Mr. Chair, we're about 2 minutes away from 9 a.m.
Okay.
But I believe we'll be ready to go. And also, before we start, I just wanted to commend the tech team. I know they worked hard this past week to resolve some of the technical issues we had last week. They have uploaded a new version of Granicus, which the culprit, and we're hoping that we'll put all that behind us.
Yay for the tech team.
Good job, everyone.
My comments are, let's see what happens.
Fair enough.
Fingers are crossed and toes are crossed.
We're gonna do great.
Yes, okay. I like that. Okay.
And I put in a new router, so hopefully I don't get kicked. So we'll see if that.
Oh, well, that'll do it right there. Thanks, Tina. Okay, we're going live on Facebook now.
And I'm getting comments that we are audible in Granicus, so we're still a minute away from start time, but hopefully we're cooking on all burners today.
Sam, oh, I didn't know you turned on my microphone already. Can you put up the volume a little bit from the Zoom meeting so the public here can make sure they hear what they're saying?
Yeah, we're not.
Thank you. And Carol, can you hear me? Moke?
Yeah, I can hear you.
I just want to let you know that Supervisor Brown is running a little bit behind, and he said go ahead and get going. He'll come in as soon as he can.
Thank you.
Okay, supervisors, whenever you're ready, we are ready too.
Was that my cue for 3, 2, 1, go?
Almost. Just 1, 2 to go. 3, 2, 1, go.
Moke, just wanted to make sure you were aware that we're good to go. Sam's giving me the green light.
Okay, thank you. Okay, I want to welcome everybody to our August 11th Lake County Board of Supervisors meeting. We're going to go ahead and start, as usual, with a moment of silence. Do we have any dedications today from the board? Okay, seeing none. We'll do a dedication for the over 10,000 people who have lost their lives to COVID-19. We stand for a moment of silence here in California. Supervisor Sabatier, would you please lead us in the Pledge of Allegiance?
Sure. Ready? Begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Justice for. Thank you. Give me 1 second. I apologize. Having some technical difficulties here. Okay, are there any extra items not appearing on the posted agenda today?
Mr. Chair, none have been brought to my attention.
Okay, thank you. Now we're moving on to the consent agenda. Consent agenda are usually items that are non-controversial, can move through. I do know we have a request to pull an item. Supervisor Sabatier.
Yes, I would like to pull for just clarification and discussion on item 5.8.
Excellent, thank you. We'll pull item 5.8. Are there any other items that need to be pulled from the board?
And Mr. Chair, just so you know, that is an animal control item 5.8, and it appears the animal control director is with us here in the Zoom room, so you can take that up whenever you wish.
Okay. Yeah, shouldn't take too long, hopefully. All right. Seeing no other items wanting to be pulled from the board, we'll go ahead and open up the public. If there are any items that would like to be pulled from the consent agenda from the public, anyone in the room or in the boardroom. So, Jake, can you open the room up?
Yes, I can.
Sam.
The floor is unmuted. If you'd like to make a comment, please state your first and last name.
You can't hear it?
All right, we are on consent agenda. Are there any consent agenda items that would like to be pulled from the public?
A little louder if you can.
Okay, sorry about that. If there are any more items, this is the consent agenda. Are there any items that would like to be pulled from the public?
Sorry, I wasn't talking to you, Moke. I was talking to Sam. I'm trying to get the sound in the boardroom to be a little louder.
Okay. All right, hearing none. Go ahead.
Brian Martin.
Yes, Brian.
I don't know if this changed, but item 5.18, I don't know if we got a change in. It's just going to be a request to pull it for a change of date.
Okay. All right, so we'll pull item 5.18 and for the date change, and we'll go ahead and take up those two items in just a minute. So, all right, thank you very much, Brian. We'll go ahead and close the room and bring it back to the board. Are there anyone, I'll ask Supervisor Bruno, Sabatier, is there anyone in the boardroom that would like to pull a consent agenda item?
It does not appear that anybody is looking to pull a consent agenda item in the room.
Okay, thank you. We'll go and bring it back to the board for action.
Mr. Chair?
Sure.
Yes, go ahead, Supervisor Bruno.
Chair, I'd like to move to approve the consent agenda 5.1 through 5.7, 5.9 through 5.16, 5.17, and 5.19.
Second.
Okay. Motion and a second. Johanna, can you please do the roll call vote?
Supervisor Sabatier.
Aye.
Supervisor Crandall.
Aye.
Supervisor Scott.
Aye.
I don't think Supervisor Brown's there yet. Is that right? Oh wait, he is. Supervisor Brown.
Aye.
And Supervisor Simon.
Yes.
Thank you.
Okay, thank you very much. We're going to go ahead and address those two consent agenda items that were pulled. We're going to go ahead and go with item 5.8. I will go ahead and read that at this point. 5.8 is a budget transfer and purchase of a new asset in the amount of $2,450 to purchase a pickup truck and authorize the chair to sign. Supervisor Sabatier? JT.
Thank you very much. So I've spoken with Director Armis about this, and I just had a couple of points of clarification that I needed to make, and because I needed them, I felt maybe the public might need them as well. On the memo, it states that we're buying a new asset in the amount of $2,450. I was first wondering if maybe there was a zero that was missing from that, and it appears that we're buying that from our fleet that already exists, and so it's a used vehicle that we're passing on to LEAP. And then further on down, it said estimated cost was $5,396.93, and I was trying to clarify what the difference was in that and why that was there, and that was just an error that should not have been there. It is only $2,450 for a truck that is already owned by the county that will not be moved on over to LEAP. And unless Director Armis has more to add, I just wanted to make that clarification.
Thank you,
Okay.
Supervisors. And, yeah, no, that's pretty much the gist of what the error was.
Okay, excellent. Thank you for that clarification. Are there any questions from the board? Seeing no questions on this item from the board, we'll go ahead and open it up to the public for public comment. I don't see any hands up at this point. Jake, can you go ahead and open up the room?
Yes, I will unmute the room here. The room is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, we're on item 5.8. If there's any public comment, please do so now. Okay, hearing none, Jake, we'll go ahead and bring it back to the Board of Supervisors chambers. Supervisor Sabatier, do we have anyone that would like to make public comment on this item in the chambers?
It does not appear that anybody will be making a public comment on this item.
You sure
Okay.
you sure they're not all here for that?
We'll go ahead and bring it back to the board for action.
Mr. Chair, I move to approve the budget transfer and purchase of a new asset in the amount of $2,450 to purchase pickup truck and authorize the chair to sign.
Second.
Okay, there's a motion and a second. Please do the roll call vote.
Supervisor Sabatier,
Aye.
Supervisor Crandall,
Yes.
Supervisor Scott,
Aye.
Supervisor Brown,
Aye.
and Supervisor Simon.
Aye.
Thank you.
Okay, we're going to go ahead and move to the other item that's pulled from the consent agenda. It's item 5.18, approve long-distance travel for Sergeant Ben Moore and Detective Nate Newton to attend watch guard training in Allen, Texas for the period September 13th through September 18th, 2020, at a cost not to exceed $5,000.
What's the
We're
item?
going to go ahead and address this item.
Good morning. The only change that I have is to change the dates. After some discussions yesterday with Supervisor Sabatier and discussions with the employee, we were able to find a date that's a little bit farther out. The watch guard training has to do with the body-worn cameras and the in-car video camera system that our patrol deputies are equipped with. This training is to allow them, these two people, the training they need to repair and maintain this equipment. So the only change is to the date of travel. We were looking at a date a little bit later in the year, and it's a request to authorize the travel days from November 15th through November 20th of 2020.
Okay, are there any questions or comments from the board? Supervisor Sabatier?
Since Sheriff Martin mentioned my name, I will say I appreciate the conversation about this item, and also think that the training is absolutely necessary to make sure that we have what we need in our law enforcement toolkit to do the best job out there for our community. So appreciate that, and looking forward to approving this.
Excellent. Sheriff Martin, can you repeat those dates again? It was November 15th through...
November 20th.
Okay, thank you.
Thank you.
Okay, if there are no more questions from the board, we'll go ahead and open it up to public comment. I don't see any hands up at this point, Jake, on this item. So go ahead and open up the room, please.
All right, I'll unmute the floor here. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
One minute. First we do Zoom.
Okay, Jake. Jake, go ahead and close the room, and we will bring it back to the board chambers. Is there anyone in the board chambers that would like to make comment on item 5.18?
Yes, I believe a gentleman wants to make a comment on 5.18, or is it a
Okay.
comment on a different item? General public comment? We'll get to that, and we'll make
Okay.
sure we won't miss you. So no comment from the public on this item.
Okay, we'll go ahead and close public comment at this point and bring it back to the board for action.
Mr. Chair, I move to approve the long-distance travel for Sergeant Ben Moore and Detective Nate Newton to attend Watch Guard training in Allen, Texas for the period November 15th to November 20th, 2020, at a cost not to exceed $5,000.
Is there a second?
Second.
Supervisor Crandall seconds. Johanna, will you please do the roll call?
Yes. Supervisor Sabatier?
Aye.
Supervisor Crandall?
Yes.
Supervisor Scott? Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
Thank you, Sheriff.
Thank you.
Okay, moving right along our agenda, we're going to go ahead and go to our 6.1 item. We'll go ahead and go to public input. Public input is for items that are not appearing on the agenda, the posted agenda. So do we have any public input today? And yes, I think we do. I think we have someone in the room at this point who has filled out papers. So we're going to go ahead and go to public input at this point in the board chambers.
Sir? Yes.
Mr. Chair, we have Mike Raffinelli that wishes to speak on the November election.
Okay, go ahead, Mike.
Well, I have three.
Hold on one second.
Yes, I'm sorry.
I thought we were going to the boardroom, so we have a
Just let him,
gentleman.
so we don't have to deactivate the germs there, you know. Let him go ahead and talk while he's already up there.
He'll come back first,
We're gonna have to clean it again.
but he'll be the first one to go up.
Well, I'm saying right now, it's gonna be cleaned if somebody else is gonna come up and speak.
He'll come first.
Okay.
Oh, Mike Raffinelli is in the boardroom as well. Gotcha. Mike, is it
that's
okay if we just go ahead and start with the other gentleman first, and then we get to you? No, you are you, and he is him, and we will make sure that both of you have the chance to speak. And so I'm sorry, Mr. Chair, we will start over. Sir, if you would please like to stand up and make your public comment.
So, Mr. Chair, I don't believe this person filled out the public comment form. If we can request that he does that after he makes his statement, so that we have that for the record.
Yeah, that's what I was. Mike Raffinelli, fill out the public input form. Sir, after you announce your name, once you do your public input, if you could, as you heard, do the instructions, please get a public input form that can be gotten from the clerk's office across the hall. Thank you.
Okay, so I should come back?
When you're done, if you can go to the administration office and fill it out, that'd be
I
great.
will fill it out for sure. I just have three separate items very quickly. I want to congratulate Mr. Cantrell that he's basically taking care of the situation with Lake Pillsbury, and I want to offer any kind of a help if I can bring any. Maybe we could all go there to the meetings of this tragic situation and, show our presence. That's one thing. I think it's a ridiculous thing to consider, dismantling such an important part of our existence. The second thing I have to mention quickly, and I can hardly talk, and I cannot hardly hear as well, but I also need to say that according to what I understand and other people tell me, then there is only one recycling center in Lake County right now, and that is in the shopping center of Safeway and other stores in Clear Lake. Now, the people apparently had to wait for several hours to be able to give or sell or whatever you want to call it, the various volumes of recycled materials. Well, at least I thought if there isn't going to be any potential for bring about another center somewhere where we used to have numbers of them, at least perhaps somehow the board could ask the people who operate this recycling center, they would issue let's say a time when person can be, when person can do the recycling. They can go shopping in the meantime, because there are lines of people and some of them wait 3 hours to get rid of a bag of cans. So I just wanted to bring that to you. The third and most important part is that I want you to understand that we are fully supportive of your attempt to keep the Lake County sane as far as the so-called coronavirus situation, which is to me non-existent, because it's never taken into details, never shown any sort of a proof of any kind of a problem of that sort. And it's been on for months, and I have stack of various news from all over the world where people realize everywhere that this is artificially creating crisis. And I think we should all, resist this kind of attack on.
Okay, I need to say we are going to be going into that is on the agenda today. A matter of fact, it's going to be the next item that we do.
If you want to speak on public comment during the item of COVID-19, then you can go ahead and express yourself on that specific item. Public comment is for anything that is not on the agenda for today. And so the first two items were perfect. If you want to speak more on COVID-19, you can get back up. We will hear from Dr. Pace momentarily, and then you can go ahead and do public comment about that then.
Okay, I'm going to fill out the form, and whatever happens. Like I said, I can hardly hear what you're saying, and I can hardly talk also, so I can write you a letter perhaps. All right, thank you.
It worked, and I understood you well. I hope everyone else did too. In fact, I will ask Supervisor Crandall, isn't there a recycling center in the North Shore?
Yes, there is. There is a Robinson right for you. And
And I do know that if there is a situation where we have an individual in the public that has trouble hearing, I think that we have opportunities there to also help with that.
Yeah, I believe we've dealt with that in the past. And Sam, if Milosh comes back and he needs a hearing device, if that's possible, if that's available. Okay, thank you very much.
Okay, we'll go ahead and go to our next public input. Mike Raffanelli. Is Mike still in the room?
Yep, he's right there.
Hello, supervisors. My name is Mike Raffanelli. I live in Lower Lake. I want to talk about something a little bit premature about voting this November. I've always voted in person and always will. The last 5 years, I feel the county has really been bad on the voting process here. I would like to say also that I hope the county keps the polls open. I'm not sure if it's the state or you guys will do that, but I hope that you keep the polls open because I like to vote in person. And if you're not going to keep the polls open, I would like to say that I'm going to come here probably with 5,000 other people and walk up to the second floor and deliver them in person. And if you decide to close the courthouse for that day, to stop all the people from coming here, I will probably have to mail the ballot certified, registered with a return receipt, because I don't trust all that stuff. And even, I like to say that in the past 4 or 5 years, I tried to trace my ballot because I think we have a problem with the voting in this county. And my votes haven't been counted because I have the receipt and I call every couple of days and that my receipt never gets tallied. So I told the registrar up there for the last 2 or 3 years and nothing has been done. And so I'm telling you guys now that please keep the polls open so we can vote in person. Thank you.
Thank you, Mike.
Is there any other public comment in the room for anything not on the agenda? Okay, looks like we're done in this room for item 6.1.
Okay. Thank you very much, everyone who gave public comment this morning. We'll go ahead and go to our 6.2 item, our COVID-19 update with Dr. Pace.
Good morning, Mr. Chair. Good morning, Supervisors. Gary Pace, Public Health Officer. So for the coronavirus update today, the current caseload in Lake County, the total cases is 240, 25 active cases. Nobody's in the hospital right now that's COVID related, and we've still have had a total of 2 deaths, no recent deaths. There's been a couple small outbreaks in the community that both of them that we've been identified have been traced back to some larger social gatherings that seem to have facilitated some community spread out there. And we're also seeing some small identifications of cases in local businesses and stores, but those folks seem to be wearing masks and the businesses are being very responsible about it. So as far as we can tell, there's not been any outbreaks there or transmission to the public from the workers in the stores. The nursing facilities and the hospitals all seem to be doing well at this point in terms of transmission. So regionally, we are seeing some problems in Sonoma, Mendocino, and Napa County, although they're starting to stabilize a bit. Sonoma has had a total of 50 deaths at this point, a large number of them in the nursing facilities. Statewide, we've passed over 10,000 COVID-related deaths now in California since early March. And but we are seeing a decrease in the rate at this point and improving in hospitalization numbers and ICU numbers over the last week. There's a lot going on with the data, and we'll talk about that in a minute. Also, just in terms of numbers, the rate of increase of cases in children went up 150% last month, which is significant in terms of the discussion around opening schools. The variance numbers, we're still doing well with the variance numbers, although we have had a slight increase in the case numbers, and we have an increase in the positivity rate. It's currently at 6.5 now. We want it under 8. It's been gradually rising. I'm not as confident in this number as the other ones because this is coming from the state, and there's been some problems with the data there. So let's talk about the data. The state last week recognized that they had significant problems with some of the flow of test results going in through their electronic reporting, where they had 300,000 reports that were not, that kind of got caught in a bottleneck. When they realized it, they started kind of scrambling to fix it, and that has now been resolved, they feel. And so hundreds of thousands of results now kind of poured into the different health departments. In the process, the head of the state public health department resigned over the weekend. So not clear exactly what happened there, but they now have some other folks in that role. So in terms of what that's done for us, I think for the most part, that hasn't really affected our numbers. The vast majority of the test results we get right away from either the labs or the local partners that are doing the testing. And we tend to use the state lab electronic feed as a backup to kind of confirm. And the hospitalizations and things like that are all easily tracked by us. We're a small county, and we do a lot of the nurses basically contact every single person who tests positive and has a conversation with them. We did see there were maybe a few delayed results that got caught in that process, depending on which lab they came in from, but the vast majority of the results we were tracking. And so I think our data still remains good and valid. So in terms of testing, the turnaround time is still a problem with Quest. There's a lot of effort going into trying to fix that, and we'll see if that really works. But there are some other options now. The LabCorp is offering a mail-in possibility. So for people that want to get tested, they can go on the LabCorp site and request a sampling kit. They'll mail it to them. They can go ahead and self-sample. They have to FedEx it out, and the turnaround time seems to be about 3 days. Insurance pays for it. So that's a quicker turnaround time, something that can be done. People can do at home. There's not the middleman between them. We're also working kind of on the county about exploring other options and even getting machines that do rapid turnaround or other contracts with some of the commercial labs. The problems with these machines is the demand is so high now around the country that supply chain problems and is a big deal. And so it's not guaranteed that even if we cough up the tens of thousands of dollars for a machine, that the supply chain is going to be adequate. Contact tracing, we are continuing to keep up with the contact tracing. We have help from the state with a couple of tracers that are there. We have some help from some of the other departments and also some help from the community. So that's been very good. The housing and homelessness part, we have a juvenile hall is housing. I think it's about 20 folks there now that are in the Elijah House project. And we're also working with some of the local hotels to house some people in the community that need to isolate and can't isolate well at home. And also, Pastor Shannon is applying for some grants for to continue to expand the homeless services for the community, which is a good thing. In terms of the hospitals, the capacity is good. We don't have any people that are COVID related in the hospital right now. Surge planning is good. The state is really encouraging us to get quite active in terms of surge planning for the fall, because once the flu season starts, and the hospitals are usually pretty impacted then anyway, the combination of the COVID and the flu could be pretty overwhelming. So, but again, the hospitals are doing a good job with that. For the fires, there's been quite a bit of work over the last couple of weeks in terms of planning for evacuation shelters. A tabletop was done yesterday where we basically walked through what a scenario would be like, so that we could kind of work out some of the details. The OES in the Sheriff's Department, Department of Social Services, the Red Cross, Animal Control are all involved in this and trying to make plans for how to shelter during fire and the need for evacuation. The idea is that because of COVID, we're needing to put more distancing between people in the shelters, and so it's decreasing our capacity quite a bit. The sheriff's team put together a really good information video on this, and gives a lot of very clear information, so I really encourage people to look it up on the sheriff's page, or it's on the health department page as well. In terms of the community and the businesses, we're continuing to try to message to do everything possible to keep us off the watch list, so that we are able to keep the local control and keep the businesses open as much as possible. The watch list is a little bit on hold right now because of all the data problems, but again, we are not qualifying to go on it at this point, so we just continue to try to do the things we can to prevent things from getting out of control. I think because of the size of our county and the size of our medical response, I really am putting a lot of effort into the prevention, to keeping things under control, because if they do start escalating, I think it could be hard to manage fairly quickly. So we are trying to put the steps into place, but that's really the thinking is that we are staying under the threshold. We want to do everything we can, because once it starts rising, I think we would go on the watch list pretty quickly. The spread that we're seeing in the community is really mainly around kind of isolated cases that have a contact point with a previously confirmed case, or these social gatherings that are happening, or funerals, things like that. So it's strongly encouraged people to avoid gatherings with people outside of your household, and if you do go, to keep distance and wear masks. The businesses are working hard to try to keep people safe, as far as I can tell, and I have a lot of contact pretty much on a daily basis with businesses that are concerned about an employee that may have been infected. What should they do? How do they walk through this process? And we really appreciate the cooperation and the collaboration with the business community. The compliance question continues to be kind of on the table. There's the ordinance that's going to be discussed later on today. Sonoma County did join the rest of the neighboring counties now in putting citation ability and kind of compliance issues. And, I think really from the public health point of view, our numbers are good right now and we're doing well. But if things start getting out of control, or if we start seeing people relax more and more, to be able to go in and break up some of these large gatherings, or to be able to go in when there's a business that's not really interested in following things along, it would be extremely helpful and allow us to do everything we could to keep things under control. Right now, we work really hard with education. We have a team that goes out and talks with people. I often will talk with people, and then it can go up to the supervisor level, where the supervisor may go out and talk to somebody if it's in their district. But to be able to have some other steps in there some other tools that we could use if needed, would be helpful. There's no real interest in making money off of this, or doing citations, or shutting down any businesses. That's not at all the interest. The interest is in really working on helping the public do the right thing and comply, so that we can keep people safe and keep off the watch list. So I think that's it right now. Thank you.
Okay, thank you, Dr. Pace. Supervisors, any questions or comments? Supervisor Sabatier?
Yeah, thank you for that update. Quick question for you. LabCorp, you said that the insurance can cover that. I know in some of the original conversations where LabCorp was brought up, that it can be free if you don't have health insurance. Is that correct as well? And also, for those who do have insurance, do they have to pay up front and then get paid back? Just trying to figure out what the process would be, so that we're all a bit more aware of how that process works.
Well, so we just found out about this about a week ago. Several people have sent samples through and gotten good turnaround times. It's been very easy, and as far as I know, they just put their insurance down and on the application, and that was that. The way I understand the uninsured part, it is supposed to be covered. I think the state is basically coming behind and covering that. So I'm not aware of anybody having to pay up front.
Okay, no, that's all good. And then I want to talk a little bit about the numbers. 6.5% is the number that you gave us today. And I'm wondering if there's an updated number at the state level that you're seeing that from, because I'm looking at our hub, and our hub says 4.6%, and that was the update from about noon yesterday. And so is that as of this morning, it's 6.5 as of yesterday, and the numbers just don't jive because the state is still in a confused state at this moment? Just kind of curious as to where that number is coming from at this point.
Yeah, that was the one I got hot off the press this morning, so she must have got it off the state website.
Okay.
Let me see, make sure I get that right. Yeah, I'm pretty sure that was basically that'll probably go up today. So, but that's the testing positivity on the state website from this morning, 6.5. It was 5.8 yesterday, 4.6 before. So we are seeing a rise over the last couple of days. Again, out of all the data that we have, that's the one I'm least comfortable with, because probably what's happening is there's some backlog that's influencing that. And so, I think we should just take that with a grain of salt right now.
And I can appreciate that, but at the same time, I have my concerns, since that's one of the major numbers that we're looking at as the state eventually will go back to looking at placing folks on the watch list or taking them off the watch list. I think it's important, and I think it should be simple. And granted, I'm not feet on the ground, so I don't know the exact steps, but we know what the numerator is. The numerator is correct. It's all about the denominator. And I know last week we spoke about, do the hospitals provide these numbers to us as far as all the tests that they've done? And the answer was no, that we might eventually get them, but we don't get them up front, which kind of skews what our positivity rate is. And I think that we need to be in a self-sufficient situation where we're not relying on the state to provide us the information about what's happening to us. I think we should have that information of what's happening to us. I know I spoke with at least Adventist Health, and I'm willing to speak with all of the other major healthcare systems in the area. They have zero problems in submitting to us a daily report of how many tests have been done, and we can probably set up a criteria to say, just give us a number of those that are residents of Lake County, not just every test that you've done. And I'm sure that they can provide that for us. They seem very willing and able to do so. And since it's just and again, I'm simplifying the process. We're looking at Tribal Health, we're looking at Sutter, we're looking at Adventist. That would just be three numbers that we would receive and have to add together. And I just don't see that as being a overburdening situation where now we're in control of knowing what our numbers are, because I want to be able to trust those numbers and not say we take it with a grain of salt when it's what's being used to drive our conversations. So I would like to see that changed. And again, please educate me on the process if it's a lot more arduous than I think it is. But I think it's the best place we can be is where we know what's going on with us, not sending out information to the state and then waiting for the state to tell us what's going on with us. Just my preference.
Okay, we'll get on it.
And I would say, please ask the other supervisors. I'm not unilaterally trying to tell you what to do.
Supervisor Brown?
No, I agree with that. I think we need all the information. All the information, if we're going to get it positive, we should get all the negative too. I want to make sure that we are accessing all of the negative results that are gathered by other entities, the hospitals, the tribes, or tribal health, and even out of county hospitals that test our residents and then send back the results if they're positive. But I want to make sure that we're getting to the best of our ability, getting the negative results as well. Are you assured that that's going on, Dr. Pace?
We are getting the data. The state is in a terrible snafu right now with all this, and we are getting the data. It comes in. There's a time delay. We are, our people are scrambling to keep on top of this stuff, and we are following. The most important thing really from the public health point of view is following the positives and tracking them and isolating the folks so that they don't spread it further out. The positivity rate, Supervisor Sabatier is absolutely correct that that's the kind of the first one to rise as a indicator of what we may see an increase in cases, we may see an increase in hospitalizations down the road. That number, the state is going to make any decisions based on their number, not our number. But by getting our numbers, we can keep ahead of it. We would have some warning. That's been part of the process here. That's why we really tried to get the epidemiologist involved to help us do this stuff. And she's just getting her feet on the ground right now and sorting through this because we can only afford her for a short period of time each week. We do get all the negatives. There's some delays. And with this last thing with the state, it's been a terrible delay. And, but I think in terms of, again, I think what Supervisor Sabatier's point is that we need to work harder to get the data and have local control of it. And it seems like what Supervisor Brown's point is that we may be undercounting the negatives and so overestimating the positives. I assume that's what you're kind of intimating there. And, ultimately the data does all come together and it's been consistent and coherent all the way along. There may be lag times and there may be blips that don't quite make sense, but overall we've seen a pretty consistent story here. And now this last rise in the positivity remains to be seen what exactly that means, because on the ground we're seeing things seem pretty much the same. There are definitely instances of these sort of community gatherings where there is spread, and that if one or two of those explode, we're going to have some problems then. So, I guess that's, I hear you. We work on it. We're going to get the epidemiologist. She had to leave. She was on until 9:30. She could help us answer some of these questions, but I understand what you're both driving at.
Well, and I don't mean to intimate, because I like to just say what I'm saying, and that's what I'm saying. I want to make sure that we're getting all the data where, the rise in positive rate is a reflection of all of the tests, not just the positive tests. And we need to know. We're making some big decisions here at the local level, and we need that information locally. And I'll be very honest with you. I'm not going to intimate this. I'm just going to say it. I don't trust the information from the state. I don't trust their agenda. We already know that the death rate is a lie, and it's a lie because we say things and we allow things to be said like COVID related. We don't say COVID caused, and if you listen really close to these, there's a reason for that. The COVID caused deaths are far lower than the death rates that are being reported. If somebody dies from a gunshot wound and tests positive for COVID, they're put in the COVID related category. If they die in a car wreck, if they die from a number of other diseases, which has been the case over and over again, including the two here in Lake County, they didn't die from COVID. They died from something else and may have tested positive for COVID. So I don't apologize for it. I don't trust the state's information, and I don't trust their agenda.
Okay, thank you, Supervisor Brown. Supervisor Crandall?
Yes, Dr. Pace, I just wanted to cover something about contact tracing. Recently, I know that you've been working with us on the North Shore about a situation, and there's some confusion at different agencies or businesses or whatever the case may be about contact tracing. So, for example, let's say that I am at a function and I'm directly exposed. Then there's secondary contact, who gets tested, and so those things are confusing for different businesses to understand. Well, how should I close down? How should I get it cleaned? Or things like that. Who should I have tested? Should I close and have everybody tested, or should I? So those things are kind of up in the air. So I just wanted to maybe get a simple dialogue about that, just briefly, if you will.
Sure. Yeah, thanks for asking, because I know now that we're having more and more cases that people are having to deal with this kind of situation all the time. So one thing is we do have a thing on our website that outlines this a little bit. But it always sounds a lot simpler on paper than it is in real life when you're trying to sort through these things. Basically, the deal is if somebody tests positive, then they're considered a confirmed case. and they need to be off work for 10 days from the beginning of their symptoms. And so they need to be home, isolated, not in contact with people that aren't sick. So for 10 days from the beginning of the symptoms. That's pretty straightforward, and most businesses are straight up about that. If somebody's a close contact to the case, which means within 6 feet for 15 minutes or more without a mask, those are kind of the specific criteria. If they're in close contact with a confirmed case, it's recommended that they quarantine for 14 days. So they stay home, go off work for 14 days. There are some, we can negotiate that a little bit, but if you want to do the right thing and you're able to do that, that's the recommendation for 14 days quarantine. If the contact is less than that period of time, or if they're wearing masks, or if you're passing somebody in the store, or if it's somebody that you work near but you're not really in that close contact with, the risk of infection is less, and so you just kind of have to weigh it out, how much you're willing to risk the person exposing other people, how well they are at taking the precautions and all that. So it's and then the testing question, even if you test somebody that's on the quarantine, on the 14-day quarantine, say at day 5 from the exposure, you get a negative test. It's still recommended that they stay on quarantine for the whole 14 days because of the time lag that the virus can turn positive. They can test negative at day 5, and at day 10 they can turn positive. So the recommendation is for 14 days. Then a lot of the question comes up, what about a contact to somebody who's a close contact to a confirmed case? So what you're calling a second degree contact. Those folks, they certainly can turn positive, because if the contact turns positive and then they turn positive, but the risk is considered low enough that, we're basically not recommending those people stay off of work. We're recommending that they wear a mask and do the precautions, but that it's not essential that they stay home. So that's kind of the steps that we are recommending, and that's based on the CDC.
Thank you for that. Yeah, I just wanted to get that out there, and then also, I don't know if it's quelling fear or whatever the case may be, but so for example, someone does test positive for COVID, they go home, they stay for 2 weeks, 3 weeks, or whatever, then they come back to work. Ooh. So I think that's another question, and I think we've probably covered this, but I like kind of reiterating sometimes to the public, how susceptible is anyone else to that person from there forward after they've recovered? Is it just like anything else, they're better now, or is there possibilities? Do they know that yet? Has there anything been proven on that yet?
So yeah, that's an important question too. So basically, after the 10 days, or after the 10 days of isolation, when somebody was positive, they are considered non-infectious, not contagious. There are a few very rare exceptions, extreme immunocompromised people that are pretty specific, and most of those people aren't in a position to be working anyhow because they're too sick. So for the vast majority of people, 10 days is considered the time. After that time, they're not considered positive. Sometimes they've tested these folks and they still test positive, but they've tried to grow the virus and the virus won't grow. So the thinking is this is dead virus at this point. And during the 10 days, it's probably really more like a week, but kind of 10 days is playing it safe, that people can still be contagious, but after that point, even if they do test positive, that's considered dead virus. And so we're not testing people to get off of isolation anymore. And the current thinking is, as best we can tell, there's not been a confirmed case of having a second infection, but we're not even retesting people for at least 3 months after their first test. After that, after 3 months, if somebody gets sick again, it may be worth testing again. We don't really know, but at this point, it's really not recommended to even retest anybody at 3 months after their first positive test.
Thank you, Dr. Pace. And I'll just mention one more thing for the public, and I think you can confirm with me. And I think we can get this information probably from the other two hospitals and possibly other clinics. But I know with tribal health, with our current situation, we were asking who can go and get tested. And of course, tribal health serves the Native American population, the Native Americans. And then they also serve folks that are actual clients of the clinic. And if you have partnership, you're able to go and register and be part of that as well. And so those are steps for actual ways to get the test. And one of the main things to state is of course, for asymptomatic exposure is another way to kind of get things a little further moved along the line. So I just wanted to kind of announce that. I know things might change once they get those other testing capabilities. Hoping we can get some more headway on the other two hospitals or clinics to have more availability. But just wanted to mention that. Thank you.
Thank you, Supervisor Crandall. Supervisor Sabatier?
Yeah, I just wanted to mention something, and I appreciate that Dr. Pace has been really consistent on saying the 14 days is really the recommended, and I guess I want to ask if there's an update on inmates being sent back home early from their sentences, because one of my issues that I have from being on the phone calls with the state is they're only doing a 7-day quarantine before they're released out to the county, and it makes no sense to me that the CDC guidelines, what we're following, what everybody talks about is 14 days, but when it comes to our incarcerated folks being released, even if they test positive, they're only doing the 7 days, and I just have issues with that, and just kind of looking to see if there's any updates on what's the number that we've received. Are we still having some in isolation? Just looking for some details on that.
Yeah, the whole state prison release is a fairly big deal. I think they're releasing something like 8,000 people by the end of this month, and early. And so,
and if I may correct you, that's not 8,000 from today till the end of the month. That's 8,000 total since they've started releasing. Correct?
Yeah, correct. Yeah.
Yeah.
And so we've had, I don't know, couple dozen people maybe in the county. I'm not sure exactly the number right now. And what the communication has been a little bit problematic with the state. We've been working with our local state parole folks and our local county parole and the law enforcement here to try to coordinate this. Basically what we do is when we get word that we check against whatever facility they were in, find out when their testing was, what their exposure history was, and whether they need to be on isolation or quarantine. The initial state plan was that they were going to keep everybody until they completed any isolation or quarantine issues and then release them back to the county. But they haven't been all that great about that. And so we've been housing some of the people in our one of our programs that helps people isolate that aren't in the community. So we've had a few people that we've been doing that with, and then there's been other people that have been able to isolate at home, and then there's other folks that have completed their isolation and quarantine and are able to go out in the community. So it's been a kind of a high effort to try to keep everybody safe and to try to make it work.
And I appreciate the work that you've been doing with our probation and law enforcement to make sure that we process these things properly. But I do question the state, not their motives, but sometimes it feels like it could be a financial issue because, hey, if you're in jail, you have to pay for their medical care. And so it's cheaper to release them versus having to deal with it. And I just think that we could have done this a whole better way, but do appreciate the efforts that were made here locally.
Okay, any more questions at this time from the board? For Dr. Pace. Okay, seeing none, we're going to go ahead and go to public comment. We are going to start in the Zoom room, and then we'll come back to the board chambers. So we're going to go ahead and go to, I see we have 2 hands up at this point. Jake, can we go through the list of hands up?
Yes, I will start. The first hand we have up here is from Melissa Fulton. Melissa, I've sent you an unmute request.
Can you hear us, Melissa?
Melissa, I've sent you another mute request here. Are you there? Should we move to the next person?
Yeah, let's go and go to the next one.
Okay. All right. The second hand we have up here is from Daryl. Daryl, I've sent you an unmute request. Looks like you're unmuted. Will you please confirm your first and last name?
Daryl Davis.
Thank you. We could hear you.
Marco Daryl.
I just have
Go ahead, Daryl.
I'm sorry. I have a couple questions. Nobody will give me a straight answer on this pandemic, as we call it. We have presently 25 approximately cases live in Lake County out of 60,000 people. Mind you, I'm just a high school graduate, but that makes 0.05%, yet we're calling that a pandemic and closing down businesses and making life rough on people. 240 something cases in the entire county over the last 4 months comes out to 0.41%. So I just want to ask, how is it you guys consider this an emergency pandemic? We have 2 deaths, neither of which were caused by COVID, but the people had COVID at one time. Any answers, please?
Well, at this point, I don't know if you want to answer those questions, Dr. Pace.
Well, sure. The way I would answer that is we're working really hard to try to stop this from spreading. So, when you do something to prevent something, you don't necessarily, it's hard to see what the results are. And, if you look at other counties around the state, if you look at other places around the country, they're having big impact. There's 160,000 deaths or something over the country. And you may challenge that they're not COVID caused, but that's not what the doctors that are taking care of them feel often. And so it's, and what we do, so what we're doing is going out when somebody tests positive, we're working hard to help them isolate so that it doesn't spread through the community. If you look at other places around, it's a lot higher. So to me, that's a success of some of the efforts that we're doing. You may see it as showing that it's not really a problem, but the only way to know that would be is if we back everything off and then let the hospitals get overwhelmed. That doesn't sound like a good plan to me.
In reality, when it was backed off originally, the hospitals never did get overwhelmed. So it kind of seems like you're being overly cautious and foolish at other people's expense. You're trying to shut down churches, but yet you're allowing people to go into grocery stores, to be close together. There's no rhyme or reason to what you're doing. It's like back and forth. All the information is half of which is correct, half is not. I just don't understand why you're making such a big deal of trying to ruin people's life. So many business I see around me. I'm a small businessman. I've stayed open. I think the mask thing is stupid. When this whole thing started, we didn't wear masks and the cases were no more than they are now. The only difference was that now we're testing, then we weren't. I personally think I had it in February. I had a horrible flu. I had all the symptoms. I stayed home, got over it, came back to work. I'm sad that you guys are just playing follow the leader rather than being leaders.
So
thank you, Darren.
I have a question following.
Supervisor Brown.
So something Dr. Pace said, I felt like this may have been directed at something I said, so I want to clarify it about the deaths and that the doctors that are treating them don't agree. Well, that's not true. The government doctors don't agree, but the private doctors that are actually seeing patients the ones here locally that I've talked to do agree. So I just want to make it clear that there's a subset of doctors, and that's the reason they invented the second opinion, because not all doctors agree on stuff. But I have spoken with doctors that actually see patients, and they agree that all of the deaths that are occurring are not as a result of COVID. Yet all of the government doctors who rely on a paycheck to say the right thing and the politics of it do pretty much agree that this is all a big emergency, that we need to shut everything down. So there's a disagreement there, and I just want to make sure that's clear, because I felt that was a response to something I had said, and I want to make sure I respond to that. So. And that's the other thing too. There was a comment that there's no money to be made, and I was going to bring this up at the next conversation that we have regarding the ordinance. But there actually is money to be made. It wasn't stated this morning, but the doctor has stated it in the past. Others have stated it in the past that if we don't toe the line and mind the governor, then he's going to take money away from us. So this has been about money. A large percentage of the decisions made have absolutely been about money, and they continue to be.
All right, thank you, Supervisor Brown. We have the next hand up. Let's go to Jake. Go ahead.
Yes, the next hand we have up is Melissa Bolton. Melissa, I've sent you an unmute request. All right, looks like you're muted. Please confirm your first and last name.
Yes, Melissa Fulton, CEO of the Lake County Chamber of Commerce. In reference to Dr. Pace's comments and all of the other input, we have been working with Community Development Services for about 2 weeks now, maybe only 10 days, on a project to distribute to all businesses in Lake County the sum total of 142,300 masks and 8,100 bottles of hand sanitizer. Those bottles are 16.9 ounces each. Andy Lucas of CDS has been running around. In fact, he was just here a moment ago delivering more masks to us. They are being picked up by businesses, and the distribution locations are all around the county. If anyone's interested, they can call CDS at 279-1540 and talk to Andy Lucas or anyone there who answers the phone, or they can call our chamber at 263-5092 to obtain free masks and hand sanitizers. These are for businesses all around the county. And again, Andy has made sure that there are supplies in every community, almost every community of Lake County. I know that the Clear Lake Chamber has them. They are at both city halls. They're in Middletown. So this is very much a community participating event, if you will, and we encourage all businesses who are listening to this meeting today to contact us to get their free masks, not just for their employees, but also if they are a retail location, they can get masks to hand out to their customers who might come in and not have a mask on. So CDS was contacted by the state, and the state is furnishing these masks. So please spread the word. They are available free, and the Lake County Chamber is very pleased to be a part of this move to help get masks out throughout the county. And thank you, Dr. Pace, for all you're doing. I appreciated some of the information you gave today. That is to say, the context in which you gave it, in terms of, we know that there are businesses who are being accused of not adhering to safe practices. And according to your statement this morning, it does not appear that businesses at this point have been a source of spreading the virus. So thank you again. I know you and your staff are working very, very hard. So we do appreciate it. And we know you're taking a beating every single day from people who don't see all of the work that's being done and appreciate everything that is being done. So thank you very much.
Thank you, Melissa.
Yeah, I think that's a really good project, and I'll say because in meeting with some of the businesses on the North Shore and all around, they really would like to have access to masks and PPE. And so for Andy to be doing this is really a big deal. It really helps, I think, because they're trying the best that they can, and looking through going and talking with them. They can't force people to do certain things, and it's frustrating when people are told to go back to their own country because they own a business or things like that. So just anything that can help eliminate that conflict or that confrontation is a good thing. So.
Thank you, Jake. Go ahead. Jake, can you let Melissa speak one more time here, or unmute her again?
Thank you. There are masks available on the North Shore at Aurora RV Park and Lakeview Market in Lucerne, and there's some other locations. Unfortunately, I don't have the list in front of me right now, but trust me, no matter what community you are in or those businesses are in Lake County, the masks are not that far away.
Thank you, Melissa. Okay, Jake, let's go to the next comment.
All right, the next hand we have up here is from iPhone. iPhone, I sent you an unmute request. All right, looks like you're unmuted. Will you please confirm your first and last name for us?
This is Kathy Toy.
Thank you, we can hear you.
Thank you. Yes, I have a grave concern about some of the comments that are being bantied about here about whether or not deaths are actually, the deaths that have occurred here in Lake County and around the state are COVID deaths. And I would like Dr. Pace, if he could, to clear up the issue about COVID related. The verbiage, I think, is perhaps not well understood. So if Dr. Pace, if you could clear that up for us, I think that would be really important. I think it's very difficult for the public to hear comments such as the ones said by Supervisor Brown, saying them as if they, we have to know the truth. We have to know the truth of the matter, scientific proof and truth, not just something that's said out there without anything to back it up. So if Dr. Pace, you could give us some information about that verbiage, COVID related, whether the deaths here are in fact COVID related dates, I would really appreciate that.
Go ahead, Dr. Pace.
Okay. Well, yeah. So I won't talk about the specific cases, of course, but the way this works is I don't make a determination. That's not, it's not a government doctor that's making the determination. The doctors that take care of the person are the ones who make the call. The kind of ambiguity about it is that basically if somebody comes in and tests positive for COVID and passes away, we'll never know if that's absolutely what caused it. But the way this works is if they are positive for COVID and they die and the clinical course is such that it is consistent with having the infection and the infection causing the death, then usually the doctor's going to say that it's a COVID-related death. And if it's a car accident, I'm not aware of any car accidents or those kind of things where somebody tests positive and there's a I don't know that, but what the more typical scenario is somebody comes into the hospital, they're sick, and they die, and they're COVID positive, and it looks like other COVID-related deaths, usually respiratory distress and kind of declining respiratory status, or heart problems, stroke kind of things because of the hypercoagulability from the illness. So, but the only way to know for sure is by an autopsy, where they go back and they kind of determine what the actual cause of death is, and that's not typically done. If somebody's COVID positive and the clinical course is such that, and there's no other clear reason to think that, then it would be considered a COVID-related death. So, I think there's some, yeah. So that's the situation.
So the important thing here, what I'm hearing, you're saying if someone dies and there's a clinical course, they've come in, there's respiratory distress, they're showing all the signs of COVID-19, and they do in fact die, that it is likely, and they've tested positive, is likely that they will say they died of a COVID-related death. In other words, it's like, as an example, if someone is shot and they die, they don't, that it's probably going to say that they died of bleeding out or a cardiac arrest or something. They don't necessarily say died of a gunshot wound. So I think that the verbiage here is what is perhaps confusing some people or is not clear to some people. But I thank you for clearing that up. The clinical course is what usually determines whether someone has been declared died of a COVID-related death. And I appreciate that. Thank you for your work, Dr. Pace.
Okay, thank you. Okay, Jake, let's go to our next hand up.
All right, the next hand we have up raised here is from Paul Markin. Marchand. Paul, I sent you an unmute request. All right, looks like you're muted. Will you please confirm your first and last name?
My name is Paul Marchand. I'm actually a practicing emergency physician. I do not practice in Lake County. I contract my services to other counties in California, but I have 36 years of experience. And as a consequence of what was just discussed today, I'll also just sort of add my voice to agree with our county health officer in saying that when I pronounce someone dead in the emergency room, there are two causes of death that are legally allowed in the state of California. One is decapitation, the other one is cardiovascular collapse. And I frequently will write died of cardiovascular collapse. However, if clinically there's space in the death certificate for mitigating circumstances, and certainly if the patient is dying of COVID, that's frequently something that I would put down. And we all know that underlying disease is a risk factor for mortality and COVID infections. And so really what you're saying is essentially that people will die of cardiovascular collapse, and they will die associated with whatever underlying disease they have.
Thank you.
So that's where the ambiguity is coming from. And I'm not sure that it's all politically motivated. I don't believe that the medical community is that unethical to try and back any political agendas. And so I'm going to say that the figures are probably not 100% adequate, because we don't do postmortems on every single patient who dies. And the causes of death are fairly obvious, and you're not going to come up with any change in the way you do things. So my tendency is to agree with the figures that are presented to me, although, quite honestly, I agree with supervisors in saying that we should be establishing our own level of certainty within our own county, because these are our county laws. And ultimately, I agree completely with the plan of doing that. And so appropriate data coming from our county with the cooperation of the local health authorities and local hospitals is something I strongly support. And really, that's all I have to say.
Looks like there are two. Supervisor Sabatier?
Yeah, I just want to make sure people realize that this is not an absolute situation. Just because somebody died of COVID doesn't mean 100% it's just COVID or it's not. Like there's underlying conditions. It's just the same thing with businesses. If they failed, yeah, it could be because they were shut down and they had issues with their finances. But others were struggling before COVID-19 and it was the final nail on the coffin. Same deal with here. And if we think we're faking the deaths, why are we only at 2? It's tragic to have any death, especially if that's within your family circle or your circle of friends. That affects you as an individual a whole lot. But the fact is, we do not have numbers that, in my opinion, show like we're inflating anything. We're at 240 as of yesterday with 2 deaths. If we were trying to fake the funk, we would be at 1,000 with 100 deaths. I just think that we're nitpicking on something that is not newsworthy at this moment in time. I think we need to make sure we have the right data, yes, but we also can't say that something is a lie when we don't have the information about it. And no doctor is everywhere in the state studying all of these death certificates and is in the room with these patients to know what's happening. There needs to be a certain level of trust, but we also need to make sure we have our own personal data here in the county in order to do so. We can't say one thing for one and then another for something else. The same thing that happens to people with underlying issues is the same thing that's happening to our businesses with underlying issues. But what I hear is COVID-19 is killing our businesses, but by the way, it's not because of COVID-19 that these people died. We can't talk both sides of our necks. We got to figure out how to be logical in what we're saying. And that's it. I just think that we're nitpicking on something that I just don't think is a big issue, at least in our county. If we were talking about much larger numbers, LA, then maybe we need to discuss it. I don't know. But right here in this county, I just don't see it as a problem.
Thank you, Supervisor Sabatier. Supervisor Brown?
So I don't think it's nitpicking. We're making decisions based on the state and federal. There's never a distinction between we only have 2 COVID-related deaths. And I'm going to go back to that for just a second. Listen to the language, COVID-related, COVID caused. They're not saying COVID caused, but they say COVID-related. Then it gets into, we're doing a moment of silence for 150,000 COVID deaths. Well, how many of those are COVID-related, not COVID caused? And I hear what the doctor is saying, Dr. Marchant, who I've been friends with him for many years. And, but I also know that we're not nitpicking. This is a real thing. And the reason I know that it's a real thing for COVID, and this is the flavor of the month or the year or whatever, is back when, well, I'll just say it right now. If the person died from something and they tested positive for AIDS, they wouldn't say it was an AIDS-related death. They're saying COVID-related because that's what the flavor is. That's where all the government money's coming from. That's what the big fear is. We're interviewing the doctors. Nobody's talking to the doctors that I've spoken to over the last 3 months that I've been dealing with a few things. No one's talking to those doctors. They're talking to the one doctor on CNN that is willing to say, yes, by God, we need to shut everything down. That's what we're talking to. So I don't think it's nitpicking. I think it's an accurate portrayal of what's really going on in our nation right now. And it comes back down to us. We need to get back down to where we have control over the numbers that we have, that we can show an active reflection, an accurate reflection, and an active portrayal of what's really going on here in Lake County, instead of extrapolating what's going on in the state and the nation and bringing it back to Lake County, because it's not real. It's not real as it relates to what's going on in Lake County. Lake County, we're doing pretty well, and I don't care who gets the credit. We can get credit for the shelter, give credit for the shelter in place. We can give credit for all of these harsh, non-enforceable ordinances that we've had over and over again. Or we can give credit to people who were washing their hands even before COVID was a thing. So that's who I chose to give credit to. So it is not nitpicking. It is a real thing, and we're making a real thing out of it, and it shouldn't be.
All right. let's go ahead and go on with the next hand up here.
All right, the next hand, I'm sorry?
Go ahead, Jake.
Okay, the next hand up we have up is from Johnny. Johnny, I've sent you an unmute request. It looks like you're unmuted. Will you please confirm your first and last name?
Johnny Garcia. Just a question for Dr. Pace. Yeah, where exactly are you getting the numbers from, like the positive rate, like the 6.5? When, yeah, just like everybody else has said, Lake County is literally like 0.04 or whatever. And are you basing your recommendations off the state level or the county level? I think that's where the big issue is. I think Lake County would rather you base your recommendations off the county numbers, not the state numbers. Why are we so worried about every other county and not just our county? I think that's the big issue right there. And yeah, with the COVID deaths, you basically said it's not 100%, that it is strictly COVID. So it just gets people worked up, mad at the county, mad that ordinances are trying to be pushed off you basing your recommendations from a state level. And if I remember, I think the CDC just came out saying that the positive rate isn't as high as everybody's saying. Why aren't we going off what the CDC is saying? Why is it strictly just off a state level? That's it.
Go ahead, Dr. Pace.
Thanks. Yeah, well, thanks for that. It's so basically, maybe I've been not clear. So the numbers that we are using are the positive rate, which is done locally. We get those directly in. We contact every one of those people. As far as I know, we've been in touch with and talked with them and gotten their story and figured out who we've been in touch with. So that's a direct. So the number of cases, that 250 or whatever the number is right now, the 240 is direct from us. The number of hospitalizations is from contact with the hospitals on a regular basis. The number of deaths is from, following that closely locally. So all those are very local. The positivity rate was the one that seems to be getting people's attention here. And I said in the beginning that I didn't really trust that number right now. And I felt like there was a problem with that number. And we've got people that are going to stop what they're doing and go calculate it now to try to get it. But we're not basing any decisions on that number. Supervisor Sabate was the one who was raising the questions about that and said we really needed to look at it. I think the issue around making decisions, we are aligned with the state's orders. Right now, the state is ordering 97% of the state's population to be on a higher level of restriction than we are. We are now we're a very small percentage of the state that's still able to have haircuts and, go into certain businesses, have your gyms and fitness centers open and those kinds of things. And, we are doing that well. And what I'm trying to recommend is that we take whatever steps we can to not go on that state list. So my main recommendation at this point is let's do what we can to allow these businesses to stay open, allow us to keep off the watch list and do everything we can to be as safe as possible. So, so that's basically what my message has been. And if that's confusing, I'm sorry about that because it's, I'm doing my best to get it out there in whatever way I can. So.
Thank you, Dr. Pace, and thank you for clarifying, everything. We are attempting to keep local control. It's been talked about here, and hopefully we can make those steps forward. Whether, folks believe it or not, local control is something we're attempting to complete, and I think every step we've taken is in that direction. So go ahead and go to Moses. I see another hand up here. Moses, I can't see the last name, Zapata or Zappa? Jake?
Yes, I sent him a mute request here. Hello. It looks like we're getting some feedback from you. Will you check your volume levels?
Okay, how about now?
There's still an echo in the background. Are you watching the meeting on Granicus by chance?
I'm watching it on Zoom.
Okay. Yeah, just check the volume level. But right now it sounds okay. Will you please confirm your first and last name for the record?
My name is Moses Zapata. I'm a Lake County resident for about 13 years. And just want to make a little comment in regards to the any changes that might come about as a result of the meeting today. Hey man, I know that your last report regarding COVID was very positive regarding our county. And I believe as far as we, the inhabitants of Lake County, know, nothing has changed, or maybe things have gotten better. I'm not sure exactly. Nothing has changed, and if it has, we really would ask you to show us scientifically or evidentially if anything has changed and how that would affect any decisions today. I'm concerned that we would have restrictions enacted that would create a problem not only for the businesses, but also for the churches of Lake County. Amen. Churches are essential to the community. We want to make sure that we are not inhibited in any way. So in regards to anything that you have to say, whether from a medical standpoint or otherwise, I believe that we have the right to know the truth and not from a perspective of fear and the emotion. We want to be safe. We do want to be safe. And we believe that by and large we are. But we need for you to show us if we're wrong in this, not by promoting fear and the fears of those who are also afraid, but by revealing to us any truth that we can see for ourselves. We do not support and expect you will vote no on any changes that inhibit our freedoms, taking away any of our rights. And I just want to make that statement. I'm a religious leader here in the county, and I just want to make sure that we are not inhibited. We have been there for the community for all these years, and we expect to continue to do so without any kind of inhibitions whatsoever. We pray that you would be with us on this, that we might continue to provide the services that the community need to grow and to prosper in every way, whether spiritually or in any other way, and especially in our businesses as well. Thank you.
Okay, Moses, thank you very much. Jake, I don't see any other hands up at this point. Can you open up the room?
Yes, I will unmute the floor here. The floor is unmuted. If you would like to make a comment, please state your first and last name.
Floor is unmuted, so if someone has a comment, go ahead. So I see D. Parker came up.
We'll get to the room.
Okay, I will unmute you here, D. Parker.
So go ahead and close the room and just go to D, Jake.
It'll be our turn when they're done with the Zoom room to come to the boardroom.
Yeah, hold on 1 second, Mo. There's some misunderstanding in our room, in the actual room, as opposed to the virtual room. When they says open up the room, it means the virtual, because otherwise if it's open, then anybody can talk. And I'm not saying this has ever happened, but somebody could actually get up and dance naked. But so they close the virtual room until it's open for that. So that's what he said. The room is open, that room, the virtual room. Then he'll come back to us.
Yeah, the virtual room's open, and as we go through the rest of the meeting, I will say we bring it back to the board chambers, and that is the room where we have physically people in the room. So that will be the next step. We're going to finish out with the virtual room here, and then we'll bring it back to the board chambers for any comments there. So that will be momentarily, hopefully. So go ahead, D.
All right, it looks like you're unmuted. Will you please confirm your first and last name? Hello, D. Parker, are you there? If you're talking, we're not picking you up. It looks like she is unmuted, but she might have a hardware mute on her side.
Okay, then if she can figure it out, we'll go ahead and bring it. Hello?
That looked like a different participant, sorry.
Okay, all right. So the room is closed, we'll bring it back to we'll go ahead and we will go ahead, if she can get through, we'll let her speak after the next one, but we'll go ahead and close up the virtual room and we'll bring it back to the board chambers. So the individual who wanted to come up and speak at this point in the board chambers, go ahead.
Hello, my name is Julius Blake, and I just wanted to talk a little bit about this whole COVID thing. I personally know a doctor who sent in tests for COVID that had no, he just unpackaged the test and put it directly into the mailing thing for mailing off and getting tested, and they came back positive. So that's not encouraging. So even the testing sites can get tested, and they're not completely accurate. And you know, it's nice that people are washing their hands now. You know, even in the men's restroom and things like that, it's amazing the amount of people that don't wash their hands when they're walking out. And and I say that because finally we're getting some awareness of just general you know, good habits going on, but the amount of deaths that are supposedly caused by this aren't even wouldn't even be considered an emergency. A pandemic doesn't even show any state of severity. All it does is say that something spread really quickly. It doesn't even mean it was really bad. All it just means is something went across the borders. So the idea that some governor of California can say there's an emergency and he's going to create some law, there's no emergency because there's never been shown that this is an emergency situation. So anything that he said, there's branches to go through properly for laws. He can't just be a tyrant and make these laws up and expect everybody to follow suit. You can try, but if Lake County or if Canada, I've heard there's counties where they're starting to put a task force out for, you know, you're not wearing a mask, I'm going to give you a fine. Well, try that. That's not going to fly well. You want a civil war? Yeah, go for it. This is unnecessary, unprecedented. You want to find, if you really want to get to the bottom of this, this is a manufactured virus, as it were, and it's not even that powerful in consideration of what they're making it sound like. Why don't you figure out who made it and actually go after them? That would be really helpful. And the news and the media and all this fake, just overreaching of power and negating of our own personal rights, that's wrong. So you here do not represent California as much as you represent us and upholding our liberties. The amount of deaths in this county is, you know, related or non-related, is nothing in comparison probably even to suicide and food poisoning. So, you know, why don't you tell people they can't drive cars? You know, there's more people dying of car accidents than there are of this COVID. Yeah, everybody can be responsible and wash their hands, but this...
and sir, your 3 minutes are up if you can finish your...
Okay, yes, well, that's plenty good. We just don't need to be a bunch of lemmings diving over a cliff because someone else is. Thank you.
Thank you.
Thank you.
We need to...
If you can wait, Milosh.
We need to disinfect each other.
We need to disinfect in between speakers. Thank you, Sam.
Mr. Chair, can I make a comment?
Go ahead, Dr. Pace.
Thank you. So our team was working on the positivity rate based on our data, And we got both Denise and Sarah, the epidemiologists, were working on this while we were talking. And the numbers they get for our local positivity rate is 3.09% and 0.83% case fatality rate. And apparently, this is what that are on the hub right now, and they come from CalReady, which is so they come from the labs send things to us, and they send things to this CalReady system, which is a large data platform that the state runs, but it's a different direction coming in. So basically, the bottom line is the positivity rate that from our calculations are 3.09%. The state today put in, I think it was 6.5%. But again, nobody's really taking those very seriously because of all the data problems.
Thank you for the clarification on that.
So those are local numbers being produced here.
Those are local calculations based on all the tests that we've run and all the positives that we've got.
Thank you, Dr. Pace. Okay, let's go back to public comment in the board chambers.
Whoever is next, I believe Milosh was getting up and we told him to sit down because of the sanitation process. And let me see if I can figure out a better way to do this and maybe set up a second mic so we can go a little faster.
Well, this is going to be very quick. I just want to address the basic issue which goes aside of this whole discussion and any other discussion. This is about the testing. How are we testing, or how are you testing, or anybody testing for COVID virus? Has the COVID virus been identified, separated from the other potential viruses? Or is the testing still based on two different kinds of possible immunity? Because immunity is the main weapon against any kind of a disease. Let's go way beyond medicine. But anyways, I just wonder, Mr. Pace, we never had a chance to ask you these questions on the radio, but I want to know, what does the testing, what is it based on? What does it show us? Is it approximation? Or because this is incredible change in our lifestyle. I personally think this is the basic attack on, human species. And it happened before. And it goes through America, because America still is the castle on the hill. And that's just something that I can see pretty much through it. You can look through history. It happened before. But about the testing, could you, Mr. Pace, could you give us an idea, what is the test based on? Because that's what we are basing everything else, if I'm correct. So thank you very much.
Go ahead, Dr. Pace.
So thanks for the question. The testing is a test for the virus, the specific virus. It's there's a swab that's done where it's put in your nose, can be in the mouth, but it's usually in the nose. So they're pulling out some of the mucus in the nasopharyngeal passageway, and it gets sent off to the lab where they basically detect the virus itself. And this is different. There are a bunch of coronaviruses. This is a specific coronavirus, and the testing is felt to be quite specific to this virus. The antibody tests, and there's some other things that are other types of tests that we're not really using. This is the specific test for the virus, and it's very specific to this COVID-19 virus.
Thank you, Dr. Pace.
Whoever is next that wants to make a public comment, please go to the second microphone that we've set up, right up there up front. And again, just to remind you, you have 3 minutes, and once the bell rings, we'll just ask you to go ahead and finish up your statement.
Okay, first of all, I'd like to say that this virus measures 1.125 micrometers. A red blood cell measures 7 microns. You can fit 560 of these viruses inside one red blood cell.
Do you mind if I interrupt you for 1 second? Is everybody hearing the gentleman on Zoom?
Yes, we can hear.
Okay.
I said a red blood cell measures 7 microns. This virus measures 0.125 micrometers. That means you can fit 560 of them inside the space of one red blood cell. You can fit about 8 to 10 bacteria in that same space. The weave of a mask would be very similar to a chain link fence at about that size. That means that if a blood cell were the size of a volleyball, a bacteria would be the size of a baseball, and this virus would be the size of a BB out of a BB gun. Throw all three at the chain link fence and see what goes through. There's a lot of misinformation going on here. There's a lot of omission of facts going on here. I've calculated the numbers since the beginning. Fauci's been wrong about 60% of the time. I'm looking at a lot of medical people in positions of power following suit with what he says. Sweden didn't close anything down. Their death rate is 1/100% different than ours in the US. People are making a lot of assumptions here based upon this because everything they're talking about is based on projections and not actual numbers. Why don't they consult with Dr. John Ioannidis from down in Stanford or Dr. Scott Atlas from Stanford, who are using actual numbers and saying what Fauci's saying doesn't fit? Now let me read you something out of a book I recently read. In every case where there are exigencies, and that means urgency, or tasks that seem impossible to deal with successfully, public opinion must be concentrated on the one problem under the conviction that the solution to this problem is alone a matter of life and death. Only in this way can the public interest be aroused to such a pitch as will urge people to combine in a great voluntary effort to achieve important results. That was written in 1925 by then 29-year-old Adolf Hitler in Mein Kampf. Volume 1, page 197, chapter 10. Sounds exactly what's happening here today.
And Sam, if you can make sure the levels are good, I'm going to go clean up rather than you having to go out of your room.
Sir, go for it. Okay, let's go to the next comment.
I personally feel a little, well, I'm going to take a different approach.
Can you give us your name, please?
Oh, I'm Jade Michelson. I'm going to take a little bit of a different approach to other people. From my standpoint, when the U.S. went into the Civil War, did they count the cost at what freedom was going to be costing them? Did they think about the body count that was going to be expelled at the cost of freedom? I don't think they did. When we went into World War II, did we count the body cost? No, we didn't. There was a job that had to be done, and we followed through with it. In regards to this, we're on a slippery slope from my standpoint and from my kids. What is the cost of freedom? I would much rather give up my life and be free than die as a slave. And like Rob Brown said, these are massive decisions that are being made. This isn't small. This isn't a mask or not a mask. That's a moot point. That's just a moot point. What it has to do with is our freedoms. Millions of people have died for our freedoms. Up to this point, what's the difference now? I turn around every day and more of our freedoms are just getting eroded away. The Constitution almost doesn't mean anything anymore in the US. It's outrageous to me. Anyway, that's what I have to say. I'd like you all to think about that as you pass these laws for me and my family.
At one of the first meetings where we discussed this, I said, I'm glad that the men and women who fought for our freedoms didn't feel the same way about the cost that we are now.
Hi, my name is Denise Lewis, and I did fight I was in the military, by the way, but that's beside the point. Over the past 20 years, the clinical studies of mask wearing and its effectiveness or ineffectiveness is really well founded, and nobody has disagreed. The WHO, OSHA, as well as the CDC. In fact, their studies have proven that masks and wearing masks have little and no effect. And this is grounded in the scientific community and grounded in scientific basis based on multiple randomized clinical trials. And randomized clinical trials where a group of people follow a strict protocol and whose results are measured and reported. It's a method for proving or disproving a hypothesis. And really the foundation of how we've made decisions, scientific decisions about wearing masks and not wearing masks. And if you're a scientist, you understand that only a randomized clinical trial can purport a conclusion on certain outcomes. And one of the outcomes is mask wearing. And mask wearing in these different trials over the last decade, considering the randomized clinical trial, has shown that that the mask and the effectiveness of it could be measured. In other words, there's no measurable benefit, and each group got sick at the same rate, whether they had a mask or they did not have a mask. On June 5th, 2020, without any new clinical trials, the WHO and the CDC made an about-face, and what changed? Let's think about that. Nothing changed. There were no more new clinical trials. Nothing in science had changed, only an opinion. There have been no new randomized clinical trials. And every other clinical trial previous to this proved that the mask did not, in a setting of the general population and the pathogens that are already there, did not affect the effectiveness of the mask against influenza.
Oh, yeah.
Anxious, frightened patients, as well as clinicians with a strong desire to prevent illness, obviously, we all want to, and create an atmosphere of safety, are all susceptible to the softening of the science with a measure that feels safer, but really has not proven to be safer. Politicians that have directly involved in treatments and policies that they assert are effective without adhering to the long-standing foundation of the science of masks that have been shown.
3 minutes.
Okay, so
You can wrap it up.
I will. We're the poorest county in California. Businesses in this area have always had to fight against bigger businesses and cities to offer local goods and services. Businesses have already been hard hit by the shutdowns. And now we're putting on the burden of this law on the backs of businesses who are just trying to survive and using them actually as a policing agent to pin them between the customers they serve. And I think if you take this step, politicians and the public health officer, you will be penalizing businesses and using business as your own policing agent, and it is the worst decision model that can be applied to a rational and democratic society. The forced preventative measures without a scientific basis while recklessly ignoring the consequences.
Mr.
Thank
Chair.
you.
Mr. Chair.
Yes.
So I'm glad we're having this discussion, and I know that's why most of the people, if not all of them, came, but we're kind of bleeding over from Dr. Pace's report into our 11 o'clock item, and I'm concerned that the information that we're getting from the last couple speakers will be missed by some that are expecting this item to actually be on at 11 o'clock. I know we're not making any decisions, we're not taking the item up till 11, but I think the information that we're hearing is valuable, and I'm hoping that we just wait another 10 minutes for that information and just maybe wrap up Dr. Pace's report.
Well, that's what we're looking to do, and most of them start out rationalizing where they're at and then end up going into the other items.
I get it, but if we just tell people that right now.
The 6.4 item, our 11 a.m. item is, obviously the masking ordinance that we're going to be talking about. Today is just a COVID. Right now, we're in the COVID-19 update from Dr. Pace. So do we have any more comments for Dr. Pace?
If you are here to speak up
on his report that was given today.
Hello. Sorry, the microphone wasn't working. If you're here to speak up on the ordinance that we will be discussing on 6.4, then please wait till 6.4. Right now we're on 6.2. If you want to discuss something other COVID related, then please, this is now the moment in time. And you can go to that microphone over there.
Bob Michelson, is this on? Can you hear me? Okay, yeah. Bob Michelson, District 3. I'd like to just kind of address the issue of which has been kind of bandied about in the news. By the way, before I get into it, I just want to thank you guys. You face a tough situation. This is kind of an unprecedented time that we face here in our country, in our state, in our county. Just, you know, I keep you in my prayers. But anyway, I'd like to just kind of address the issue of herd immunity, which has been kind of bandied around a little bit here and there in the news. And I think one of the best things that can take place is herd immunity. When I was a kid growing up, I had the measles. I wasn't vaccinated against that. I had the mumps and a few other communicable diseases that we run from now, and haven't had them since. And I think there's a great benefit to our elderly population for herd immunity to be allowed to take place, allowed to develop as nature has planned it, as nature has designed it. And I think that would be a great benefit here in Lake County. I would like to encourage the supervisors. I don't know how feasible this would be, but to encourage you as supervisors to maybe set aside a separate entity to look into some of the implements and ramifications of this, of the whole dialogue around COVID-19 for Lake County's purposes, for Lake County's standalone. I'm not sure quite how to put it, but because we're not followers here. We kind of stand on our own as far as the other counties around us, and it would be good if we continued to do so. California needs a shining light. Someone mentioned that we're in the top 5% of those who or the bottom 5% of those who are a little bit viewed a little bit different by the state or whatever else. That would be great if we continued to do so, because in this time of confusion, to have a clear direction would be really helpful. And I do not, support some of the draconian measures that some of our other counties, sister counties, have taken. Anyway, that's for the next time probably. But I just want to thank you, and I'm reminded of the words of Benjamin Franklin. He said, "Those who would trade their liberties for safety deserve neither." I'll close with that. Thank you.
Thank you.
Hi, my name is Cielo Alavisos, and I'm not going to repeat what Bob Michelson said, but he pretty much just had what I had on my heart about the herd immunity. And then the other thing is that I know it was said earlier that masks are available at certain buildings, but we all know that really doesn't defend much with just a mask. We also need to provide everything else that comes with protecting from the COVID-19, and that would be some gloves. Maybe even we need to start wearing outfits. I don't know. And maybe even probably some stuff to cover our shoes so we're not tracking it into our houses where our little babies are crawling around and putting their hands in their mouths. And then also, it shouldn't just be the protection that's provided. It should also be for, like, this gentleman here, maybe some hearing aids now need to be provided. And I just think a lot of things aren't being taken into account, and not just for the people who can actually handle the masks and the outfits that need to come with it, but what about the children who have disabilities who can't stand things put on their heads or their faces, or even, I just think a lot of things aren't being taken into account, and even including the children. And now how schools are going to be, I'm not even going to say they're going to be working, because they're not. They're not. This is not just going to affect their health, this is also going to be affecting their education and a lot of things like that. And that's all I have to say. Thank you.
Thank you.
Thank you. My name is Val Lancaster, and I just have a quick question for Dr. Pace. The whole face mask thing is based on the potential for asymptomatic transmission. Is that a stat that our county health director keeps? Because if it isn't, then that really negates the whole wearing of masks. It really does. So if that's not a stat, then maybe it should be, because that is the only narrative that has been left out there to implement the mask ordinance in itself. Thank you.
Once again, we are moving into item 6.4 again, Val.
Mr. Brown, item 6.3, please.
And we'll be getting to that next.
That does actually go into this.
Any of the conversations going on in the boardroom there? Are there any more questions directly for Dr. Pace on his COVID-19 update today? Or comments?
That's my question.
She just asked the question. You didn't hear that?
Asymptomatic.
Dr. Pace, are you keeping stats on asymptomatic cases? I think that was a question. Go ahead, Dr. Pace.
Really hard to figure out where asymptomatic transmission is occurring. Most of the studies that have been done are using somewhere between 30 and 40% of the transmission is thought to be by people that don't have any symptoms. But that's not from Lake County. That's sort of larger studies done by, big centers.
Okay.
It looks like we have no further comments just on COVID-19. I think the rest are waiting for 6.4 or other items that are on the agenda.
Okay.
Wait. It looks like we might have again, it has to be related to COVID-19 and not the masks. Okay, go for it.
I just would like to ask Mr. Pace if he would identify the actual source of the discovery of the virus COVID-19, because I can find it anywhere. If you can direct me to website or publications, that would kind of put my question to rest, but I haven't found it. There were several attempts to identify COVID-19. Latest one was in South Africa, but I don't think they made any progress with it. So thank you.
I don't know if you have an answer for that, Dr. Pace.
It sounds like what the question was around where the COVID virus first was contracted by humans. I don't have the answer to that. No, I think they're still working on that. I think that the current thinking is, I'm not sure. I think they're still working on that. I don't have a good answer for that.
Okay, thank you. All right, any more questions for Dr. Pace on his COVID-19 report? I still see that we have Dee Parker is still up there. Was there any headway made with that individual, Jake?
Yes, we think we may have a resolution on her technical difficulty. So I will try to unmute her here. Dee Parker, I've sent you a mute request. Looks like you're muted. Go ahead and give us a sound check. All right, it looks like you are still experiencing difficulties, Dee Parker.
Okay, it seems like we haven't had any move there. We've attempted a couple times. Hopefully,
yeah.
we can hear you.
There we go. I figured it out. Sorry, guys. I'm so sorry. Thank you so much for taking my time. This is Dee Parker, or me taking your time. I just have a quick thing. I sent last meeting, I requested email correspondence. I sent an email to you, Moak, and also to you, Ms. Brown, Mr. Simon, Ms. Brown. I tried to reach Dr. Pace and was unable to find his email on the site. And so I reached out to the general environmental health, and I just need an email. And I just need to know if you guys have received my emails.
Yep, got your emails, and we'll work to get you the Mohawk email and also the number, the 263-8174, if you need to speak with them. So
I would like to do that if you just get me in touch with Dr. Pace so that we can start a conversation. I so appreciate it. That's actually all I needed today at this section. Thank you.
Thank you, Dee.
And in response, I did get your email at 11:52 on Sunday night. So sorry I haven't had enough time to get back to you since then.
That's okay. I think that's when I might have sent it.
Yeah.
Okay. Dee, we'll get you that contact information so you can have a conversation.
Yeah, and in the email that I had, there wasn't any question that you had. It was just, it looked like a statement. But if you want to call me, or I can give you a call afterwards, and maybe we can.
Oh, thank you so much. I so appreciate it.
Okay.
Thank you, Dee. Okay. I know that we went back to Dee Parker on that conversation. She had her hand up for a long time. We've done that. We closed it and brought it to the board chambers. Do we have any more comment in the board chambers?
No, we do have no more comments on this one. We do have an individual who's waiting patiently for item 6.3.
Okay, excellent. And we're going to go ahead and bring it back to the board then. We're going to close public comment on this report from Dr. Pace, and we'll bring it back to the board for comment. And I see Supervisor Scott.
Just that Ron Green wants to make a comment, but does not know how to raise his hand in the Zoom room.
Okay. All right. So we're going to try. All right. Well, we want to really try and get this thing wrapped up. We've got 9:30 a.m. item that we're well behind on, and we also have the 11 a.m. item that I know a lot of people are waiting for. So, as far as public comment, we'll go to. We'll try and take care of the last two here. Obviously, I want to make sure everybody has an opportunity. So we'll go ahead and go to. But I don't know if Ron doesn't know how to raise his hand. I'm not sure if we'll be able to get through for any public comment. So.
Forget it. It was actually on the next item he wants to speak, so we'll just let it go for now.
All right. Thank you. Thank you. All right. So we're going to go ahead and any more questions for Dr. Pace from the board? Comments? Okay. Hearing none. Like I said, we're going to go ahead and move to our next agenda item. Obviously, I know there are folks waiting probably for 6.3 and 6.4. But I do know we're going to go ahead and move along with our 6.3 item. It was a 9:30 a.m. item. It's a nuisance abatement hearing for Riker Shink, 2922 Gardner Street in East California, APN number 031-134-57. I know he's been waiting patiently, so we will go ahead and we're going to move forward with that item. I want to thank him for his patience and everyone else. So this is as we said, a nuisance abatement hearing, and we're going to go ahead and move forward with it.
Do we need to?
I don't know if we have
do we need to
community
take
development?
Yes, Mr. Chair, it's my understanding community development is joining us by Zoom, but I am not sure who.
And Mr. Chair, witnesses should be sworn.
And so anybody who is going to testify in this or would like to give, would like to testify and give, talk in this hearing, we're going to go ahead and have you please stand and raise your hand, and whether that's
how do you do that
in Zoom or actually in the meeting.
We need to get clear on who community development will be speaking. Do we know? Okay.
Excuse me, Mr. Chair. Yeah, this is Code Enforcement Officer Michael Herring, so I'm here.
Okay, are you on the phone only, You're not on.
No, I'm on Zoom as well. I can share my screen.
Okay. Well, please, Johanna, if you could please swear everyone in.
Okay. So is everyone raising their hand?
Yes.
Do you solemnly swear that the testimony you are about to give will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
I do.
Okay, thank you.
I know the folks on the phone who just attested to that. Please, when you give your testimony, please, attest that you had sworn in and who you were when you did that. So thank you very much. So as the hearing goes, I know that from a community development standpoint, usually the path that it goes is we do the presentation from the appellant, or community development goes first. I think.
Community development goes first, sir, then followed by the appellant.
Yes. And so I just wanted to make that clarification. I know the appellant seems to be standing there at the microphone. No, I just want to make sure that if he needs to, he can grab a chair while the presentation is being done.
That gentleman is gone. You can use his chair.
Excellent. Okay. All right, go ahead. Community development.
All right, I'll bring up my presentation for you now. So my name is Michael Herringshaw. I'm a code enforcement officer, and I'm here for the abatement hearing request for 2922 Gardner Road in Nice. 2922 Gardner Road is a vacant lot zoned R1. It's located in Nice. The R1 zoning, single-family residential, provides that the primary use for it is a single-family dwelling. At this time, there's no dwelling on the lot. The issues that we're having with the lot are open and outdoor storage issues, meaning that there's excessive items being stored on the lot. At this time, with no dwelling on the lot, no items at all should be stored on the lot. So technically, it should be an unencumbered lot. So what happened was in February of 2019, our former code enforcement supervisor, Kathy Freeman, had received several complaints about this property. The complaints range from allegations of someone occupying a van on a vacant lot to the storage of outdoor storage items, including junk, debris, and inoperable vehicles. Kathy Freeman did an investigation and substantiated that a violation of the zoning ordinance was indeed on the lot, and she issued a non-OTA or notice of nuisance in order to abate on February 14th of 2019. The violations that she listed were open and outdoor storage of household materials or other storage items and a storage of an inoperable vehicle. This notice of nuisance in order to abate was sent via certified mail to the address that we had on the tax collector's roll, as well as being posted at the property at the time of it being issued. Shortly after that, on March 4th of 2019, Riker filed his signed nuisance abatement hearing request form requesting this hearing. However, at the time, Kathy Freeman, to my knowledge, didn't make anyone else in code enforcement aware that there was this hearing request. So after she left, it went largely unknown that the request was there. And it wasn't until later, in February 20th of 2020, while I was doing routine patrol in the area, checking on other violations, that I came across the property, and I spoke with Mr. Riker, and he allowed me on the property to see what was happening, and there was still the issue of large amounts of storage items, junk, and other debris at the time. My conversations with him led us to the understanding that he was going to attempt to come into compliance with the code, and he just needed some time. So while working with him, I did some research, and that's when I later became informed about the hearing request that had been filed for the property. Shortly after that, I informed Riker that we had the hearing request. He stated that he still wanted the hearing, so I began working for that end. And recently I just did some more research. His hearing request, the reason that he filed it was he has a stream bed alteration agreement from Fish and Wildlife saying that he has the right to alter the stream bed. And his statement is that this agreement collaterally stops all code enforcement action. I called the Department of Fish and Wildlife and was contacted with one of their permit techs, and they verified to me that the agreement does not stop code enforcement from taking an action against the property or against the property owner. And in fact, that he may be in violation of his Fish and Wildlife permit, which I contacted Fish and Wildlife about, but have had no follow-up at this time. This is the property as of yesterday, taken from the street. There's still large amounts of storage items. The van, a shed has been erected over the stream that runs through the back of the property. And this is just another photo showing all the construction materials and other storage items that have been brought onto the property at this time. The code enforcement staff, the Code Enforcement Division recommends that the notice of nuisance in order to abate or non-ODA dated February 14th of 2019 be upheld, and the board directs staff to move forward with obtaining a warrant and pursuing an abatement action in order to remove trash, junk debris, and other storage items from the subject property. And that's the end of my presentation. Thank you.
Thank you very much.
I do have a question just for clarification. The
Go ahead, Supervisor Brown.
Yeah, the building that's that was erected, is it over a stream or is it a drainage, or what exactly is the status of? I mean, this time of year, most streams are dried up, but is it a functional year-round creek typically, or is it a drainage?
I believe that it is just a seasonal stream. When I spoke with Fish and Wildlife, that's the indication they gave me. And the gray shed there has been erected over it, where the stream runs under it. It's not a stream that's year-round. There's no water in it at this time.
It's what they refer to as a blue line stream. Just
correct.
Okay.
That's correct.
May I clarify? Thank you.
Thank you. Any other clarification questions at this point from the board? Yeah, I don't see any, so go ahead.
Okay, first of all, good morning, Board of Supervisors, Sheriff Martin, and members of the public. My name is Riker William Shank, and I would like to just take 1 minute and delve my massive experience. I have 46 years experience in the construction business and 35 years as a former foundation and framing contractor from Marin County, San Francisco. I've also performed work in San Diego, Los Angeles, and on the island of Kauai. I've had major structures on both major earthquakes, Hurricane Iniki and the hills, fire from Oakland Hills. I would like to start off with a shout out to my father, Mike Shank, who taught carpentry at the College of Marin and ran developments for the union at 35 and 37. When I started with 5, I used to go to them Black Fridays, and I would see through the eyes of a superintendent the development process, what it takes to build these massive developments. And with that being said, I would like to start off the hearing saying that I am blasting the code enforcement, Andy Williams' entire abatement as null and void and moot. Now, the code enforcement is strictly regulated by federal regulations, Title 28, Chapter 2808.1 through 8. And the code enforcement, I went to the code enforcement Mary Jane Montana on approximately November of 2018 with complete plans, a permit, a building application, and a notice from the Fish and Wildlife Department that I had obtained a stream bed enhancement permit number 1600-2018-0308 R2. I would like to correct the code enforcement as the zone is R2. I just want everybody on the board to know that under no circumstances was I trying to circumvent the permit process. I've learned long ago that it doesn't pay. So I was being extremely honest with the code enforcement. But what I found with the code enforcement is a lack of experience, a lack of code knowledge, and also an extreme lack of law, federal and civil law. I'm challenging the entire abatement as null, void, and moot, as the process goes like this. There is an original notice that was generated by my neighbors, Don and William and Jared Thornberry. Now, they were using the property unauthorized, and they were mad that I purchased the property. I hadn't had any prior contact with them. I have an incident report from the Sheriff's Department that they have wrongly and fraudulently complained over 11 times about my work there. I gave them a notice that I was going to build a fence, and they said they allowed me to do that, but subsequently caused over 10 vandalism acts moved by tearing down the fence and moving the survey markers, which is a federal crime. I'd like to note that the original complaint was from them, and it was done repugnantly. And Andy Williams, with his lack of experience, is causing hundreds of problems throughout the lake. And I want to stand to correct this right now. For instance, the code enforcement, upon receiving, I had no knowledge of the accusation or the nuisance. I was only told this when I approached Mary Jane, Montana. So I'm challenging the accusation or the nuisance as improper service. Now, I went there with an application with my current address, yet Andy Williams sent it to an address I hadn't received. I hadn't been there in 6 years. It was a P.O. box at the Creative Workshop. So never at any point was I properly notified of any nuisance other than through Mary Jane's oral statement. Nevertheless, on March 4th, I filed an answer, and I've also submitted to the court and the Board of Supervisors a demurrer to strike and to dismiss the abatement based on the grounds of collateral estoppel. Collateral estoppel stops any complaint where you have permitted by a state agency. The code enforcement has no jurisdiction to stop a fish and wildlife streambed enhancement. Now, the process after the motion to dismiss is that under Code 20, Title 28, 2808.1, is that they're supposed to give me, I'm supposed to authorize a hearing, but they've never, to this day, sent me an accusation. The abatement is null, void, and moot. The code enforcement had 30 days to comply, but never have to this date. It's moot. When I submitted plans, complete plans, for a house, a small house, 950 square feet, 460 or 70 per floor, solid concrete, metal roof, cementitious siding, and fire sprinklers. And along with that, I wanted a plantation house, a cottage. So that was approved on November 1st, 2019, for approximately 20 minutes. I've paid over $60,000 to the school, the fire department, and the municipalities. I've obtained 2 sewer laterals and a water meter, but have been denied my permit illegally and voidly by law because of Andy Williams' inexperience and knowledge of federal and civil laws and code. So what happened was I was excited. I was standing. One point I'd like to make is that as a frustrated businessman, you have to approach community or county work like a business. You never pass up a chance to receive money from a client. I was sitting there with my checkbook ready to complete the final application. I've already submitted about $6,000 towards the permit fee, plus a permit fee, a special live-in permit on the property, because I'm disabled. I'm 57 years old, and I've been disabled from years in the construction business. Now, since then, between the Thornberrys, acts of violence, and theft, and Andy and the code enforcement's illegal jurisdiction over the matter, is that I've been suffered huge financial hardship. Excuse me. I've lost about $30,000 in lost income and about $5,000 in vandalism and thefts, and I've had to re-go there and rebuild. I was permitted through mediation and Judge Lunas to build a fence. And part of that process is the fence is called winterization. Winterization is protecting the property and the job site from the public and protecting people from going onto my property and stealing things, okay? Which has occurred over and over. So, with that being said, and having paid and my due diligence and my honesty, I'm asking for some damages, actually, but I'd like to avoid litigation and just get on with my building process because, see, I have had to reside there and shelter in place under the COVID-19 mandate since approximately March or April, without water and without electricity that I paid for. So the materials that were presented there and also pictured were always my attempts to stock the job for my project, but was always thwarted by the wrongful and fraudulent calls by the Thornberrys and the wrongful jurisdiction of the code enforcement. So every time that I tried to work there, they called the sheriff's on me. And so I just want to say that this county and the code enforcement has lost jurisdiction over this matter. They only have 30 days to bring it to a hearing. It's been over 3 years or 2 years, but 3 years since I applied for the permit and submitted the plans. So with that being said, I'm asking and praying for relief and remedy, and that the county waive the rest of the fees for the main house and let me issue a permit that I paid for. If there's any questions, I'll take them right now.
Are there any questions from the board? Supervisor Sabatier?
Yeah, I got a question for our code enforcement officer. If he can discuss the attempt to get the building permit as far as I'm concerned, the jurisdiction of the state would be over the stream bed alteration, not the rest of the property, and our laws supersede the rest of the state as far we have our own laws of what's expected of something in our neighborhood. But I was wondering if you can speak on the building permit and if that was provided and then taken away, like if he can corroborate the story or give us a different perspective.
Yeah, so to my understanding, he had applied for a building permit. However, a building permit was never issued because of there being code violations on the property. And at no point did we attempt to stop him from having his state permit through Fish and Wildlife for stream bed alteration. We're not too concerned with that. Our only concern is him having storage items on the property without a building, and he can't get his building permit. Although he's applied for it, it cannot be issued until those storage items are removed from the property so that the code case can be closed.
I object to that. I'd like to...
Hold on one second.
Yeah.
And my follow-up question is, I know that it's always confusing because code changes depending which jurisdiction you're speaking of. But I know, for instance, in the city of Clear Lake, if you have a building permit, there's certain rights that you're now given, such as having an RV on the property so that you can live in that RV while you go ahead and build your building. Are there certain rights that would be allowed for him to have some of this storage material on his property if he was given a building permit, just to kind of see if that would fit?
Yes, he would be able to have some storage items related to construction if he had a issued building permit. As well, there is a temporary dwelling permit, which you had mentioned that he could apply for, which would allow him to live on the property while he's constructing his house. And that would be possibly through an RV or a fifth wheel trailer or something of that nature.
But it would need to have all the appropriate sanitary accesses.
I believe that's correct. I'm actually not too familiar with the temporary dwelling permit because the planning division normally issues them, I believe.
Okay, I would like to...
Right. No, it's only temporary until the building permit either expires or whatever the case might be.
Yeah, and I'd like to directly oppose the code enforcement's interpretation of that. On November 1st, 2019, I did submit the application and I was issued a permit 01490. That allows me to have materials, and the shed that they were talking about over the stream was a Tupperware shed to lock my tools up. So it's only a temporary issue. I had repeatedly worked with Jack Smalley because he seems to be the only one that has any experience in construction. And he said, yeah, Riker, just build a little wood rack and organize your wood, which I've done. And nothing is on that project, on that property, that isn't going to be used for construction. I did receive and paid another $543 for a live-in permit. I have a porta potty, and I also have a little outdoor palapa with barbecue. We're all subject to the shelter in place, and this code enforcement has greatly exceeded their jurisdiction here. My stream is episodic at best. It runs 4 months out of the year. I have a notice of exemption from the blue line rules. I'm very sensitive to blue line. We all grew up hunting, fishing, and I want the board to know that even though that the Fish and Wildlife exempted the Title 37 blue line restrictions, I'm observing it. I'm staying out of the creek. I'm going to build up some keystone walls that'll separate the floodplain from the creek. I did do a culvert head wall to handle any kind of a flood. And the neighbors, the Thornberries, I paid for the entire cost of the fence and the head wall. And yet they continue, there's 1 foot that goes on their property. and they will not, assist in any way. They've been a nuisance themselves, and everything that the code enforcement has said is 100% false, and I just wish to get my permit that I paid for and continue. This is my retirement home. I have family that lived in Findlay, and my Aunt Hazel and Jim Gaffney. Aunt Hazel worked for Judge Wright as a personal secretary for 40 years, and my uncle was a game warden. So I've had a long history with Lake County. I love the county, and I wanted to retire here. But this code enforcement has extended their jurisdiction way too far and has not allowed me to proceed in any fashion, yet has been adversely affecting my condition and way of life.
And if I can follow up on that, I just want to let you know that from just doing a quick research, you are in a R1 zoned area. There's still a P.O. box as far as the main address. I don't know if you need to go upstairs and fix that. So I think that there's some things that you need to look into as well. And I'm all for figuring out a solution, but we've extended this past a year because it got lost, which is a bit of an embarrassment for us. But here we are trying to rectify that. And in that year, it doesn't look like anything has changed. It looks like the Fish and Wildlife has expired, and so while I'm looking for a way to solve this, where you can end up with a house and a place to be, but in that year of extension, you've lost your Fish and Wildlife, or it's expired your Fish and Wildlife permit, and there's no bridge, and so how confident can I be that if we extend this, that we will get the outcomes that we're all looking for, that you're looking for?
Well,
so that's where I'm stuck right now, and I'll let other supervisors ask questions.
First of all, it's an absolute R2 zone. Second of all, the Fish and Wildlife permit is a 5-year permit. The young lady that was 2 scientists that I hired and paid the permit gave me 5 years. This is a 5-year permit, and because it involves 80 to 120 tons of stone and rock work to be done. I want to put Wash River rock in there. I want to do some ladders, but I have not, because of the overzealous, unjurisdicted diction of the code enforcement. I have materials for the fence ready to finish. All the materials there are for the project. I have the materials for the foundation, for the cottage that was approved under permit 01490, and that the car is registered and insured, the little truck that I use for the project. And this has been a nightmare. I mean, this is the county enforcement is clearly under experience in this issue, and I've been a builder for many years in the big city under the earthquakes, Hurricane Iniki, the Oakland Hills Park. I've had evolutions of code knowledge and changes, and I have on that property just materials ready to finish the fence and build the cottage. But I wish to have my original house permit. I didn't go in there for a permit for just the cottage. I went in there for a permit for the house and the cottage. I've also purchased the property next door and wish to merge that, but this has been a real, it's been extremely costly, and it's unnecessary, and they're clearly out of their jurisdiction. And it's a 5-year permit.
Okay.
I have the report. Go ahead.
Do you have any more any more evidence that you'd like to present, Mr. Shanky?
Well, yeah, I do have. I'm trying to find it right now, but the original records that they have, it was just kind of scrambling right now. But I went in there. I would like to point out this. This is produced a brochure in Public Works, and this picture depicts something that is published by Public Works. Scott DeLeon is in charge of Public Works, and he's in charge of the building department. This is actually depicts a well-prepared job. And you'll notice that the fence is up there. It's winterization. It's got coconut husk, which I do, silk fencing, overflow pits for if there was, concrete water or whatever, and access, a porta potty, numbers. The people in code enforcement have no knowledge of pre-permit winterization rules. And they need to learn this because I have extensive experience in this. I'm representing an 85-year-old man in Marin County right now who's facing abatement, and we're winning. I'm currently involved in the Court of Appeals, a federal judge, and the U.S. Marshal stopping them. I don't want to get into that litigation with the County of Lake, but I will. I demand my permit. The rest of it as under R2 for a single home and a detached cottage. So I have that, and I also have a sheet that proves in the receipts of the monies that I paid. So I'm well researched, I'm well experienced. I don't wish to fight in court. I just want to build my house. With that said, I'm asking for my permit and the waive the rest of the fees because of the extensive cost and damage that I've had caused directly by Andy Williams, Kathy Freeman, and the rest of the code enforcement. I've talked to EJ Crandall numerous times. I reached out to him and he says, wow, you're really knowledgeable, Mr. Shank. Maybe you can apply for the code enforcement. We really need some help. I said, I'd love to help out. But all he did was I got a call from Andy saying, you got a hearing on August 11th. I'm like, where's the accusation? Here we are 2 years without the accusation. I have not received the accusation to this date. The issue is null, void, and mute. I motion to dismiss it.
Thank you, Mr. Zinke. Excuse me if I say your name, Riker.
Yeah, no problem.
Supervisor Crandall?
Yes, I wanted to ask code enforcement a question about the property that they found on that property, and also the vehicles and I've seen the pictures, but they're kind of upside down. So I'm checking that out and trying to find out because he's saying it's materials that are going to be used to be built, and then there's a vehicle that he said is tagged. Is there one that's not tagged? And then my second question is also the Thornberrys. In his court statement states that they live on his property, and they're making complaints. I wanted to make sure that that's about.
So on Riker's property right now, there are some construction materials. I would not say everything there is construction materials. There's a makeshift kitchen, I believe, a van that he resides in. There are some other just miscellaneous materials stored there as well. When it comes to the Thornberrys, they don't live on his property. They are his neighbor, his immediate neighbor.
Okay, thank you for that clarification.
I would like to say about the regards to the tag on the vehicle. We are registered till January.
One more second, Mr. Secretary.
Oh, sure, I'm sorry.
Are there any more questions from the board's point of view? Supervisor Scott?
I guess my only question would be for code enforcement. So we've asked him to go in and clean this up, and if he would have gone in and cleaned it up, we would have given him his permits, correct? And I guess I'm also confused by the fact that he stated at one time that he's paid over $6,000 for permits and then another $500, but then we were told he wasn't issued permits. So could you clear those two questions up for me?
So to answer your first question, if his property had been cleared up, he could have been issued a permit because there would no longer be a code case on the property, so a permit can be issued at that time. We actually went a step further and told him that if he just got his property into a very organized and orderly state, we could work with him on attempting to issue a permit. That didn't happen at any point, as well as I'm sorry, what was your second question?
That he stated he's paid $6,000 in permits already?
So I'm not aware of that. I don't have those numbers that he paid. I know that he applied for a permit, and to my knowledge, no permit had ever been issued. Simply an application was submitted, and at that time, fees are collected.
So
we've been working with him. Code enforcement has been working with him for at least a year, to my knowledge, if not more, trying to get the property just into a manner where we can feel comfortable issuing a permit. A large part of it is the precedence of you can't have code violations on your property and then get a permit and those violations go away. So it's been quite some time that we're working on this with him to get his permit issued. However, at this time, it's only applied for.
Well, I really appreciate the fact that you were trying to work with him, that this wasn't just you went in and you gave him that nuisance of the garbage and all needed to be cleaned up, that you've really been trying to work with him. So
I
really
object to that. I have to say that let me explain the code enforcement.
Mr. Shank, this is not a court where you can object and just interrupt.
Supervisor Brown?
So, yeah, she was right in the middle of her.
Oh, I thought she was finished.
You'll get your chance now. Well, I wanted to say something to answer Tina's question when she's done.
Okay.
Yeah, I think she is done, Supervisor Brown.
Well, so what I heard him say, and he can correct this too, the $6,000 that he paid was not for a permit. It was for the fees to go towards the permit. There's school fees, fire fees, water, sewer, depending upon where you're at. And so first he said 60,000, but I think he meant 6,000 because he said 6,000 after that. So I think that's the fees that have been paid. Now you're shaking your head no, but that's what you said. So I don't know.
No, $6,000. It's somewhere between $5,000 and $6,000 for the permit fees only. I have over $58,000 to all the special districts.
Who'd you pay the $6,000 to?
Lake County and Lake, and I have the canceled checks in here, okay, to prove it. Also, I would like to verify the code enforcement's interpretation of cleaning up. Because what the gist of the reason I'm here is because they wanted me, after the permit was finished, to remove everything on the property, when in fact there had been a legal building permit in place and work on the fences to protect myself from the neighbors and from the public from walking on. So their interpretation of the code enforcement is not valid. So I'm saying that they want me, in no circumstances can I remove building materials that I need there, and that issue is also moot. I've been trying to, I'm actually, the place is looking a lot better. I've been working on fire abatement. Yes, Mr. Brown.
Okay, go ahead, Supervisor Brown.
Well, since I had a misunderstanding of what he said about his fees, I don't believe Tina's question was answered, and I'd like to know the answer to that, if he actually did spend $6,000 and the county cashed his checks for a permit. And then the other thing I would like to get to, maybe if Mr. Herringshaw could put the pictures back up of the nuisance that's being alleged, because I looked at them originally, but not with the eye of whether or not they are actual building materials that could be used in a house. So I would ask some staff.
Yes, Anita.
Yeah.
Bill, this is Tokara Nicole Thomas, the Deputy Director of Community Development.
Apologize.
If I may address Supervisor Brown's question about the permit fees.
Well, actually, it was Tina's question, but I would like to hear the answer.
Sorry, if it was Supervisor Scott's question. I was able to determine that Mr. Schneck, and I apologize if I mispronounced your last name, as of October 2019, we received $252.60 for the permit fees. That's just for the permit fees. I don't have any record in front of me at this moment of any additional fees. Was that helpful?
Well, go ahead, Tina.
Go ahead, Supervisor Scott.
Yes, just trying to clear up, what's been paid, because we were told he hasn't been issued a permit, but I guess I didn't realize you pay the permit fees in front of the permit being issued.
That was for the building permit in October 2019. As Code Enforcement Officer Heron Shaw mentioned, we've been working with him. We cannot move forward with the permit until he clears up the code enforcement violation.
So,
go ahead, Supervisor Brown.
That being said, if he says no, forget it, will he be refunded that money?
That's a policy.
Let me look into that. That's a good question.
Okay.
I'll get your answer.
Okay, so I see the slides up there. Could you enlarge those photos a little bit for me, please? Yeah, there you go.
I'm sorry, that's the best I can do on the PowerPoint to make it larger.
That's actually better. Are there other photos? Because
There are, yeah, I'll go through them. So this is the front of the property.
Okay.
This is immediately off of the street. This is what you see when you're going up Gardner Street.
Yeah.
2 years ago, that was 2 years ago, and I'd been interrupted by the code enforcement.
So that's not there now?
Actually, these pictures are dated February 20th, 2020, and there's a date stamp at the bottom of the picture. This is from the inside of the property. This is his, I believe he called it a lumber rack. So this is where he's storing his lumber.
If I may, I have a list of all the agencies that I paid. Also, regarding that issue, I do apologize. That's a better picture. It has been since been cleaned up a lot better than that, and I'm still working on it. I would like to restate the fact that every time I go there, I get a call. The neighbors call the police and the sheriffs, and I've been interrupted on that policy. Now, it's not fair for the code enforcement to issue a permit for the cottage and then say that it's an R1 when in fact it's an R2. And it's not fair for me to have to be subjected to Better Homes and Gardens issue with the code enforcement. I'm not telling them how to do their job like I am now, but that everything that is there, that's a retaining wall to the left. That's going to be done in Keystone. If I needed access to the driveway, the Tupperware shed is temporary. It's just to secure my tools. I got expensive construction tools. To the right is a little palapa casino. I've been sheltering in place. And to the right of that is my tool shed. I've been adamantly working on it all week. I do have two severely bad knees and a broken hip. That has taken a little bit longer. I apologize. I am working with Scott De Leon and trying to resolve. Had to put off the inspection, but the gist of the inspection is I should not have to take those materials away. Now there's a case in Mill Valley. They used a precedence of this case of new code enactment, and what that calls for is that all new construction must have 40% recycled materials. They must have 40% solar photovoltaic for the footprint, which I called for as a solar photovoltaic system, a grid tied, and a solar thermal system. It's going to have a very low carbon footprint. Only the stove is my gas the heating's going to be solar thermal through radiant heat through the ceiling, and that these materials, it also has to contain a 12% water catchment system. So.
Okay, so you're citing a code from another county that it's not relevant to what we got.
It's state and federal, yes. Well, I mean, it's
not as far as recycled materials. No, that's.
Well, I mean, those are form boards I'm using for the foundations and the underpinning, which I can't.
Okay, so, Mr. Chair, I just want to, we could go back and forth. We're not going to reach an agreement as to what he thinks the code enforcement should be doing, and code enforcement's not going to, get to a point where they're going to go, you're right, let's just walk away from this. I think, we have, if whatever action the board takes today, if the action is to move forward with the abatement, that's when they work with them. That's when they get down. They don't go in there and start cleaning up tomorrow. They work with them to try to get this resolved. All of this stuff about the law, the code, the threats of lawsuit and all this other stuff. We hear this all the time. Yeah. That's not settled here either. That's settled on the fourth floor. If it gets to that point, I'm not going to make my decision based on what a threat of litigation might be. That's not how we deal with this here. And it's just all of this other stuff is really not relevant as far as what kind of cottage he's going to build and his resume and all this other kind of stuff. Really has nothing to do with what the issue is at hand. It all may be valid, but it has absolutely nothing to do with this hearing. So I'm interested to hear.
Yeah, we were going to go through those photos, and I know Mr. Shank, if you let us go through the photos. I asked you earlier if you had anything else to present, and I think you presented your case. Now what we'd like to do is have the folks that did, once we go through those photos, Supervisor Brown, if you'd like to finish that, we can do that. And then we will move to anybody who would like to raise their hand that was sworn in to testify on this, and then we'll bring it back for deliberation and any further questions from the board.
Yeah, no, I'm good with the photos. I wanted to see, if there was actually lumber stacked there that's going to be used for framing. I mean, it's all recycled stuff, and we've gone through this before, and actually, years ago, where abatement hearing was heard. The decision of the staff was held, and all of the material that was supposed to be used for recycling is still sitting there, and the neighbors are still dealing with it. So, whatever action we take, I want to just take it and move on. And either clean it up or move on. But I'm interested to hear what the supervisor in that district has to say. But I also am interested in taking a break as my bladder becomes my own personal spokesman. So.
Okay. All right, hearing that request, then let's take a 5-minute break. We'll take a 5-minute break. When we come back, we'll have the folks testify who were sworn in, and then we'll bring back the board for deliberation. So let's take a 5-minute break. That will bring us back at right at 12 o'clock.
If I just better interject that
there's 5-minute break, and we'll reconvene the hearing.
There's been no previous hearing here, Mr. Brown. There's been okay.
Process
Go
here.
ahead.
Since we're obviously running really late, and are we going to take up the 11 o'clock item prior to lunch, or are we going to just work through it? Because I think there's a lot of people here that have been here all morning for that, and we should tell them now if they're going to wait. We're going to wait around or what?
Well, if I can conclude 6.3, I'll do it really quickly.
No, I'm asking the supervisor Simon about process.
No, so the process was, was planning to get through item 6.3 and then take up the 6.4 item, as soon as we could.
Okay.
Obviously we are behind here. I do know that. And, the idea was to get through this hearing at this point, work through it, and then go right into the item and then take a lunch break after.
Okay, I just want to let the people know that, because there's still a lot of people here, and there may be some come back, I don't know, but I wanted to make sure they knew ahead of time so we didn't surprise them with a lunch break in between.
Yeah, we weren't going to surprise them with the lunch break. Plan on working through the hearing and then taking a lunch break after our 6.4 item. So we're going to go ahead and reconvene. Are we ready, Sam?
We are ready.
Okay, we're going to go reconvene the hearing. Just before our break, I know that what we said is what we'd like to do is go ahead and ask for anyone who raised their hand and would like to provide testimony at this point in the hearing? And I thought we had more than just a couple of folks who had raised their hand to provide the testimony. And I could have been wrong. But I thought we had heard some more. I thought there were more than one that had said yes to testifying. But if that is not the case, if there is none at this point, we will go ahead and close that part as far as testimony goes. Mr. Shank, you've been given testimony from the beginning. What I was looking for, if there was anybody else on behalf of Mr. Shanky or in opposition to Mr. Shanky that would like to give testimony. And seeing none or hearing none, I don't see the boardroom. Is there anyone in the boardroom at this point in chambers that is raising their hand and would like to comment on this item?
I do not believe that there's anybody in the public here that wishes to make a comment on this item.
Yeah, and they needed to be sworn in before the hearing. So, okay, I just wanted to double check. All right, we're going to go ahead and close that portion. We're going to bring it back to the board. And I see that we do have a question from Supervisor Crandall.
Yes, no, Mr. Shank has called me quite a bit of times, and I was so somewhat relieved when Andy took it forward because for whatever reason he was given my number to talk to about this. Of course, rightfully so. It's in my district, and he's been struggling with his neighbors and those things. So I really only heard pretty much his testimonial of it. So everything that he's saying is the things that I heard. This report gives me a different aspect of it. However, I just wanted to state that I know it's difficult at times too for them to change hands of different. I've had a couple of situations in my district where Mrs. Freeman had passed something on to someone else, and it's right there in Nice, and it's another situation where some things get unheard. So I was really glad to see that they came together and worked on this. I don't know if I'm glad to hear what Supervisor Brown said, that if they do, even though they're conducting an abatement, it's not just that they come in and move it. There is some work that they'll work on with Mr. Shank, and I'm hoping that that's going to happen. I hope that there's a way we can move forward from this in a positive way.
Okay. All right. So we're going to go ahead and, like I said, we're going to go ahead and close the public hearing, and we're going to bring it back to the board.
And Mr. Chair?
Yes, go ahead.
I do want to make sure that you're aware that Mr. Shank is looking to say something and just...
Oh, okay.
Yes.
I apologize.
Thank you.
All right. Thank you, Mr. Shank.
Thank you, Mr. Brown. What I'd like to do is that, motion the board to stay the abatement, let me finish
Mr.
the
Shank,
fences.
We have heard that request from you multiple times. What we're going to do, what we'll be looking to do now is to close the hearing and to bring it back to the board. And there are obviously, there is a recommendation by community development, but we'll do our deliberations and ultimately the board will make the final decision. So we have heard your request, obviously, to, null and void the appeal and to stop everything. And, I can't speak for the other board members, but clearly heard you state that at the beginning of your evidentiary information that you were giving us for the hearing. So we're going to go ahead and close the hearing at this point and bring it back to the board for deliberations on both your request and the request of community development. So I just want to clarify that you've clearly been heard on your request. So we're going to go ahead and bring it back to the board at this time for deliberation. So we have any board members? I know Supervisor Crandall just spoke. Any more deliberation from the board at this point? Supervisor Brown? Just making sure you're getting some exercise there.
Yeah, that's good. Yeah. So again, I'll wait to hear what Eddie has to offer here since it's in his district. But one of the things that we've done in the past is to uphold the abatement order and ask for a period of time for the property to come into compliance. And for me, I think 45 days is a reasonable amount of time. And the reason I say 45 days, just, it's kind of arbitrary, but it's really not, because we don't want to get into the rainy season in a couple of months and then have an issue going on. So at some point, this thing has to be resolved before it starts raining and this creek becomes not just a dry blue line creek, but actually a drainage with a lot of water running through it. That could happen. So, here we are in the middle of August. And, if this could be done by October 1st, somewhere in there, I think that's a reasonable amount of time. And then that would give staff time to go in and have it cleaned up if the property owner didn't do it to their satisfaction.
The reason why I object to that, the grading permit ends on October 15th, and that's not enough time for me to build what I was permitted to do on 01490.
Mr. Chair?
Go ahead. Yes, Anita.
Thank you. I think your board is moving toward it, but just for everyone's clarification, your board's not granting relief today on permits. You're not looking to see whether a building permit should lie. I think you've discarded quite correctly the issue of collateral estoppel, which simply does not legally apply here. And you can fashion relief as to the code enforcement action. So as Supervisor Brown said, if your board wanted to uphold the notice of abatement, then you can certainly direct staff to give it a period of 45 days or whatever time period your board feels is appropriate in order to correct the conditions giving rise to the action. But I do think it's important for everyone, including the property owner, to understand that would be the extent of the relief you offer today. You're not granting permits or anything beyond the four corners of this particular hearing.
Yeah. Okay. Supervisor Crandall, I don't know if you have.
Actually, that was one of the questions I was going to ask staff is how much time would they be able to give him in regard to this situation? I wouldn't necessarily state that we need to just overturn what they're trying to do, but give them some time because of the situation with Kathy Freeman being gone and the situation with Mary Jane. I mean, I hear those different things, and it happens quite frequently. It's not anyone's fault. It gets frustrating too when we come into the chamber rooms or we come to a situation where we're talking, and now the person that's making the Mr. Shank is feeling like he's not getting his statement made. So if there was time, 45 days is fine. I was thinking maybe 60, but all in all, I do understand that things need to move forward, and would like to see. I'm fine with that if there's not anything else.
Supervisor Sabatier?
Yeah, I was gonna say that a couple things. Number one, in light of the situation that we're in, we're trying to make sure that people are housed right now, and so I don't think that this is something that I want to move towards offering a situation where now all of a sudden somebody would be out on the street rather than on their property. Granted, it's not the best of shelters, but at least it's his property at this moment in time. And so I don't want to follow that route. However, I will state that I'm really disappointed to hear that in the past week, there's been changes when there's been a year or more that we've been looking for that change. And if I was the neighbor, I would be very upset about that situation. And so in 45 days, I don't know what the process is. Will it come back to us to approve of the fines, just like we're seeing right now? Because I just want to make the statement, if that's the case, I will not be as easy, because I think that it shouldn't take years to fix this issue. There's a way to clean it up. There's a way to meet expectation. I don't think that code enforcement is asking for miracles or asking for things that are out of the order. I think that as neighbors, we need to be neighborly, and that means keeping a certain level of cleanliness on our property, and this is not what I'm seeing. So I'm hopeful that in 45 days there will be some drastic change, or else I will not be as friendly.
It doesn't typically come back to us. It's just, that's the order.
Yeah.
Okay.
Yeah, I'd like to clarify something if I can.
So this is the non-odor abatement that's being requested, and yeah, I would agree. It wouldn't come back to us. So at this point, obviously, what we'd be doing obviously is either looking for action from the board. Obviously, this is Supervisor Crandall's district. I don't know if you're prepared to act one way or the other. Go ahead.
Yes. So if we were to initiate the 45 days, would that be where I would enter it? Should I enter it into the motion here to move forward within 45? With it not conducted within 45 days, code enforcement would obtain a warrant and pursue an abatement action to remove trash, junk, debris, and storage items. Is that how it would read, Anita?
I think that you can go forward with the recommended action with the caveat that the property owner first be given 45 days where code enforcement staff will work with him to come into compliance, yes. And if whatever order put that in, you can put the time frame in your motion, sir.
Okay, so
from the CDD perspective, just want to, if I may, support that if that would be the correct course of action that CDD code enforcement would take if at the pleasure of the board.
Thank you, Takara. Go ahead, Supervisor Crandall.
I would like to motion to code enforcement staff's recommendation that the NON OTA dated 2/14/2019 but be upheld and authorize staff to move forward after 45 days of allowing Mr. Shank to clear the area with obtaining and after 45 days, if it's not conducted, obtain a warrant and pursuing an abatement action to remove the trash, junk, debris, and other storage items from the subject.
Second.
Thank you, Ms. Crandall. Is there a second?
Second.
Supervisor Sabate seconds. Johanna, would you please do the roll call?
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Aye.
Thank you.
All right, with that does conclude our public hearing. Mr. Shank, thank you for coming, and also code enforcement. And that concludes this item.
One more option before you conclude. I have a temporary electric pole permit. I need my power and water permits so that I can can continue to work. I've been working there without electricity.
Mr. Shank, the board, obviously we know that there are multiple issues with this. But we have taken action as the board, got 45 days to hopefully work with folks on the third floor to get these issues cleared up. And, we wish you good luck on that. We
need clarification on the materials. Whether if I want to be able to, the materials there are for the fences and for the foundation for the cottage.
And Mr. Shank, your opportunity for making sure that those that CDD is aware of that is to go up and speak with community development as they are going to be working with you to make sure that you meet what their requirements are in the next 45 days.
Thank you very much, and
thank you, Mr. Shank.
My case submitted, and I hope that you resolve this.
Thank you.
Thank you.
Thank you.
All right. Okay, we're moving along with our next agenda item 6.4, our 11 a.m. item. Thank you for being patient with us. Consideration of an ordinance of the County of Lake Board of Supervisors to provide for graduated levels of enforcement of public health orders through education and training and the imposition of administrative fines. And obviously, I know we got a lot of people waiting, both online and in the room. So Supervisor Crandall.
Yes, so returning to our board with an ordinance for consideration, which if approved, would focus on education and training around the need for compliance with public hearing orders. Continue to be grateful to the Blue Collar Committee for their work in this regard. A couple months back, to go back a little, that there was an urgency ordinance that was brought to the Board of Supervisors that wasn't voted on. And I know one of the statements that was made was, would this ever come back? And my comment was, if it was to keep businesses open, it would. I'm not bringing forward an urgency ordinance today. I'm bringing a non-urgency ordinance The draft ordinance that they worked on was actually done also as a measure because in that group, they knew that eventually it would come to it, so they were working on something more palatable for the group, and I appreciate their work on it. Their draft ordinance is attached, and it's been a part of it, and last week we tabled it for this week so we could have more of a discussion about that. And more recently, we've had some other drafts brought by community members, or if not just drafts, but just input, and it's also attached, and I'm appreciative of those efforts as well. In the ordinance I'm bringing forward today, if a violation is determined to be occurring, an enforcement officer will contact the responsible party and request correction while offering assistance in the form of training or information to achieve compliance and allow a reasonable time of not less than, I think it says not less than 5 days, but I think in the ordinance it says 10, but please note that the mere receipt of the complaint does not conform, that there has been a violation. Complaints will first need to be investigated by making contact with the responsible party. No informal enforcement as described above and is unsuccessful, the enforcement officer will issue a notice of violation that provides up to 10 days to make a correction. Actually, that's what that is. In those rare cases where the violation is still not corrected in 10 days, the enforcement officer may impose an administrative fine not to exceed $100 for the first violation, $200 for the second, and $500 for the additional violations within 1 year of the first. Any party subject to a notice of violation may within 10 days file a written appeal with our board. Appeals will be heard by our board, allowing the party an opportunity to testify and present evidence. Our board will make the decision as to whether an administrative fine will be imposed. With hope, we have moved beyond COVID-19 crisis. The ordinance will sunset on October 1st, 2021, unless further action is taken by our board. Another reason that this was brought forward is also because we've been talking and discussing about how the state is making claims that if we don't comply or have enforcement measures in place, that it would jeopardize our CARES Act funding, and so that's another reason why bringing something forward, regardless of what it is important. And for me, not sure if this is a solution to that. However, I feel it is an olive branch to show that we are moving towards compliance. It also wouldn't take into effect if brought forward until mid-September, which is the ideal time that we talked about for flu season and sickness and all of that, when things would possibly, Dr. Pace had stated, would possibly start rising. This would be during that time frame. And so that's really all I have for now. And I know a lot of people have some things to say about it. And my biggest thing about this is bringing everyone together to have a collaborative approach to see where we can go, having some sort of ordinance in place.
Thank you, Supervisor Crandall. Any other comments from board members at this point? I know there are a lot of folks waiting, but go ahead. Supervisor Sabatier.
All right. Thank you very much, and I hope that we can have a very constructive and productive conversation here. As Supervisor Crandall mentioned, this kind of started, I believe it was June 13th that the urgency ordinance was brought to us. We now find ourselves August 11th. And obviously, it's always a strategy on how we're going to figure out what we want to get passed. And the strategy now is that last time it seemed like there might have been 3 votes, and this time it would only take 3 votes to pass it. But it kind of goes against what the purpose of the ordinance is, which was that it was urgent. And so now it doesn't feel so urgent, and so it doesn't feel right. So something strange to me. On the other side, I just kind of chronological order of events, and these are things that I agreed with. These are things that we agreed with as a board, maybe not as individuals. We shut down our county prior to the state shutting down, and we did that in order to ensure the safety of our community based on what we knew was eventually going to arrive, and it eventually did arrive. April 5th was our first case that we had here. But we asked people to shut down and shelter in place prior to ever having a case. I'm not against that decision that we made, but it was a decision that had an impact. And we fought hard, maybe again, not as individuals, but as a board, to try and regain the trust of the state to reopen. And the state pretty much hand in hand walked with us every step of the way. Maybe we were asking for things that were already being worked on, but every letter that we sent, less than a week later, we would see those things reopen. Now we have this situation of the watch list, and the watch list feels a little bit like a threat, because if you're on the watch list, these are the bad things that will happen. These businesses will close, so on and so forth. And in fact, I feel that our last few weeks, if not last month or more's report, has basically been followed with, we're managing it well. We are containing the potential outbreaks, or we're containing the potential spikes. Even though there's some kind of doom and gloom that comes with the reports, because COVID-19 overall, that's just not a positive subject matter. Overall in our county, we have been showing that we've been doing some things well. And this is why I was really focusing on the positivity rates earlier, because it's not that it's an unimportant number. It's not that it's just a random number. It's one of the major numbers that the state is using on whether or not we're going to have to force some of our businesses to close again. So we have that potential doom and gloom of the watch list, and I'm 100% sure that it will come back and be available to add more counties to that list in the near future. I doubt the state's going to drop that, and at least drop it, but keep all the others on the watch list. That just doesn't make any logical sense to me, that the state would do that. So I just think it's still a doom and gloom of the potential future. And we got to look at what's happening today. We got to look at how we've been doing in the past months. We've seen a rise. I think the most we've had was 44 cases. Then we dropped back down almost to 11 cases, and now we've just been kind of hovering and going up and down at maybe about just below 20 and then just above 20. And it seems that we are still able to manage what we're doing. Our positivity rates, I believe the lowest that we've had in the past month is about 2.9%, and the highest that we've had is about 5.5, and today we just corrected, it's not 6.5, it seems to be 3.09, but I'll still put an asterisk next to that, because again, we need to make sure we have the right process to make sure that we are getting the exact number. But it's vastly different numbers, 6.5 and 3.09. And so we need, that's why the data is important to me, because when we're discussing these types of things, we need to make sure that we are looking at facts and truths of what we are seeing versus just a number that we are taking as fact from someone else. And I think if we control that data, then we know a little bit better of exactly what's happening on the ground floor. So we're in a situation where we're doing fairly well. Every single county around us is not doing well. Sonoma County has had over 100 plus this weekend, over 100 plus each day of new active cases. Yesterday, I believe it was in the 90s. The week before, it was hovering between 60 to 125 a day. On Friday, Mendocino had 96. I believe it was 96 active cases. As of yesterday, there are 160 or 180 or something around there. I forget the specific number. I can bring it up on my computer. So, I mean, these are areas that have been a little bit more entrenched in the issue of COVID-19. They have the masking mandates, and I am not going to say that the masking doesn't work. It helps. At the very least, it helps. It's not going to save us from everything, but it helps. But the idea of penalties is where I have trouble. I'm all for saying mask up, be safe, let's help each other out. But the penalties is, do penalties actually give us the outcome we're looking for? We're looking to change behavior here. I got an article through one of our staff members, and it basically said in there that obviously masking does help, but it is the risk assessment that the public makes of the situation that's going to really make the impact of if people are going to mask up more or not. It's not an order. It's not a law. People smoked pot. It was illegal. Okay, just because it's a law doesn't mean we're going to see changes in people's behaviors. People change their speed of their car when they see that the road looks dangerous ahead. If not, they speed up. Same issue we had in COVID-19. People were going over 100 miles an hour because the highways were closed. They felt safer to do things that were dangerous. So we're looking at places like Sonoma County and Mendocino County where their numbers are definitely increasing in ways that would not be comfortable. And so to make the comparison is almost apples to oranges. Yes, the virus does not see borders and jurisdictions. It crosses them as it feels and will do so. But we have been doing a good job, and I think that when we have the doom and gloom of the potential watch list threat from the state, that at this moment in time, we should be looking at building cooperation and collaboration and trying to offer incentives for people to do the right thing, not more threats. We all feel threatened by the virus, whether we're worried about our health or other people's health, or we're worried about the economics of the situation. We need to stop being afraid and stop saying thank you. Saying thank you for doing the right thing. Our numbers are low, not because we said something, but because we did something as a whole, as a community. We don't have the power to change everything that needs to be changed. That's not where we live. That's not how it works. We need people's buy-in to make this change. I am looking for an ordinance that provides an incentive and a carrot to say, if you're doing what we're asking you to do, we'll provide you some funding to help you pay for those masks, to help you pay for that sanitation, to help you pay for the extra mile that you've gone to help us out. I get so many complaints, and I've taken those complaints seriously. We said that we would go after each and every complaint that we receive from public health. Some of them are serious, and some of them are downright just ludicrous. I walk into a store and I can't see anything wrong for me to talk about, but yet I've received the complaints. The last thing I want to do is for us to ask for some of our staff to go out and go after these ludicrous complaints because they're the majority of the ones that I receive. And I think it's because we have a lot of fear. And again, whatever your fear is, it's there. We have been shut down for a long time, and that's shelter in place, not just shut down our businesses. We're all in a different mind state right now, and our emotions are bubbling right now in ways that they have not done in a long time. And I think that we need to recognize the power that we have, and we can either use that power to threaten, or we can use that power to help each other. And I think this is the time that we help each other. What I'd like to offer, and it's a compromise, because I know that, or at least I feel I know, that there's the 3 votes that you need for this ordinance. So I'd like to make a change. And I would say, if you're serious about what you want to do, it needs to be an urgency ordinance and not an ordinance, because that makes no sense to me anymore to say 40 days later from now, or I guess 37 days later from now, it's going to be enacted on, because an ordinance, once read twice, still takes 30 more days to go in action. So that just, to me, if we're serious about that, then we shouldn't be serious about making a normal ordinance. It needs to be an urgency ordinance. I also believe in us as a county and a people that we've been doing the right thing, and that our positivity rates have not reached that milestone of the watch list. This is why we're not on the watch list. So I think we need a tiered approach where there's an action plan, where if we reach a certain milestone where it looks like we're getting dangerous, and whether that's hospitalization, whether that's death rates, whether that's case rates or positivity rates, the state already sets these guidelines. We know what they are. Then we can say we're going to be a little bit more firm about following these rules. But at this moment in time, I don't think that we should be talking about being more firm about following the rules, because things are kind of going steady and staying flat. They're going up, they're going down, but we're not seeing a huge spike. And that way it puts the numbers in front of every single one of us. If we reach this threshold, this is when something is going to happen. Now that puts the onus on every single one of us to say, Should I go to this social gathering? Should I do this? Should I do that? Because we now know that there's consequences and what it looks like before we make a decision. Right now, everything's been so random of what, not random, but it's so almost surprising that here's a new order, here's a new order, here's a new order. And I'm not talking about us, I'm talking from the state. And we need to put some prediction in what our actions will do by saying, if we meet this threshold, this is going to happen. And if we don't meet this threshold, then we keep going as normal. I just think that we are dwelling too much into how afraid we should be of the situation. Again, that's both, whether it's economics or it's health. Health is important. If we reached a milestone, we need to be more firm. But that's my offer. Make it an urgency ordinance, have an action plan, and if everything happens the way I believe it happens, then that means nothing changes here. Even though the action plan will have a masking fine if we reach a certain level, I don't believe we're ever going to get there. We are isolated, even from ourselves. Our culture is isolation in itself. We will not see the numbers, in my belief, that others are seeing because of who we are, where we are, and how we live. And so I'm willing to make that compromise. The only reason I'm doing so is because I know that at this moment in time, with the way that I feel and believe, I'm fighting a losing battle where 40 days later we're going to have this passed anyways. If we pass this and we go down to a positivity rate of 1%, we're still fining people for not masking, and that just doesn't make sense to me. If we see that we are going into a danger zone, because if I lived in New York, I would say absolutely, things are just not going well, we got to do something. But we're not. But if we do get to a situation where it gets dire, then let's make that be a trigger point where we push ourselves to do better. But we need to do a carrot. We need to offer an incentive. Too often, just because we can raise taxes, too often because we can tell you what to do and make a law, doesn't mean that we should. And I think we need to hold ourselves back and maybe applaud our community for keeping those numbers low, because it's not because of what we've decided up here. It's because of what they've decided to do with their friends, their families, and everyone else. And I will say I have issues with how are we going to enforce this? Because I'm looking at all the numbers, and the state of California is being very opaque about this, about our Latino community being absolutely hit hard by this virus. Now, what I don't like is Latino community is automatically bunched together between those that have been born here, those who live here and have kids here and go to school here and work here, versus those that are transients that are coming through mainly for farm working type of activities. Well, if you split those two groups up, and we've discussed it in our press releases, we're going to talk a little bit more about our farm workers than we are about the Latinos who are just a part of our community, period. Just like any other person who lives here and plays here and works here. And the reason that their numbers are going up is because we're okay with the way we are kind of forcing them into an environment where there's too many per household or very substandard living situations. And I am not going to ignore that. That is something we should be discussing and talking about to slow down the spread, not necessarily our businesses, where we have never said that there's been an outbreak caused by our businesses. Is there the chance? Absolutely. Everywhere there's a chance. Everywhere there's a risk, and it goes beyond COVID-19. But let's look at what the real issue is on the spread, and let's solve the basic problem of why that is happening. I just feel like this is the easy way out to say we feel good about it. It's going to make sure we get money from the state, when I don't know that the outcomes are going to come out of just this. The outcomes are going to come if our numbers go up and people get scared and they're going to mask up. That is why people are masking up in Sonoma County and other places as well. So I would like to take a different approach. I'd like to be real about what we're discussing and what our problems are, because our businesses are not being highlighted on our charts. It's the social gatherings that are being highlighted on our charts. And I think that we need to look at ways to work with our community, because if we work with them now and we still end up on the watch list, they'll probably have more faith in us to follow what we need to do than if we try to threaten them now and then threaten them again later on with the watch list and having to close things down. So I just think that we're looking at it from the easy perspective without looking at, is it really going to give us these outcomes? So that is my offer that I put on the table. I'm sorry, it's a fourth ordinance idea, but I just think we're going about it the wrong way.
Okay, Supervisor Scott?
I'm a little concerned with waiting for another threshold when Dr. Pace is telling us we're already teetering right there where we could be put on the state's watch list. And once we're put on that state watch list, then we've already lost our rights to have businesses open. We've lost the rights to have students into school. So I think we have to be really careful about, what threshold are we looking at? I know people are saying, our numbers are low. Why are we even looking at this? But if it gets to the point of no return, then we've gone too far and we haven't protect our community and the rights that we want here. We want businesses to have the right to continue to open. So I kind of understand where you're coming from that, Supervisor Sabatier, but I'm concerned that threshold is going to be too high where it's past a point of no return and we can't do anything. We've already lost those rights that we're trying to fight to keep right now. I mean, I've said for months that we have to make sure we're staying ahead of this, and we've seen it blow up in other counties and other states where then it's gone too far. And we have done an amazing job here in the community. I know it's hard to see that because our cases are low. It's, damned if you do, damned if you don't. We've done the right thing. Our cases are low. We need to pat ourselves on the back. We've done a great job, but I'm just concerned that people are starting to ease up. Kids are going back to school. Lakeport Unified's having kids in class next week. I know Upper Lake and I think Lucerne's going to have kids in school. And so I just would like to get to make sure that we're staying ahead of this. However we can do this, we just need to stay ahead of this. Most of our businesses are doing the right thing, but there's still those out there that are blatantly not following the guidelines. And, I think, people say that, we shouldn't be harassing businesses, but it's naive to think that we're going to go out and attack businesses that are doing the right thing. There's going to be those that are blatantly not following the protocols. So I really do believe we need to have something in place. It's actually kind of sad that we even have to go this route of demanding people to please do the right thing to protect your community. For me, whatever I can do to protect the community, that's what I'm going to do. If it means, staying 6 feet, wearing my mask, so my businesses and the community can thrive, that's what I'm willing to do. And I would hope that everybody would want to do the same thing. Thank you.
Thank you, Supervisor Scott. Supervisor Brown?
So the term,
Supervisor Brown?
yeah, I'm here. So the term doing the right thing is very subjective. What one person thinks is doing the right thing may not be the same as another. And I'm not the right thing police. There also the comment was made, we don't want to lose our rights. Well, we've already taken the rights away from others. We've been doing that for 5 months. We collectively, I've tried to avoid that as much as I possibly can, but when somebody criticizes the board, they're criticizing all 5 regardless of how the board votes. I agree with Bruno that this pretend urgency that we've felt now for 5 months. I mean, last week we had a board member say we need to have this on this week because it's urgent. Yet that board member has not had one single thing on the agenda in 5 months that was meaningful to prevent anything. So it's all about appeasement and symbolism, in my opinion. The decision makers are us, and we're making decisions that ultimately affect businesses. If you say that there are many businesses that are doing the right thing, that doesn't mean they're not being attacked. They're being attacked every single day when we say we're going to put an item on the agenda. Even the threat of putting it on the agenda is a kick in the gut to real business owners, not somebody who's partially involved in businesses who their income isn't ultimately affected. We're still getting paid. These decision makers are still getting paid. The people that have mortgages or are actually trying to get loans, try to get a loan right now, given the conditions that we're in. If you're trying to get a business loan or anything like that, we talk about businesses that have closed down. There have been several of those, but the businesses that were really hurting, that were really affecting, are those that may have happened. We've been very fortunate in Lake County. We've had a lot of young people and other, older people too, who have thought, what, I think I'm going to open a business. I think I'm going to put my heart and my soul into everything that I believe in and do a business in Lake County. I'm going to buy a piece of property. I'm going to do this. I think it'll go well. Whether it goes well or not, that's not our business. That's their business. That's entrepreneurship. That's capitalism. That's the thing that makes America work. Whether you agree with it or not, it works. And when's the last time that you went to a ribbon cutting, or do you have any planned? Probably not, because no one is planning on putting in a new business in Lake County. So those are the ones that we're really hurting. The 5 months of do nothing but talk about it, I'm not going to question the intentions of any board member. I know how I feel about it. I know my convictions. If I felt this strongly about it, I would have called for a vote back in June 15th saying, I don't care whether I'm the only one or not. I've done it. I've been there. I've done that before. If I'm the only one or not, I'm going to call for a vote because it's my conviction. There's not been a conviction. There's a lack of conviction in really doing this, because the proof in that is that nothing's been done. Nothing's been done up to this point. I predict today we'll have an ordinance, one way or the other. I'm not sure which one it'll be, but I hope I'm proven wrong. But I think that there probably will be. We're sitting here today talking about an ordinance or a group of ordinances that actually penalizes businesses, when Dr. Pace said earlier, and he said it over and over again, and I would defy anybody to tell me that one single infection in Lake County is caused as a result of some business not being in compliance, or as a board member may think their definition of doing the right thing. Give me one example. This ordinance will be no different. It won't be enforced adequately as an ordinance should be, and the proof of that is the several other ordinances that we've brought forward, like the hazardous vegetation ordinance, the shelter-in-place ordinance, where there were fines and jail time even threatened in that. Is there one single person that was cited for that alone and convicted? No, there wasn't, and there's never going to be. But what we're doing is scaring good people from doing what they believe is right for their own businesses. I trust them more than I trust the government to do what is right. Again, this is appeasement. We have roughly 600, maybe more, few more businesses in Lake County, yet we have 65,000 people. So we're going to appease the masses who we've scared into a quandary here of, they have no idea what to do with themselves. I don't believe that's the majority, but they're the vocal minority, and we've scared them so badly that they're shaming businesses that again, we might define them as doing the right thing, but a member of the public defines them as not doing the right thing because they went in there with the intention of catching somebody without a mask, and they were successful in that. They have no idea why that person wasn't wearing a mask. They don't care. There are a lot of good reasons why somebody doesn't wear a mask. There's reasons that they can't ask for, but they have that. So you have these tattletales running and calling and complaining and whining and sniveling about somebody not wearing a mask. Well, they shouldn't have been in there to begin with. Stay out of there. If you go to a gym just to catch somebody not wearing a mask, yet you obviously haven't worked out your entire life, just stay out of there. Don't go there. There is money to be made off of this, and I stated that earlier. There's millions and millions and millions of dollars of taxpayer money, and we're going after those that are paying those taxes in order to make the government even more rich and buy more toys and do more things that they're going to make us grovel, us as taxpayers grovel for a few pennies in order to comply with their wishes. There is an agenda. I'm telling you, folks, this isn't some conspiracy thing. I can go through several things that this state has had in place for decades trying to pass. Now, all of a sudden, we have the best legislature leadership that union money can buy. and they are getting one thing after another that they asked for. They wanted prison reform. They're releasing 10,000, close to 10,000 prisoners. Some of those, one of those was a person who was convicted of carjacking and killing a 22-year-old kid down in Woodland, and she got 84 years. She's just been released because of COVID. So try to convince me that the governor or these folks who make these decisions are really concerned about public safety. No, they're not. They're more concerned about hugging a thug than they are taking care of those that are really doing the right thing in this county. The cost, you think the money's not a big deal. The cost of housing an inmate in state penitentiary is $81,000 a year on average. You release 10,000, that's over $800 million. 800 million bucks. And by the way, that $81,000 a year for housing an inmate, only $459 of that actually goes to vocational training. So maybe they should be talking about that for when these folks do actually get out at some point. Loss of volunteers. The unions don't like volunteers. They want to empty out the prisons because that will limit the firefighting force that we have. We usually have 4 to 5 crews just in Lake County alone. We have 1 this year. We're going to have 1. And that's because the firefighters union, the state union, has spent a lot of money making sure that we don't have volunteer firefighters and inmate firefighters, and they're getting ready to add 10% to the CAL FIRE firefighting force. That's what the real agenda is for them. Loss of mom and pop businesses, starving them out. That has been on the agenda for a long time. See AB 5 and SB 10. Now they're able to accomplish that. Starve out mom and pop and bring it back to the larger corporations that have union membership. Homelessness. Homelessness is a problem. We've had that for years, and throwing money at it seems to be the issue, how to deal with it with the state. You're not teaching these people how to take care of themselves or giving them the opportunities, giving them the tools to do it. We just throw money at it, put a roof over their head, and we feel good about that. That's okay. We've done that here in Lake County, and I had the opportunity to go down and check one of those out last week, and the heroin was flowing like ice cream. So, we're not dealing with that. We're not really concerned about their health. We're not giving them the tools that they need in order to become productive citizens. Instead, we just put a roof over their head and we pat ourselves on the back and we say what a great job we've done. But in the meantime, the taxpayers who are actually funding that are sabotaged and belittled and made to feel like criminals through actions such as what we're considering here today. If we want to be real about the spread, Bruno brought it up. I don't think we should do this, but if we were going to do this, why wouldn't we target a community that is actually, where the spread is really getting larger? You stop weddings, you stop funerals, you stop all these things, stop family gatherings. You go in and have your neighbor file a complaint against a neighbor who's got 300 people coming over for a wedding. Again, I don't want to do this, but they're not doing this because they don't want to be labeled as, targeting a group because, being accused as racist or anything like that. Our businesses are not the reason for any spread. We're going to go out and we're going to attack them and we're going to target them because they're easy to target. It's only 10% of our population. So they can't really stand up. I heard, change behaviors. We're going to change behaviors. We're not social engineers. We're gonna change behaviors to believe the way we believe as individuals up here. I'm not into that. If somebody, I believe in the rights of others, even to behave differently than I do. I don't care. As a grandparent, I'm going to tell you this right now. I'm done with this. I'm done with not being able to hug my grandchildren because they had a pool party where they had a bunch of friends over or anything like this. I'm telling you right now, I would rather hug my grandkids for 30 minutes than to live another 30 days. I'm tired of worrying about getting sick and all this other stuff. I don't care about that for myself. I want to be able to live my life. I don't need 5 board members who, to be quite honest with you, have had behaviors of their own. And I'm not talking about just us. I'm talking about, you got 5 city council, you got 5 board members in every county. You got 5 board members who have not given this much concern to health and what a doctor says until today, until now. So don't be hypocritical and then all of a sudden say, health has been my life, and I think that you should behave a certain way because I'm worried about all of our health. This is nothing more than a smokescreen, and I won't participate in it. The Blue Collar Committee has taken a lot of hits from people that are just, ignorant or running for office and want to be relevant. And they've worked hard on different versions. In fact, they're the ones that brought this up to begin with. And they did that because they knew that something was going to come down. So let's lead the pack and let's try to come up with something reasonable. I'm the lone man out on that. They don't, like I said earlier, they don't believe, we don't all believe the same and march to the same tune or anything like that. I told them right up front, I'm not going to support either ordinance because I think it's wrong. I think the concept of it is wrong, and there's nothing good that's going to come out of it. There will be no enforcement of it. Nothing will happen, but we'll make a bunch of people feel better. So I'm going to ask this right now because there's going to be people that are pissed off on both sides. When this passes, don't be pissed off at the whole board because I'm not voting for it. When it does pass and there's no enforcement, don't be pissed off at me because there's no enforcement, because I said there's not going to be any enforcement. I predicted that. So I'm just saying that right up front.
Thank you, Supervisor Brown. Well, a lot to talk about today. Obviously, the first time that we did bring an ordinance to the board, at least I put an ordinance on the board for the conversation. Yeah, you're right, Supervisor Brown. There wasn't a vote taken. I clearly heard that it wasn't going to be moving forward. So when I addressed that, it was all right. Well, let's look at we can regroup and do what we need to do down the road. I think that your comment was directly for me. So if I wasn't, you
there was four of the board members that could have voted on it.
It was a strategic move to look at something. For this county to stand up and say, no, we're not going to comply and have that done at the board level. Thought that would definitely make us down the road potentially, it could harm the county for all of our constituents, not just us and how we're voting. So when you look at this, we're all in politics and you have to have a strategic plan sometimes to get things done, even though I believe that it's just common sense. Common sense right now that this is a pandemic. There are 2 deaths in Lake County. I am not a doctor. So as we move through that, in the rest of my life, as my conviction is, when I was on this board, there were 2 deaths for COVID-19. And I'm hoping it stays at that. But the way it looks, it may not. So today's issue, when we talk about these things, as we move forward with this ordinance that's been presented today, I look at it this aspect. When we brought up the first ordinance, it was suggested that we as supervisors take the calls and we go out and we talk to business owners. Thought, okay, fine, that's the way we're going to do it. We've gone out and we've talked to business owners. What I've realized, and you all can speak about it, is, there are plenty of, that one person didn't have a mask. Well, they have an issue for that. So you work through those processes. But I've also walked into businesses where they say, we ain't going to comply. It's not real. We're not going to do it. Well, you're right. I don't have any power. I don't have anything. I'm not trying to do that. I'm trying to get this thing moved in the right direction. When you're looking at a public health order, at some point, there's got to be something that can be done to hopefully help protect our community and other businesses. And, it is unfair that we are, as a county, we have a mandated mask order. And what we don't have in place is an enforcement opportunity, so it's a level playing field for each and every business. And it also, today, I think in the discussions we're talking about, will give us an opportunity. If there's a masking order and there is an opportunity where folks could be fined or get a violation, that gives one more tool where we're not asking our businesses to step up and do this, but we as leaders of the community are at least trying to put something in place that will hopefully take the pressure off of them. Because I've talked to multiple business owners, and being a business owner, I've heard people, just are absolutely rude. You need to remove them or 86 them or whatever and get them out of the environment, because that is the environment we live in. There are multiple people, just like board members, that do not believe this is real. So that's their belief, that's fine, but go believe that somewhere else where we can run our business and keep it as safe as possible with what we decide on. As far as the watch list and other things that are talked about, we've talked about local control before. This is one more step that hopefully will keep us in local control as we move through this pandemic. Each and every one of us is tired of dealing with this. There's no doubt about it. I want to hug my grandkids. I want to, be with my family members that are sick and under the weather. Yeah, there's no doubt about it. you can't just throw your hands up in the air. We're the leaders, and today, hopefully we'll lead in the right direction. And there definitely are going to be people that are unhappy as we do this. But ultimately, like I said, after we get through this, we've overreacted. If I've overreacted, I will stand up and say that, or the community can, lose faith in whatever my leadership is. But right now, with what we've been provided and the information we've been given, and not just listening to Dr. Pace, paying attention to everything that's going on at the state level, other counties, on all these region calls that we have, other communities. I am part of a vulnerable community, the tribal nations. There are other calls going on, obviously, in our community to see what's happening across the state. And I think as of yesterday or Monday, there were 37 deaths of natives across the state. So this thing is moving through. It's getting closer to each and every one of us. I don't know anybody else on the board at this point that has gone through a case being brought into your business. At least I know at least 2 or 3 board members haven't. And it's absolutely, it's a terrifying situation. But the one thing that we know is the education from CDC, our public health department, and also educating our employees and their community and family members as we move through it. And each and everything that we can do to help just give one more tool in the toolbox of our public health officer here locally is something that we need to do as leaders. This is, and it keeps saying that, I've heard multiple times, we're punishing the business. What we're doing is just doing another tool to help the businesses remain open as they're moving through this process. It is a process. We are not going to change people's attitudes or habits. They haven't changed by now. The only thing that'll change somebody's habit that either believes in a mask or doesn't believe in a mask is someone who gets sick in their family or close to them. And then at that point, it is too late. Sitting on the diocese today, it was brought into the urgency ordinance first, and Supervisor Sabatier did offer up an opportunity maybe for a tiered system and an urgency ordinance. And, I'm excited at least to hear that offer. What that looks like, I don't know, but we need to get something put into place. So I appreciate Supervisor Crandall bringing up this ordinance at this point, the way it is. If by the end of the day, we make some corrections or we compromise one way or the other, all this is one more tool to move forward to help us stay open and protect our community. It is not a fear thing. Obviously, I'm not a scientist, I'm not a doctor, but enough of the information has been passed around. Even if you want to say half of the deaths are not, hey, they're not directly COVID-19, well, still, that may be a decision that, I've made on this board where we had one death. One death is too many for me. Maybe everybody else can sleep at night, but I think about the families that have been affected, not only by being sick, but losing a family member over something when it's politicized. I don't get it. And, I'm going to have to live with that for the rest of my life. And I do weigh on that every night. So, I appreciate it. Everybody's thoughts, everybody's opinions, but I do believe that we're moving in the right direction. And obviously, I've had folks write me very nice letters, and I've had folks write, some hateful stuff, even wanted to get into racist and all this other things. So that's part of what we do. But moving through this process is not easy. But I think what we have in front of us today gives us an opportunity not to appease, but protect communities that want to be protected, equal the playing field for all businesses throughout the county. Also support our public health office and everyone else working in that manner on this pandemic to just have one more tool to make this thing solidified as we move through the process. Not everyone is going to be affected. It keeps being a doom and gloom situation, on the ordinance. If it's infected, you're going to attack every business. That is not the case. We are looking, obviously, on folks that would, if you read the ordinance, repeat offenders, or folks that are just putting it on Facebook that they're not going to comply. They don't believe it. It's not right. And that's really going to be the focus. Education is the focus of this ordinance. And we're going to continue down that path the best that we can. And nothing is a silver bullet. Nothing is going to protect everything. We may implement an ordinance today and 4 months from now be in a dire situation still. But we need to look back and say we tried to do everything that we can. And, you know, those are my thoughts on things. And ultimately, everybody is going to have their own view. But as a leader and as the chair of the board this year, and one heck of a year, I think I can say probably the most tumultuous year ever for a board chair. You know, we need to get one more thing put into place. And this just doesn't end the battle. There's going to be another battle that comes up next week and the week after that as we move through this. Schools reopening, how we're doing those things are all going to be a challenge over the next 4 to 8 to 12 weeks as we move through this. And I appreciate the conversation. Supervisor Sabatier.
I just want to clarify a little bit of what I said because I was talking a lot and I forgot to actually have closure on some of my points. I want to discuss our farm worker community. Again, the issue is not the farm worker. The issue is the environment in which we place them into, which is a dangerous situation when it comes to COVID-19. It's already unhealthy on a regular basis, but it's exacerbated by COVID-19 now with this spreading around. We're seeing it throughout the state. Governor Newsom constantly talks about Central Valley being an issue, and the issue is erase the ethnicity, and it's about the environment in which we allow them to be placed in. I mean, right now we look back in the past thinking slavery was horrible. I'm sure in the future they'll look back at us saying, how can we allow us to treat people like that who have brought food to our tables? So that's something that I hope that we can continue to focus on and to create a better situation for the future, not just today. But also I'm worried about, we have another conversation happening in our nation, and it's policing. And are we going to hire somebody who has gone through the appropriate training of anti-bias curriculum to not see, well, the highest percentage of those who have cases throughout the state of California, surrounding counties, and most likely here, I don't know, we don't have our ethnicity breakdown here, is Latinos. Does that mean that we're gonna be looking at Latinos the most for ticketing? And it takes a while to go through that training. As a police officer, you go through that training, and we're looking to potentially hire new people. What level of training will they have to make sure that we are not looking at a potential issue of discrimination in these situations, whether it's business owners or whether it's individuals? Because we talk about businesses a lot, but this new ordinance that we're looking at is also based on individuals walking around without masks. So, I mean, I'm concerned about everything that we're looking at. I mean, I'm so confused as to where we're going, and I know that there's dangers, and I know that there's things that we want that we can't do, but we are breaking the idea of equity to a degree that I'm just not sure how long it's going to take to come back. Who has the ability at home to allow 4 of their kids, including parents, to work from home? Do they have the internet access? Do they have the quality internet access to make that possible? Who's going to make their kids go back to school when it's a hybrid? Those who can't afford to keep their kids at home. And so, I mean, to me, we're allowing this inequity to come back to a level that is just really bothersome for me and worrisome for me. Yes, we need to be safe, but at the same time, we're completely ignoring that those that are going to be the most affected by the decisions we make are those at the bottom of our social ladder. And we need to figure out a different way to do this, which is why, again, I'm just going to get off my soapbox, but we got to look at ways to help our community, not ways to threaten them into making sure that they do what we want. We have that opportunity to do this. We should take it, because we are in a position where we're not doing horrible in our county with the numbers we have. I'm looking at our hub right now. It's got a breakdown of the type of the source of cases. So we have 240 cases as of yesterday. 116 of them are from close contact to a known case, household, family, friend with recognized significant contact. 116 out of 240, that is almost exactly 50%. We have 33, which is the next highest other than the other stuff that's still under investigation, which is 54. 33 is other and unknown. Granted, if we knew, we have a category for presumed community transmission, and if we knew, we have a category for presumed occupational contact. The next level is out of county contact to a known case, which is 24. Presumed community transmission is 7, and presumed occupational contact is 4. If the issue is contact to a known case, if it's in your family, it's probably going to get spread within your family. That's just yes. If it's from social gatherings with a large family, then that is an issue that we need to be looking at. If it's from going out of county, I don't think that our rule will change what we anticipated to change. In fact, I just gave you numbers from other counties where they are doing what we're asking to do, and those numbers are jumping through the roof. It is how we behave, not what laws we put on the book, that make the change.
Well, Supervisor, I guess when you're talking about other counties, they are in the same position in the conversation we had today. Waiting to react always put you in a bad position. And that's what we were having the conversation. What I'd like to see, if that's the information you're going to present, would be the dates when they enacted those urgency ordinances and other things and how those numbers correlate. Because what I've been watching from the other counties is their reaction to something. Instead of being proactive, they're being reactive. And what we've been attempting to do here in Lake County is always be proactive. And I think we've done that from the beginning. I think the final missing tool is the enforcement part, and that's the conversation we're having now. So I appreciate what you've given, but finding out when those ordinances were enacted and how they affect those numbers. Because remember, what we've always talked about, we thought 2 weeks from something was it, but really it's probably 4 to 5 weeks. And I can have Dr. Pace talk about this. The time frame of things that were thought about in the beginning of a 2-week situation, some of them were coming up for a month. Memorial Day was affected in June, and it would jump like that from July 4th to August. So I appreciate it, but it seems like those are reactive in some of the conversations we're having today. Supervisor Sabatier?
And just to finish up as well, with the businesses that obviously that I've gone to based on the complaints that I've received, that there were issues, in my conversations, granted, it's not all the same. Every store is different. Every business owner is different. Every approach and the way the approach is received is different. I've seen changes in every single one of them. I think that there are ways to continue education to make sure that we keep the numbers where they are. We always knew that reopening would lead to higher numbers. It was about managing it. And every week, week in and week out, we are stating that we are managing it, and we need to continue on the same path. I just don't think that this is going to make the change that we're looking for. I think we got to look outside of what others are doing. And granted, we don't even have the rules in place. And July 1st, by the way, is when Mendocino started fining. August 6th is when Sonoma County went a little bit harder. And I would suggest to you that we still have a masking mandate. We never changed it from May 21st. It's never been rescinded. We have an enforcement that we are doing, and it's called education. And there is no way the state would say, you're not on the watch list, you actually have your mask mandate, and you're doing education, it looks like you're doing well, we're not going to give you the money. I am not afraid about the state's money being pulled away, because it would be absolutely worst case scenario for them to do so, because we would have a lawsuit on our hands against our state. We are doing well, and we deserve to get that money to help us out to continue the work that we're doing, not hold it as a carrot so that we can push more people into a position where they're already doing a good job. And so it's rough. It's rough.
Yeah, it definitely is. And, I think we have done the education part. But what is missing is the enforcement, and that is what we're having. Education doesn't come with enforcement. Supervisor Brown?
So a couple things. One, I don't know of any board member, including myself, who said this is not a real thing. That's a blatant misrepresentation. The flu virus is a real thing. People can get it. People can get sick. There are people that can actually die from it. Very few. But I don't think it's worth all of this because of that. So that's just want to make it clear so that my comments aren't misrepresented. I'm not sure who else may have been spoken of in that regard, but that's my position on it. The other thing that I wanted to say for clarity, because we do say things up here that sometimes are taken they're taken badly. And one of the things that I heard a minute ago that I wanted to clear up is the farm workers that we have in Lake County are not treated as slaves. If you have the time to go and see some of the operations that are anticipated with the pairs coming up now, right, and they're actually in effect right now, and then moving on into the other harvest groups, the owners of those businesses are taking a lot of extra precaution. They're housing them separately. They're doing everything they can. Although I will tell you, having been out there, when the day is done and work's over, those folks aren't going home to shelter in place. They're going to hang out with their friends, hanging out with their families, and they're doing things that it has nothing at all to do with the owners of those ag operations. So I just want to make sure that that's.
And I never used the word slaves for this specific.
No, you said slavery. Yeah. You did. You mentioned farm workers, and we shouldn't be treating them as slaves or use the word slavery. I know what your intention was, but I can tell you, as somebody who's been misquoted and misrepresented thousands of times, we don't want that to happen, because we do have our farming operation is a big part of our community, and they are doing some really good work. And so we could go back and forth. I want to get down to what the other board members think, what the public thinks, but I'm going to go back to this thing. Another tool in the toolbox. I've heard that a million times when rationalizing ordinances, and I'm going to say this again. When the job is washing a windshield, you don't need a hammer as a tool in your toolbox. So that's where I am with it. And the other thing of education, that's another subjective term that, I go back to the old adage that those who can do it, do it. Those who can't do it, educate others on how to do it. So I'm more inclined to let the businesses do it on their own than to have a government entity come in there and say, this is how we think you should do it. And if you don't do it, you're going to be subjected to these fines, because I think that's just silly.
Okay, Dr. Pace, before we open it up to the community, I just wonder if you have any comments? And I guess that's a no. Yeah, we can't hear you.
Thanks. Yeah, he wouldn't. He had to unmute me. Well, thank you. I appreciate this discussion going on, and just a few quick points. You've already heard me a lot this morning, and be interested to hear what the public has to say. But I think the main thing from my point of view is that there's concern about lag times here with this. So part of what when you actually do put some measures in place, it takes a couple weeks before you see the effect in terms of case rates and positivity. And so, to wait until triggers come on is kind of too late. And that's partly why and this is going to take 40 days before this gets in place anyhow. So by then, it's hard to know exactly what the situation is going to look like. But I suspect it'll be similar, and we'll be starting to move into flu season. So to have the way to intervene when things are not going the right way seems like a really good idea to me. The businesses are doing pretty well, and it would, this really isn't about going out and finding businesses and shutting down businesses. What we're doing now and what we will continue doing is going and talking to them. If we get some complaints, we would go out and talk with them and see what it looks like. And certainly individual patrons coming in and not wearing a mask every business can't be responsible for all that. They would, if there's a general sense that they're doing the best they can and things are going pretty well, then that's really what we're looking for. It's not to go in and find people and shut people down for when they're doing the best job that's possible. I think the ability to be able to intervene with people that should be masking and aren't, or to be able to go address large social gatherings that shouldn't be happening, and that where we go talk to them and they basically don't really comply, to have the ability to do some citations would be a good thing. I think, the farm worker situation, we're doing a lot of I agree with Supervisor Brown, the ag community is working really hard to try to keep this virus out of these congregate living situations, these congregate work situations. We meet pretty regularly. They've been extremely engaged in trying to do everything possible to keep people safe, and I've really appreciated that. And it's a high-risk group. People are coming in from the Central Valley now to be picking, and the ag community is really working hard to keep this under control. And if there does become an infection, I'm hoping that they contact us right away so that we can help them think through how best to manage this. I have a bunch of other things, but I think that the last piece of it is, a lot of the folks earlier were talking about the science, and the science is actually, it's been a little bit ambiguous in the beginning. There hasn't been a whole lot of studies done earlier on, but now they're starting to do some studies. It's pretty clear, two things that are becoming clearer as we get further along in this from the scientific study point of view. One is that it does seem that there is some protection of the person wearing a cloth face covering. It seems to decrease the load of the virus that the person gets exposed to. So some of the studies now are showing that people that are wearing cloth face coverings are actually getting less virus transmitted. So they may not completely prevent illness, but it seems to decrease the severity of the illness. And the other thing is, it does seem pretty clear that it can protect other people around you. That's certainly been the experience of our contact tracers locally, that when people are wearing masks, the folks they've been in contact with are much less likely to get a positive result on their tests. But it's also, they've done some studies now that show that, an N95 mask protects the best, but then the cloth mask decreases the distance that the droplets get propulsed when somebody coughs or sneezes, and then no mask at all, it can go up to 12, 15 feet, something like that. So we are starting to get a science now that looks at this and starting to understand it more and more. It hadn't been looked at that effectively prior to this, and that was part of the confusion early on when the CDC said not to wear masks when they changed. So, I think I don't expect to change a lot of people's minds that are reading a different line of literature, but I would just like to say that keep your eyes out, because the science is starting to get much clearer about how this does protect the people that wear the mask and the people that are in proximity to people that wear it. So overall, I appreciate that we're bringing this up again. I know this is a divisive issue. The point of this is not to shut down any businesses. It's actually to keep things open longer and allow us to stay off the watch list and keep local control here, because once we get on that list, then the state has a lot more involvement with what we can do. And so I'll stop there. Thank you.
Thank you, Dr. Pace. Okay, any more comments from the board at this point? If not, we're going to go ahead and open it up to our community. All right, seeing none, we're going to go ahead and open up our public comment. We will start with the virtual room with the hands that we have up. After that, we will move to the board chambers, because I know we have folks in there waiting. So we're going to go ahead and open up public comment. So Jake, we can work through the hands up here in the room. That'd be great.
All right, the first hand we have up here is from Stan. Stan, I've sent you an unmute request. Looks like you're unmuted. Will you go ahead and confirm your first and last name?
Hi, Stan Snow. Can you hear me?
Yes, we can hear you.
Okay. Well, I'd just like to keep it quick. So I'll say thank you, Supervisor Brown and Bruno Sabatier, if I said that right, for at least considering the alternative views. I think the rest of you mean well on the board, and Dr. Pace too, but I encourage you to look at some other data in regard to masking. consider the health damages that are being done to the county along with economic damages that have been going on since February. Suicides, domestic violence, maybe Sheriff Martin can comment on that increase. And mostly the overall damages that have been done. OSHA violations that are being encouraged with pretty much all of the workers in this county, which used to be something you'd have to have a pulmonary function test for before you actually go and impose masks on every worker in this county. Cutting off their air supply, suffocating them, forcing them to not even breathe fresh air daily. And that's where you're getting a lot of people ticked off in this county, and it's going to potentially open up the county and individually supervisors to liability. So that's all I have to say. And I just encourage you to maybe take a vote, think about it another week or so, and research it more. Thank you.
Thank you for your comments. Okay, Jake.
Okay, the next hand we have up here is from Paul Marchand. I hope I'm saying that correctly. I sent you a unmute request.
Yeah, and I'm here. I identified myself earlier. My name is Paul Marchand. I'm a practicing emergency physician. Having been on the front lines for 36 years and also being on the front lines of the pandemic, I have seen people die of COVID. I have seen cases of COVID that are virtually undetectable in terms of any history or symptoms. And what I can also say is I want to echo Dr. Pace's remark about there's a lag time, and that's very important because it really fits into what Supervisor Sabatier said. Being reactive is probably not an appropriate approach. And I'm going to weigh in with that because I personally believe that some of the remarks that were made were about social distancing and about inhibiting people's activities based on reacting to increases in numbers. One of the things that was also brought up is Lake County was very proactive. Very early on, we were one of the first counties to put in some recommendations, at least. And so I think being proactive is very important. A lot of the difficulty in enforcement that Supervisor Brown has alluded to is very justifiable, but I also say that we have to make an effort to do that. People are looking to the supervisors for leadership. We're looking to the supervisors to be proactive to protect Lake County. We are surrounded in the state by people who are doing much worse than we are. Does that mean that we've done everything right? Maybe. I also think it maybe means that we're lucky. But I also will say that maybe it's because we have been proactive. And I would consider what I think is a good course of action from Supervisor Sabatier about making this an urgent thing and moving forward on it more rapidly and being more proactive. As supervisors of the county, you're here to protect our rights, but also to protect our existence. And that means protecting ourself or our health. And to do that, I support strongly moving forward with an ordinance. You need a carrot and a stick to get the best possible learning. And as far as I'm concerned, I feel very comfortable in saying, and I do have a business, I have a horse boarding facility, and we do public venues. And I would welcome the opportunity to make my customers feel more safe by having an ordinance. I would welcome that. I would hope that it would improve my business.
3 minutes.
Because we would have an ordinance that people would look to and be able to follow, and there would be consequences if we did not follow it. As far as I'm concerned ethically, the other thing that I will say is I think that your right to hug your grandchild ends with your right to spread COVID to my daughter. And so all I'm going to say is we're in a situation where if we don't act collectively to do something, then all I'm going to say is we've shirked our responsibility. And I'm going to leave you with that thought. Thanks very much.
Thank you for your comments, Mr. Marshall. Okay, Jake.
Okay, the hand we have up next is from Nathan Maxman. Nathan, I've sent you an unmute request. All right, looks like you're unmuted. Will you please confirm your first and last name?
Nathan Maxman, Lakeport.
Thank you. We can hear you.
All right. So other counties have waited until they had problems to put an ordinance into place. Lake County has a chance to be ahead of it. I'm currently on quarantine from Mendocino County because of actions somebody else took outside the office. It would be interesting to know if there was communication about that between the two counties. Ultimately, the biggest problem from what public health officers all over are saying is gatherings. This ordinance really doesn't help with that because it takes 15 days to be able to do anything, to be able to issue a citation. You can go tell them, okay, you have to stop. But for 15 days, there really isn't any action taken. So there needs to be a tool to address it a little more immediately. And the fines for businesses really should be higher because at the level they're at, businesses can look at it as that's just the cost of doing business. It's not significant for most businesses. And maybe come back and reassess it in 30, 60 days after it's been in place and see if it's been effective and make sure the enforcement's been non-discriminatory because I've heard some concerns about that. Other counties have been concerned about it. Maybe come back and reassess it at that point. And ultimately, you guys are the appeals body for it. If you guys feel that a fine isn't warranted, you guys can get rid of it. So it kind of still falls to you. That's all I really have.
Thank you. Okay, Jake.
Okay, the next hand we have up is from Melissa Fulton. Melissa, I've sent you an unmute request. All right, looks like you're unmuted. Will you please confirm your first and last name?
Thank you. I have some statements that I wanted to make, and I want to make a clarification that although I am the CEO of the Lake County Chamber of Commerce, our board has not discussed these ordinances officially at this point. So my comments on this particular item are those of Melissa Fulton, a member of the Blue Collar Committee, a resident of the county for 30 years, and also involved in the current project to distribute 142,000 plus masks around the county. There was a statement made concerning the effectiveness, or rather the existence of ordinances such as what we're discussing today in both Mendocino and Sonoma County. And I'm wondering if anyone has any information on how effective those ordinances have been, what has been the action of those two counties imposing those ordinances. And another thing, this whole pandemic, and we're very aware of this, is creating situations of friction and anger between our residents, such as I've never seen before, and probably none of you have. It's made some of our residents feel that they are the conscience of every one of us, and that has to change. And I don't think, again, my personal opinion, I don't think the existence of an ordinance is going to help in that matter. I think it will only make it worse. I think that the current distribution of these masks will help create more awareness than any ordinance ever will. And it's already been stated that these ordinances are extremely difficult to enforce. And so therefore, we're putting into place perhaps ordinances that will create more divisiveness, more friction, more anger, and not in any way be effective to correct the problem. I think education, which I believe Dr. Pace has mentioned, and which I believe this new free mask project can enforce. Education is the way to do this. So, and my last comment has to do with the fact that it's been made very clear that the social gatherings are the source of a lot of the cases. Dr. Pace has repeated that more than once. So if those are the cases, now we're asking friends and neighbors to police each other and report on each other if in fact they see social gatherings. Another situation where we're creating enemies of friends, of people who used to be friends. I just don't, we're reinforcing a negative approach to a very serious problem. So as an individual, and I've read both ordinances, I'm just not convinced at this point that any type of ordinance is going to be effective. I think we need to concentrate on education. Tina Scott put out a challenge, a mask challenge, and I have been named in that mask challenge, so I'm naming my 5 people, and I'm going to continue that process, which again is not creating any negativity. It's creating awareness of the fact that we should all be adhering to wearing masks. So thank you, Tina. Thanks to Gary Diaz who challenged me, and I am putting my challenge out today. So thank you for allowing me to speak on this matter.
Thank you, Ms. Supervisor Sabatier.
Yeah, I want to respond a little bit to that because I did do a little bit of research, at least for last week's meeting. I contacted Sonoma County, which, as we know, just on the 6th, they started the penalties for masking just in the public themselves. So they didn't really have any relevant data to provide for me, but Mendocino did provide a little bit, and granted, it doesn't give a clear picture of how it's working for them, but they had 103 complaints on businesses. 95 of them had worked with code enforcement in order to comply. They were still working on the other 8. 2 businesses, one has actually received a notice of violation because of the lack of compliance. Sorry, I got distracted by the other voice. And then the other business actually got a $10,000 fine, which currently is being appealed. And so we'll see what the Board of Supervisors in Mendocino does for that. As far as the public for not wearing masks, I was told that it was maybe about a half a dozen or a dozen citations that had been submitted to those folks. But it's hard. The majority of what they're doing is education. And I don't have any specifics to show positivity rates have gone up or positivity rates have gone down. So just providing the data that I collected, unfortunately, it doesn't provide enough foundational information to say whether or not it would work. I think it also depends on how iron-fisted it is, and I think most communities are trying to do the education piece, which is what we're doing, which means they would see similar results just like we do.
Yeah, and that's really that's the intention of this ordinance also, is to work on the education portion of it. Obviously is what the heavy-handed part is, education before fines. So Jake, we got 5 more hands up, and I know we got people in the room, so let's go to the next one up.
All right, the next hand we have up is from Johnny. Johnny, I've sent you an unmute request.
Okay, can you hear me?
Yes, we can hear you, Johnny. Will you please confirm your first and last name?
Johnny Garcia. Yeah, I think this ordinance is going to be BS, because all it's going to do is going to bring out all the Karens in Lake County that it already has. I mean, you guys are talking about you're going to go out and educate the business or educate the person that gets called on. I mean, it's not going to change anything. Somebody's beliefs, this is where it's weird. I don't, personally, virus is real. Somebody's going to get it. They have a 50-50 chance of dying. That's them. But I mean, exactly what are you going to do? What are you going to do? Oh, if you don't mask up, you're going to get sick. You have you have a chance to die. If they don't believe in that, you're not going to change their attitude. You're not going to change their mind. They're going to continue to do what they want to do. So what are you going to do? You're going to find them. Where does that money go exactly? Does that go into your pockets? Especially with Eddie's comment that it makes it sound that Eddie and Moak, I'm sorry to say, are in it for they want to pass this ordinance so they get the CARES Act funding. I mean, if you didn't really care about that, that shouldn't be ever brought up. If you really cared about the public's safety, that's all that should ever be brought up. No money whatsoever. This is where I have a hard time. I also have a hard time because when this whole COVID happened and my son didn't like being stuck at home, he ran away. He strictly ran away because of the stupid ordinance. I called the cops. Did they do anything? No. So that's where Rob Brown has a point. It's not going to be enforced. It's not. It's just a way to scare people. And that's just stupid. It's going to turn the county against itself. It's going to turn the county against the board. I mean, if you guys really cared about the public and people dying, you would sit down and think of that. Dr. Pace came out today and said that the numbers statewide aren't really accurate right now. You guys keep saying, oh, we're basing it off the numbers. Today said there's a glitch. The numbers aren't accurate. So what numbers are you going off of? The numbers that came out a month ago, the numbers that came out at the beginning of this? It makes no sense. Also, the gatherings. I mean, did you guys have a breakout the 4th of July? Was there a massive breakout of cases, positive cases through your 4th of July event? I didn't think so. I think maybe 10 cases happened. How many were in attendance? You guys aren't making it clear why you're trying to enforce this. Is it strictly for money? Is it strictly because you guys want to keep an image of, oh, we care but don't care? It makes no sense. And all you're doing is pissing off a lot of people. And it's really going to tear this county apart. That's all I have to say right now.
Thank you, Johnny. You know, obviously, I will speak since you spoke directly to me about where the money's going. Obviously, any fine or citation that goes to the county does not come to Moak Simon, obviously. From the point of view as far as testing and other things, you know, just trying to follow through with this ordinance is just one more thing. If everybody remembers, a few weeks ago, we had tested for the CARES Act money that, a 5-0 vote for that we had tested. We were obviously going to follow through with everything and be in compliance with the state's orders and other things. And this is one more step in that process. So the CARES Act funding has come. You know, I know that has come up here a few times in the conversation, but we have already attested as a county that we're going to do all that we can to be in compliance. And we have attested to that, which was sent to the state of California. And it was a 5-0 vote by the board. And this is just one more step. But as far as personal money off this issue, you asked that question, absolutely not. Everything goes into the county coffers. So
I want to clear up another misrepresentation there. We did vote for that CARES Act funding to apply for it. There was nothing in there said about coming back with more draconian ordinances in order to pretend to be in compliance. So that's just not accurate.
well, I know you used your draconian and all this other, whatever the ordinance. We did a test. There was an attestation
that we'd already met the ability to do that. It didn't say anything about coming back and fiddling with this nonsense.
Enforcement is a part of compliance.
Not enforcement is not a real thing too. So that's where we really are, is non-enforcement.
Yeah, that's what this board has decided to this point. You're right.
Okay.
Let's go to the next hand up, please.
Yes, so the hand we have up next is from Galaxy S9. Galaxy S9, I have sent you a unmute request. You should have received it.
Galaxy S9, are you hear us? Can you hear me?
Hi, yes, we can hear you. Will you please confirm your first and last name?
Can't hear him, Jake.
I'm sorry, will you please pull the microphone closer?
Yeah.
It sounds like you're really far away. No, that is not better.
Is that better?
Yes, that is better.
Yes.
Sorry about that. Hi, gentlemen. So first of all, I'm going to try to keep it as brief as I can. So first of all, I think, I like what the other person said. I don't think the fallout is being considered. I think your intent is good, but I disagree. Because the fallout of this, that's what happened in Nazi Germany, is they passed ordinances like this, and then people started snitching on each other. And then they started creating snitch boards and putting people's faces on it. And that's already happening. That's happening around the country right now. And so if you want to divide this county and destroy our social fabric that we have here, that we enjoy, then pass this. But if you are serious about having peace in this community, you will not pass this. The other thing I would just say is, you took an oath to uphold the Constitution, and this is against the people's rights. And why would you want to take that responsibility on yourself when you don't have to? So here's my suggestion. I come with solutions. Let the free market decide. Let the free market decide. If people want to wear a mask and go into a store, let the stores post a sign that they say, we allow people not to wear a mask. And then those stores could also have hours when people that want to wear a mask can go to that store. But why would you want to take this on yourself when you don't have to? Let the market decide. People will go to the stores where they feel safe. And let the stores develop policy for meeting the needs of their customers. And it will happen. You don't have to take this upon yourself. And I urge you not to do this today. Let the market decide. This is a free country, and I don't know how we leapt from, being free to this overreach that people out of fear are going to tell other people how to live their life. The last thing I will say, the numbers don't reflect a pandemic. We do not meet the criteria of a pandemic. This, I'm not denying there's a sickness, but I'm saying we're managing it. I urge you not to.
3 minutes.
Thank you.
All right, thank you very much for your comments.
Were you going to get a name from that person? Because I don't think Galaxy S9 is there.
Jesse Burnett.
I think he gave it when it was down low.
Couldn't hear it. I didn't hear the
Jake.
name.
I'm trying to unmute him again to confirm his name. Galaxy S9 Plus, the speaker who just spoke. Will you come back and confirm your first and last name for us?
Well, he had trouble last time. If he comes back, Jake, just let us know.
Okay, I'll try to see if I could confirm in another source.
Okay. All right, let's go to the next hand up.
Okay, so the next hand up we have is from Michael Green. Michael, I sent you an unmute request.
Yes, thank you. Just want to speak in strong support of the ordinance. It's unfortunate that it's taken this long to get it back on the agenda in the non-urgency form. But hey, we already had a bite at the urgency ordinance. So any suggestion that we should go back and try to take another run at something that will satisfy 4 votes on the board, that ship has sailed. I would strongly urge we stick to our guns, the original game plan, and take an up or down vote on today. Sonoma County, all the other counties, yeah, they're doing what they can, but I wouldn't call it proactive, and I wouldn't be patting ourselves on the back here in this county just because our numbers aren't up. So Sonoma County right now has 50 deaths attributed to COVID-19, and they just passed an ordinance, and along with that, a $300,000 budget allocation to help do that public outreach. So I'm going to do a little challenge of myself today. How many deaths will it take in Lake County to get those 4 votes for an urgency ordinance, if that's going to be the plan? And where's the budget allocation that will help Dr. Pace and his hardworking staff do the public outreach that happens? So I know we can't tackle the budget allocation today, but we do need a carrot to go with the stick. But the idea that a $100 ticket is so overly punitive that every business owner is going to wet themselves for non-compliance is a total red herring. And I'm over the constitutional arguments. Let's get the first reading of this ordinance done today so we can have something in place before our problems do start getting as serious as Sonoma County's. Thank you.
Thank you, Michael. Okay, let's go to the next one, Jake.
Okay, the next hand we have up is from Latoya Fortino. Latoya, I've sent you an unmute request.
Yes, thank you.
Hi, yes. Will you just please confirm your first and last name?
First name's Latoya, last name is Fortino.
Great, thank you.
First, let me say thank you to the lady and gentleman on the board. I have been watching you guys have this conversation for the past weeks, and I appreciate the fact that it's a difficult position to be in. As stated before, either way this goes today, someone's going to be upset. A few of my questions and concerns in this ordinance are for the businesses that have been trying to work with individuals with medical conditions and so forth that do make it a challenge to wear a face mask for prolonged times. As it's gotten hotter, myself, some businesses I go in, they say, you know, I have established that my son, who suffers from a seizure disorder and should not be wearing a mask, they have worked with me in doing that. However, I also have gone to businesses and even displaying, like stating I have a medical condition, I've been asked to leave because they have flat out said, you know, it's law. They said at that time the governor had put out no mask, no service. In attempts to try to work with what's going on, finding other solutions. Shopping, I had done Instacart from Safeway. I actually had to stop that because it was costing more, and on a budget, that makes it a challenge. So those businesses that are trying to work with our community on both sides, what is this ordinance going to do to them? Because I do know for a few businesses, they've actually had people come up and give them a hard time for myself or my son not having a mask, even though we are 6 feet away. We have respected the fact that they are wearing a mask and have really given those businesses a hard time. Do I think we need to have safety precautions? Absolutely. But just consider in this, how are those businesses going to be addressed? Because a fine is pretty much a black and white situation. And I do know that we have a handful of businesses that are trying to work with their community. So thank you so much for your time.
Thank you. You know, I guess just answering the question, education, if you read through the ordinance, ultimately, I know fines are what's being focused on in this ordinance, but that is the main enforcement part of it. But I know that this is an education process still laden ordinance. And I know that we worked with multiple businesses in the area as far as people either working there or people going in. It will still continue to be an education. There's never going to be a perfect process, but education right on top of the ordinance is that's going to continue. But at some point, the education needs to stop, and some more action may need to be taken. So, EJ?
Yeah, the administrative fines would be a last resort. If attempts at education fails and we get off track and people are thinking fines could be common, but they're not. There's also the board, it would come to the board for the appeals. And so I think that's another level of it extended to for the 10 days. I know that that's not popular to some folks that would like to see it shorter, but it gives people time to correct some of those things.
Mr. Chair?
Yes, Anita.
Also, I would say that the imposition of the fine's permissive, it's not a mandate, and both the local health orders have always, and certainly the state orders that came out on or about June 18, recognize exemptions, and among those exemptions are medical conditions.
Thank you, Anita. Okay, Jake?
Okay, the next hand we have up is from Frank. Frank, I've sent you a unmute request. All right, looks like you're muted. Will you please confirm your first and last name?
Frank Deloso, can you hear me?
Yes, we can hear you.
Okay. Yeah, I just want to let you guys know that I do oppose. I am not in favor of this this ordinance. I'm asking you not to vote no on it. Really, I take a look and I don't see where the emergency is. Not saying the virus isn't real, not saying the virus hasn't killed anybody. We have flus every year that kill tens of thousands of people, and we even have a vaccine for those. But where is the emergency? There's no emergency. There hasn't been one for a long time. And if you look up what an emergency is, it's a sudden, unexpected, a direct threat or great peril. None of those definitions apply, and since there's no emergency, there's no grounds that I see for for these health orders to even this masking ordinance to go through. You take a look at Dr. Pace even confirmed, it's been in the news, the numbers in California have been skewed, and our hospitalizations, our hospital has not been overrun here in Lake County. And like I said, I'm not saying that the virus is not real. So I'm not some, crazy conspiracy theorist that is saying that it's not real. I'm just saying that the emergency, and with you guys pushing, or with some board members trying to push this mandatory ordinance that imposes fines on people, it brings division even more in a county that's already under a lot of stress right now. You can say mask work all you want, but you can take a look at states like South Dakota that has not done anything, and their numbers are really, really low. Our numbers are really low. Why? Because we're not the Bay Area, and South Dakota is not California. So, and there's another reason why you see a lot of these health officers, including the state health officer, resigning, because I think there's some major issues that are going to come up, and probably some lawsuits that are going to come up in this thing as well. And I urge the county to vote no on this ordinance. Thank you.
Thank you, Frank. Okay, Jake?
Okay, the next hand we have up is from Dan LaBelle. Dan, I've sent you a mute request. Looks like you're muted. Will you please confirm your first and last name?
My name is Daniel LaBelle.
Okay, we can hear you. Thank you.
Okay, so I had a thought. When General Eisenhower in World War II was planning the D-Day invasion, I'm sure he considered that there was going to be a lot of injury, but he went ahead with it. Of course, his objective was to help conquer a regime that could break your door down and grab you, drag you out in the street, and execute you in front of all your neighbors. Okay, so what I think is at some time in our lives, we have to face something. We have to sometimes do a frontal assault. Okay, so my next thought is, I've got a quote here from nih.gov. It says, replication of most viruses is reduced by even a modest rise in temperature. Okay, so I believe that we should allow the coronavirus to run free at this point when we're in a better position to defend ourselves against it. In the summer months, if you get a chill, if you've got a fever, or you can go out and sit in the sun, especially in Lake County, and diminish the power of the virus. So basically to just keep pushing this, kicking the can down the road or whatever, seems to me like a foolish move. And another thing about wearing masks is people exercising, where there was a test made with people exercising without a mask and then with a mask, and their oxygen content was measured, and their blood oxygen content was lowered by the mask. Another point I want to make is I've heard of this missionary in Nepal. He's a native of Nepal, and he lives here in America. And he pleaded with people that received his newsletter, saying that the coronavirus restrictions has interrupted the food supply for a lot of people in Nepal, and there is actually starvation caused by it. So anyway, these are points that I wanted to make in coming against restrictions. Another thing that I just thought of is the biggest thing that the Constitution gives us is dignity. All right, and that's all I wanted to say. Thank you.
Thank you. Okay, Jake.
Okay, the next hand we have up is from D. Parker. All right, looks like you're muted.
Can you hear me?
Yes, we can hear you.
Hi, thank you so much for making the time. I appreciate all of the supervisors' time and energy and efforts in working with this problem. I'm going to bring up a couple of points, and then I'm going to go in a little bit of a different direction. When I look at both of these ordinances, the thing that concerns me is the part in, and you know, they don't have numbers, so I'm thinking, you'll have to excuse me if I can't tell you which is which, but the one that talks about adoption of public health orders as county law, that raises significant questions in my mind. It also raises questions when it says that this isn't just a masking ordinance. This is an ordinance that deals with 4 issues: business operating when they're supposed to be closed, masking requirements, failure to social distance, and then adherence to maintenance and hygiene requirements. So I want to bring that point up because I'm going to talk about that. The other one also talks about fostering compliance with state and local public health orders. This is both of these. The one is very broad range. The other one's more specific, but it's still broad ranged. My concern is twofold. Number one, it's the environment that you will be adding to and enabling, which has already been created in this county. The behavior you're trying to prohibit is fostering a whole new behavior that nobody's dealing with. And it's super detrimental to businesses and to members of the community. I think that your efforts, although I applaud the passion and the focus, should be directed to helping people already in crisis, mental crisis, emotional crisis, veterans, PTSD, people who struggle with that, who are in isolation or who can't do and go. The mental health issues that are out on the street that are happening all around. The domestic violence things. And I know you guys have all heard this before, but if you are out in the community actively working with people, you begin to see that this isn't just a once in a while, it's pretty prevalent. My concern is, secondary is, for people who cannot wear a mask, and I am one of those people who struggle to not become very ill when I wear a mask. I have to evaluate when and how long I'm going to have to wear a mask. To have a sanctuary where I can let them know I have a medical issue, I'm very careful. I wash my hands. I social distance at all times. I go, most often, if it's the post office, I try to go when it's closed and very few people are there, if anybody. I look before I walk anywhere or in anywhere. If I go to a store, one of my family members who is masked goes with me so that I can be quick and efficient, or I wait.
3 minutes.
So here's the thing. We are being stalked. We are being confronted. We are being battered mentally, emotionally, because we don't have a mask and because we don't look like we should have a mask. There are private citizens going around taking care of business. My question to you is, how are you going to stop that from escalating? What are you going to do for the businesses who help us, like Harvesters, like Mountain Highs? I just cannot praise them enough. What are you going to do to help me feel safe? Because right now, I don't feel safe. And this is going to compel me to begin to fight back. Not physically, but talking to people, seeking out resources to help combat this legally, election-wise. I don't want to have to go there. I want you to protect everybody, not just the ones who are screaming the loudest. I appreciate your time and your energy, and I'm trying to make sure that my bus is not being driven by my emotions. Thank you so much.
Thank you, Dee. It was stated earlier too by Anita and County Council, obviously, all orders I think that have come out address medical issues as far as controlling everything. Whether this ordinance passes or not, there is a mandate for masks in Lake County. It was talked about here at this board, controlling everything. That isn't what this ordinance is going to do. So, there's been plenty of education points, I think, in each order, and Dr. Pace, if you want to just elaborate on the orders that have come down, both from the state and from the county, that folks with medical conditions have the right to not wear a mask.
Correct. Yeah, I mean, the way we're working with it now in the county is people that have a medical condition that prevents them from wearing a mask can enter businesses or do whatever. They just need to keep 6 feet. They just need to keep the social distancing. And most of the medical societies have come out saying that they feel generally that there's very few medical conditions that prevent people from wearing masks. But I know a lot of people get some bad feelings and they feel short of breath and things. And so we're not really challenging that. But the way we are proceeding with that at this point is that they just need to take responsibility and keep 6 feet, which is kind of hard to do in some stores, especially if it's crowded. But that's what we're trying to have people do at this point.
Thank you, Dr. Pace. Supervisor Brown.
I think we all know about the rights that people have with medical conditions, but I think what Ms. Parker is talking about is these groups of people who make an assumption that they're just not wearing one to be defiant, as opposed to just assume that they can't wear one. But it's easier to post things on Facebook, and you have these groups, masturbating for a friend and all this other stuff. These people want to belittle people and shame them. And you shouldn't have to wear your medical card around on your sleeve or on your chest to prove to people that you have a medical condition. If these people would just assume that other people have the right not to wear one for their medical condition, I think things would be much better. What she's saying is people are being held under attack by folks who need to mind their own business, basically. And I don't disagree with the rights of one not trumping the other, but I do disagree with Dr. Marchand's bumper sticker drive-by that he just did about my rights to hug my grandchildren don't trump
his adult daughter, by the way, of not being infected. Well, you can have both. I think I should be able to hug my grandkids, and his adult daughter should stay 6 feet away from me, and I'll do the same for her. So I think that's the real problem. People, I mean, to say that we need an ordinance in place to make people safe at my business or my horse arena, if we have to have an ordinance to make people feel safe at their business, they shouldn't be in business. They should be able to operate their own business without having the government come in there, because I'll be honest with you, I disagree with another comment that he made. It is not my job to protect the health of anybody. If that were the case, I'd be slapping the cheeseburger from the fast food restaurant out of your face too. And I'm not doing that, and I don't think you should. I don't think you should tell people, grab a cigarette out of their hand or take a drink out of their hand. People are doing all these things, and we're allowing it. We've been allowing it. We talk about how Lake County is supposed to be the unhealthiest county we talk about that every year, yet we don't do anything about it. We just talk about it because it's another funding source. But now all of a sudden we're worried about people's health. It's just a smokescreen. It's more smokescreen. That's all it is.
Hey, thank you, Supervisor Brown. Jake, go ahead. Let's go to the next hand up.
Could I interrupt real quick?
Yeah, Supervisor Sabatier.
I just want to quickly, because we still have some very patient people here in the room. I want to thank them for waiting patiently. We are remembering you, and we will get to you.
Yeah, we got four hands up here. So let's get through this list, and then we'll go to the board chambers. Go ahead, Jake.
Okay, the next hand I have up here is from Aiden Fideli. Aiden, I've sent you an unmute request. Looks like you're on mute. Will you please confirm your first and last name?
My name is Aiden Fideli.
I can hear you.
I am here to speak in support of the ordinance. First off, the biggest reason why we have not had an explosion of cases is because individuals have been taking the responsibility that should be with the Board of Supervisors and have been socially distancing. They have been masking. They have been not going to places that don't enforce the masking guidelines. We also need to put this ordinance down before we have an outbreak and more people die in the county than our current nice looking number of 2. Because if we continue to just ignore any action at higher levels, people will die, and that is not something that the Board of Supervisors should permit. You should be doing everything in your power to prevent this. And in terms of giving incentives to businesses, not negative disincentives, to make them comply with this ordinance, I'm all for that. But there needs to be a carrot and there needs to be a stick. We need to make it clear that businesses that are complying will be rewarded for their efforts, and those that are not may be liable to fines. But as everyone has mentioned, it's not like you go in and see that someone isn't masked and they immediately get a fine. It's as many have mentioned, there are guidelines for people who can't wear masks, and fines aren't the first action. The actions are education, which is why I honestly see this as a smart thing to do, because we're not going to punish people who genuinely don't know better. We're going to only end up punishing people who are actively trying to ignore the county government. Thank you.
Thank you for your comments. Okay, like I said, I see 3 hands up here. We're going to go ahead and finish up these 3 hands, and then we're going to move to the board chambers. So, Jake, let's work through these 3, and then we're moving to the board chambers.
Okay, the next hand I have up here is from Monica Rosenthal. Monica, I've sent you an unmute request. Looks like you're muted. Will you please confirm your first and last name?
Yes, my first name is Monica, last name Rosenthal,
Great, thank you.
You're welcome. So my comments are, first, I'd like to lead with the enforcement issue, which, as we all know, we have many, many ordinances on the books, and they are not enforced. So I do have questions around that. But my main question is really, I'm so lost now in listening to the proceedings for this over the course of time and where we are now and the urgent and non-urgent need of this ordinance. I'm just so lost, I don't even know what the purpose of this ordinance is anymore, other than that as it's written, it does seem to be overly punitive to our businesses. So when I ask the question, what is the percentage of businesses that we have here in Lake County that are out of compliance today with our current actions surrounding the COVID situation? And what is the percentage of the number of people in our community not wearing masks? I mean, I frequent a number of businesses, I pass by a number of people, and we're all wearing masks. In fact, I mean, masks have become rather fashionable, you know, in checking out. It's like Halloween costumes. But anyway, I'd like to say that I agree. I believe it was Melissa Fulton who talked about the proactive measures that are being taken with businesses, both in the regard of education and in the free masks that are made to businesses in supporting our local businesses. Do we really need this ordinance? It has been stated several times that we already have a mask mandate. My vote is for positive, proactive action rather than this ordinance, which appears to be proactive but negative in its approach. Thank you.
Okay, thank you, Monica.
Does anybody have a question? Does anybody have a question? Does anybody have an answer to that question about how many businesses? Because I've only heard of one that was in District 1 that didn't accept the education from the supervisor there, and that was a driving force behind this. So I'd like to know, are there more businesses than that? I think it's a fair question that she asked.
Supervisor Brown, can you clarify your statement? What was the driving force behind?
Yeah, what's the driving force behind all these businesses that we're suddenly concerned with? That we need an urgency ordinance. It's talked about providing leadership, but 5 months later, it's like leading from behind. I'm just curious as to how many businesses we really have that would cause this sudden need for an ordinance like this.
Well, leadership comes with 3 votes on this board or 4. Depending how that goes. And I can speak, yep, there at least one business in my district has been very blatant about not using masks. I can't speak for anybody else's district. But if no one else has experienced that problem, that would be fine, but I can't speak for the other districts. As far as tracking it, I know that at this board, there was a conversation of bad actors and those types of things. I don't think there's anything at the county level on folks that are at least accumulated list. Dr. Pace, you can speak to that if you'd like to.
I was just writing to some of our folks to see how many complaints we get. On our Mohawk line, we get regular complaints every day of businesses and, situations that people are concerned about. And, then what somebody will contact those folks and sort of see what the story is and talk with them about that there's been an issue. And the next step is if it seems like there's a problem and there's some kind of lack of resolution, then it'll bounce up to the supervisor of that district. I think there's a certain level of surrender in the community of where people aren't really registering complaints because they feel like there's no enforcement. There's also this whole issue of kind of group gatherings where there's not really leverage for that. If somebody's having a party down at the beach, there's not really a way that it gets broken up at this point unless the law enforcement decides to do something. And you know, there's also just, I think there's just a general sense of like with the masking itself, you know, I've seen in other counties that when the ordinance goes into place, it seems like people become more diligent about doing some of those things. So I don't have a specific number though. I did, you know, so if I get one before we're done talking, I'll let you know. But, and in, I just saw in the paper, I think today or yesterday, that in Sonoma County, when they just, Sonoma County just opened up their, they just put the ordinance in effect last Thursday, so August 6th or something. And they report that they've had, you know, several hundred complaints. They have a new hotline that they're doing. They've had several hundred complaints to that line so far. And then they're kind of working through the process with that, so.
But I don't want to know how many complaints there are. I want to know how many that have been determined to be valid. Mokes indicated he's had one in his district. I've had none. I've had some complaints and I've checked out every single one of them has been invalid. So I'd be interested to hear what the other supervisors have. Because we're spending a lot of time for one complaint that's perceived by a board member.
It's not perceived, you know, if you're saying one complaint by a board member, it's not perceived. It's actually, it was made very public. I think we even all got letters written to us as Board of Supervisors, or at least an email. You know, the other thing too, when you talk about enforcement, I did say one, but there are other things such as businesses, such as Airbnbs and other things that are running out. I know this weekend I got a lot of calls about a business in South County that was still hosting large events. And I got a lot of calls from the community members. So, don't have an exact list, but hopefully if there are others in the county, people will speak up. Supervisor Scott?
I would have to say there isn't a lot. Most are complying and wanting to do the right thing. I have at least 3 in my district that have blatantly said they're not going to follow the guidelines. And I just think we need something in place to be able to make sure that they're following the regulations that we have in place. I know already that the health department already has, items where they can go into businesses and file a violation of notice or order of correction. So this is not something new. It's just another item to add to their list of making sure that businesses are making sure that they're doing the correct thing for the public. Like the health department can come in if employees aren't washing their hands, or if the cleanliness isn't correct, they can do a violation of notice and they have to clean up and do the right thing. Or if there's, bugs in their restaurant, they can go in and file a notice of violation and the correction. So this is just another piece for the health department to make sure that we are protecting the health and safety of our community. And I agree, there isn't a lot.
Each time I've had a situation to go, there's been evidence that they're wearing masks and they're doing their best to comply. I know that there's some instances where there's nothing that can be done. For example, there was a complaint even about Robinson this last couple of weeks. I guess there was some people that came out on motorcycles and that it was a sponsored event or something of the nature of that. But these are, again, some of these reports as well that come through, and some of them weren't wearing masks. And
I think the question was, in each district, are there folks that are not complying? Not going out and educating people. I think the question was directly, do you have businesses that have said they will not comply?
Well, there's some that said they weren't, but when I went, they were. So I don't,
okay.
I think that people in my district and their businesses, I don't think necessarily would have to worry about this ordinance because they're doing the right thing.
Thank you. Okay. All right, we have 2 hands up. Go ahead, Jake.
Looks like the last hand we have up here is from Daryl, probably. I sent you a mute request. All right, looks like you're muted. Will you please confirm your first and last name? You are unmuted, Daryl. I'm not getting any audio from you, though. Will you please check?
Hello?
Oh, all right. There you go. We can hear you. Will you please confirm your first and last name?
This is actually his wife. He had to step out to wait on a customer. Can you hold on? No. Just a second, I'll go tell him.
I guess that's up to the board.
Yeah, we're going to go ahead and move. You know, I wish you wouldn't have just ran off, but yeah, I know we're trying to get through this. We have folks that are waiting in the chambers, and
4 hours now.
Like to get to that. So I'm going to go ahead. What I saw, Jake, was there was one hand up when I had said that, and we're going to go ahead and.
The last hand we have up from Johnny is, he spoke already, so I didn't know if you wanted to.
Yeah, so we're gonna, at this point, we're gonna move into the chambers. We're gonna go ahead and move into the chambers. If Daryl comes back, we may try and pick him up, but we're gonna go ahead and take it to the board chambers. Anyone who would like to speak or make public comment, please do it at this time. So we're gonna move to the chambers.
And so we have 2 microphones set up. Please alternate between the microphones and I'll come out and clean up behind you with the sanitation stuff. And so please, one at a time, go ahead and come up.
At some point, we should probably take another break too, Chair. It's been several hours since we've had a break, so.
Shouldn't have drank that coffee.
We have staff. No, this time I'm concerned about staff who hasn't had a lunch break, and you know we're kind of.
Yeah, well, we were looking to get through this item here, and then
we got
come
all
back
day.
for lunch break. And I know the folks in the room really want to come up and speak. I can't see if there's somebody at the
there's
the podium at this
somebody
point, but
ready
if
to
there's
speak.
someone is what we could do is before we start in the room, we could take a break. We could take a 5-minute break. So we do plan on getting a lunch. We want to get through this stuff, get back to the board, and then after that, we will take a lunch. I know today is pushing along a long time, but you know, we like to move through and push through this. So
my suggestion.
let's go ahead. Well, let's take a 5-minute break. Since that's been asked for, take a 5-minute break, and then we'll come back with public input in the chambers. That will put us back here at I have 3:28.
We are good to go.
Johanna's ready too.
Thank you, Johanna.
Thank you, everyone. Okay, we're going to go ahead and resume public comment, so go ahead. Can you please state your first and last name?
This is Mike Raffaelli. Doesn't sound like this is on. Okay.
If you could start over, please.
Yeah. My name is Mike Raffaelli. I'll just make it really quick because I got to go. But if I'm really against this whole ordinance and mask wearing thing, and I don't really like to wear a mask. I don't wear seat belts. I don't wear my helmet when I ride a bike. I don't really care what people think. But if this ordinance passes, I can almost promise you that I'm going to sit in the Walmart and Safeway parking lots and be the parking lot police and start turning in people for parking in the double parking, parking taking up 2 stalls, and the big one is parking in the handicap zone. I'm gonna definitely do that. I spent all day there. Thank you.
Okay, thank you, Mike.
I'm Paula Mune, and I'm a 33-year resident of Lake County. What can we do to help the men, women, and children of Lake County, and especially the businesses? Our case numbers continue to rise. From June 30th, we had 60 cases. To yesterday, 240. We do not want to end up on the watch list. 97% of California population is living in a watch list county, which means students cannot enter the classroom and our county will be under state control. We have a choice to stay off the watch list. An enforcement ordinance could save some of our businesses from having to totally close down under a watch list. I believe we are at a point of needing an enforcement ordinance. Please vote your conscience and not your politics. Please vote for what's best for our community. You know there are more good people in Lake County than will comply than not. And also I must say that people not wearing a mask and following the safety rules, safety recommendations are infringing upon my rights. And I really resent that I was here almost from 9 o'clock until 2, and 50% of the people of the public that are in the audience right now are not wearing masks. Thank you.
I would add that they are way more than 6 feet away from you.
Thank you.
Whoever's next.
Bob Michelson, District 3, I think. I'd like to voice a few concerns I have regarding this proposed ordinance. I agree the situation we face is grave. Death from any cause is most unfortunate. It's a sober way to end one's life. We've had 2 deaths so far from people who've had COVID on board. I just can't help wondering if deaths from heart disease had received as much attention as COVID, how many lives would have been saved? Just thinking. Those Hollow Point pickles at McDonald's. Anyway, but 2 people have died having COVID on board in Lake County. Another concern that was raised previously is the possible punitive action between individuals who may not see eye to eye, and who may take it upon themselves to begin self-policing. And I don't see this as conducive to helping us pull together as a community towards any given goal that we might have to keep ourselves safe and free. I think also there's another thing that I read once, that the fabric of society always moves forward, and it never goes backward. And the decision made today will be going forward, it will not be going backward. I think that there will be a dependence on the revenue that possibly will be generated, whether it's small or large is irrelevant, but there will be a dependence on the revenue that is generated, and that will become an established thing. And I personally don't see this going away anytime soon. There was a suggestion made earlier regarding a solution, and I would like to endorse that, and that is to let the free market decide how to navigate this season. I think people are mature in general. I believe some people have a challenge or two in these issues, but in general, I think people are relatively mature and have the ability to self-regulate without having an imposed regulation on them. That's just my perspective. Thank you very much for your time, and you've done marathon without meals. Anyway, that's it.
Thank you.
I am Joan Moss. I'm a journalist. I look at all sides. We need to all respect each other. This is what I read, and I think it's very important. I am exempt from all regulation mandating face mask usage in public. Wearing a face mask poses a health risk to me. Under the ADA and HIPAA, I am not required to disclose my medical condition to anyone. Department of Justice ADA Violation Information Line, 800-514-0301. Organizations and businesses can be fined up to $75,000 for the first ADA violation and $150,000 for any subsequent violation. Attention government agents. Please provide lawful and necessary consideration to aid the bearer in the unimpeded exercise of constitutionally protected rights. Thank you for your understanding and assistance. As a journalist, I'm on the fence. I have friends on both sides of the story, and I hope that we can all be pulling together, whether you pass the ordinance or not. We've done a really good job so far. Thank you.
Thank you, Joan.
Anyone else?
Good afternoon, Supervisors. Thank you for the chance to speak. My name is Haji Wharf, and I come to you from Upper Lake. Once again, I'm here to show support for the proposed ordinance, despite its substantial changes and lack of urgency. I applaud your efforts to bring together disparate interests into a cohesive proposal, which is no small feat. I do have a few concerns, but before I get to those, I wanted to address the positivity rate and its significance. If we have it at 3%, as Bruno and now maybe Dr. Pace contends, with only 11% of the population of Lake County tested, you can extrapolate that to mean there are over 2,000 cases undetected walking around among us. Look at it that way. Okay? I do have a few concerns, one of which is the lengthy process by which an individual or business is brought into compliance. 5 days after education to correct the violation, plus 10 days after a notice of violation, and depending on the day of an appeal, when it's filed, day of the week, up to 7 days before the hearing is on the board agenda. That's 22 days, an exceedingly long time frame to ask for compliance during a pandemic. Furthermore, this ordinance does not specify the timeline between the filing of an appeal and when the board guarantees to hear it. So that interval is entirely discretionary. If the next week's agenda is full, the hearing may be delayed, which adds to the time the appellant has to continue his non-compliance. Another concern is the quality of education. If we are going to take a graduated approach to a health emergency, and education is our first priority, then part of that instruction should include a PSA on the most effective masks and how to wear them properly. A recent study on 4 different styles of masks conducted by scientists at Duke University suggests that the loose weave fabric of neck gaiters or tube scarves like this one, I've seen lots of people just wear this, in fact break down large droplets to release small aerosols, leaving them to be worse than masks. That's what the study shows. So if this is all you have, don't bother. You're making it worse, okay? Even the N95s are not without differences. Those with air vents allow exhalations to escape with a viral load, while it protects the wearer. Fitted masks protect better than those with loose edges or vents. Covering only the mouth and not the nose renders the effort largely ineffective because the nasal passage is known to harbor the virus. Okay, those who cannot wear, I've been waiting all day, okay? Just give me time. Those who cannot wear one for medical reasons, a shield would suffice. They have those clear shields that they can wear. So it's not all or nothing. There are a variety of options out there. Just try. If we're going to expect better compliance from education, then let's educate in a way that gets results. Okay, thank you for your time. And allowing me to share my concerns.
Thank you for your comments and thank you for your patience. Thank you. Now, is there anyone else in the boardroom? There we go.
Thank you. Val Lancaster, Lakeport. I had something prepared. I'm tossing it out the window. This hits home. This whole mask ordinance hits home without disclosing my medical issue that I have. A shield doesn't cut the mustard for me. I am very, I want to thank Dee Parker, who spoke earlier via Zoom. She is very conscientious, like I am, of who's around her. You know, I go to the grocery store at 6 o'clock in the morning. I'm very conscientious of the people around me. I keep my distance. I try to make people feel comfortable being around me. But I'm a business owner. My husband and I, we brought our business from Fort Bragg here in January, before this all started. He works on the emergency vehicles for North Shore Fire. So he has a very important job. I don't expect my husband to wear a mask when he's working on a truck in 110-degree weather. And yet there are going to be people that are going to see him crawling under this truck, working on it, and say, well, he's not wearing a mask. He's not in compliance. That's bullshit. Oh, I'm sorry. It's bull. This whole thing, businesses are complying. I've been rejected. 2 different businesses I've walked into, and they've told me, get out. I'm like, I have a medical condition. I don't care, get out. Are those going to be educated, those businesses? Are you going to educate those businesses into complying with those that have medical issues, that have the medical conditions, the exemptions? That's what I'm trying to say. Because they're not complying. They're not complying. They're kicking people out because they're not complying with the medical side of the people that can't wear masks. And I've been kicked out of 2 different places. They didn't care if I had a medical exemption. I said, I fall within the medical exemptions. I don't care. Are you going to educate those people? Are you going to find those businesses for non-compliance? Because you have to. It goes both ways. I've sat here for 6 hours patiently, and I applaud Rob Brown and Bruno for sticking up for this, because I don't think it's the right direction. You're just going to pit business against business, and individual against business, and individuals against individuals in a situation that we're already so stressed out about. But my mother-in-law almost died from heat stroke because she wore a mask when it was 105 degrees in her car. She almost died. I mean, that was her decision. She decided to do that, to go out and to wear a mask. But she should not have been afraid to not wear a mask. And that's all I have to say. Thank you.
Thank you, Val. Are there any more folks in the chambers that would like to make comment on this issue?
Good afternoon. My name is Marty Northrup. Thank you for this opportunity to speak to you today. I would respectfully like to ask each of you if your child or another loved one had a health or psychological issue that prevented you from wearing a mask. Would you want a doctor's waiver to be respected so they could live a normal life? We all know that the COVID-related cases, specifically hospitalizations and deaths, are an extremely low percentage of our approximately 65,000 population in Lake County. My question to you is, why do only COVID-related lives, why do only COVID-related lives matter? What about the 11-year-old child who told me in confidence that with school and extracurricular activities canceled, they were being held hostage by their overbearing father? Does this child's mental and emotional health matter? What about my friend who is struggling with sobriety and has gone through rehab during the lockdown, only to come home and relapse again because she feels like a caged animal in her 1-bedroom apartment that she shares with 2 teenage boys? Do these 3 lives and their welfare matter? What about the 3-year-old boy who cries every time he has to wear a mask because he thinks he's going to die? How do you think this is impacting his psychological development? Does he matter? What about the multiple families I know who are, What about the multiple families I know who are frequently stuck at home with a raging substance abuser? Do their safety and lives matter? And the middle-aged single man who has been so depressed and despondent that he has seriously considered suicide. How important is his life? These are all people that I know personally who are suffering and struggling because of the oppressive restrictions controlling their lives for the sake of protecting others. Yet you are proposing even higher restrictions. But what about their lives? Like the George Floyd incident, you have your neck on their knees. You have your knee on their necks, and they can't breathe. I believe in my heart that you wouldn't want such an unthinkable thing to happen if they were your loved ones. Please show some compassion and mercy for the other 99+% of your constituents. Please do what is best for everyone. Thank you for your time and consideration.
Thank you. All right, do we have any other folks that would like to comment who have not commented already in the chambers?
Looks like we're done.
Okay, I know we had one individual who had stepped away. We're going to go ahead and finish with Daryl, and then we're going to bring it back. Daryl, is Daryl still there?
Yes, he did come back in during the break, and I told him we'd give him a moment. I also have another contact from Ron Green, who tried to speak earlier as well, who said he's back. If we would like to.
We'll finish with those two, and then we're going to bring it back to the board for deliberation.
All right, so Daryl, looks like you're unmuted. Will you please confirm your first and last name?
Daryl Davis.
All right, we can hear you.
Okay, guys, it's been a long day. I've been sitting here trying to run my business and listen to this all day. You brought a lot of misery on yourselves and other people by even bringing this to the board. You're just opening a big can of worms that you're not going to be able to put back in. I'm pretty sure in listening to you folks that at least 3 of you already have your minds made up and are not willing to listen to common sense. It seems that for some reason or another, you want to keep up with the big boys, that being Sonoma County, Mendocino County, any place with more people than us. We're a small rural county. We're not a big county. We shouldn't be treated like them. We're different. People around here got pretty good common sense, and you've got them all running around scared like chickens trying to cross the road. It's really sad. I just really wish you would utilize some common sense instead of chasing the money, which I think is what you're looking for. And lastly, I just want to know how you're going to enforce this. Is this going to call for a new department? Maybe someone with some brown shirts or something to go out and enforce this? And surely I know that you'll be set up for some lawsuits. I hope you're prepared to pay for those as well. I won't be one of them. I'm not going to worry about this. I think we're all adults. If we feel our health is at issue, we take care of ourselves. If we don't, we act like normal Americans. I don't remember when it was the Board of Supervisors or the government's responsibility to ever tell me how to take care of my health. They certainly don't want to pay for my health care. What gives you the right to tell me how to take care of my health? And lastly, this morning I brought up a comment about per capita, we've got like 0.05% of cases. And I asked the doctor how he considers that a pandemic and never got an answer. If you'd like to address that, that'd be okay. And I'm done. Thank you, guys. Wasted a lot of time.
Thank you for being patient, Daryl. I don't know if you want to address the pandemic question, Dr. Pace. Yes, specifically to you, so I don't know.
Well, I forget exactly the way the question went, but I understand, he mentioned the pandemic earlier on. I mean, we have things under control pretty well in Lake County. We have limited resources. We're really trying to take a strong preventive role so that it doesn't spike up real high, which it has done in other small rural counties. And, basically, with every definition of a pandemic, there's been nothing quite like what's going on nationally and globally right now in terms of the impact of this virus and the impact on the economies and everything else. So,
if everything's still under control, why do we want to strangle our population by placing this rule that you want to make?
I
think
do
Dr. Bates
want to
answered the question. This ordinance is coming obviously from the board.
Right.
And that's what we're addressing. Okay. All right, with that, we're going to close public comment and bring it back to the board for discussion or action.
I
Mr.
believe
Chair,
there was
sorry
Ron
to
Green.
interrupt. I had one more from Ron Green.
Okay. All right, I didn't see anything up there, so.
He was having issues raising his hand.
All right, well, we'll reopen that, take Ron Green's, and then bring it back to the board. So go ahead.
Okay, thank you. Ron Green, I've sent you an unmute request.
Okay, can you guys hear me?
Yes, we can hear you.
Yes.
Okay, I'll try to be brief. I'm Ron Green. I'm a 40-year resident of Lower Lake, and I urge the board to adopt this ordinance. We need an enforcement mechanism because too many people are ignoring wearing masks and social distancing. Too many businesses are not enforcing the wearing of masks for their employees and customers. Too many people are gathering in large groups. Too many people have had bad experiences in stores with employees not wearing masks or wearing them below their noses or even below their mouths. A few businesses have quite publicly and blatantly flaunted the mask law with public statements, perhaps as a marketing strategy. As a result, too many people are choosing to shop in Ukiah or online, hurting our local economy. I think the proposed ordinance, if anything, is not strong enough. The penalties are too light, especially for businesses, but it's certainly better than nothing. I strongly urge the board to adopt this ordinance and not to delay it as Bruno seems to be proposing. And I thank the board for your consideration in this matter.
Okay, Ron, thank you. All right, with that, we'll close public comment, and we're going to go ahead and bring it back to the board.
Mr. Chair, this is Anita. If at some point you'd like to listen, I do have a couple minor adjustments on the face of the ordinance in response to some of the public comments that were good.
Okay. Go ahead, Anita.
On page 2, at the very top, the first recital, whereas it's imperative for this board to be responsive to the concerns of all residents and to illustrate to the state the county's efforts to adhere and enforce its public health orders, not only in regard to local business, but as to members of the public as well. And then in the next 2 recitals where it makes reference to local businesses, in the recital after that, where it says, whereas generally local agencies and businesses, I would add members of the public, local agencies, and businesses have diligently pursued compliance. The days in the ordinance draft, Mr. Chair, are simply just days. Your board can certainly change that on its face today if that's what you would like. If there is a concern about moving forward in terms of the time for appeal to the board, under section 10 hearing, where it said appeal shall be heard by the Board of Supervisors, you could add no later than the next board meeting following receipt of the appeal.
Yeah, okay.
And those are just suggestions in response to some of the comments, sir.
Thank you, Anita. Okay, Supervisor Brown.
So the last few speakers were in support of the ordinance, but there's 3 of them actually here. So which one are we actually looking at?
The first one on the list.
Is that what
Yes.
we're gonna do, is go down the list and, or are we just gonna
No,
eliminate
that's
two right
the-
now? What's gonna happen?
The other two ordinances were, EJ can explain that, I think EJ explained at the beginning, that was just for reference. The ordinance we're talking about today is the first ordinance.
Right, the ordinance that was put together by the county is impacted by both the Blue Collar Committee and also the other group who just put some stuff together to give some insight. However, this is mainly, most of what's in the ordinance conducted by the county is heavily influenced by the Blue Collar Committee and their work. And that's the one that I think is up for vote today.
Yeah, so we brought it back to the board. I know we had public comment. Are there any other comments? If there are no other comments, bring it back to the board for action.
The only comment that I like to make is that we're not putting an ordinance in place for masking. That's already there. That what we're trying to do right now is just have compliance with the ordinance that we already have in place. I think there's some confusion there that we're trying to put something new into place. We're just trying to make sure that we're following California ordinances that are already in place, and we're struggling with that.
Supervisor Sabatier?
And I respectfully disagree. We already have that in place. This is a sincere conversation about penalties, not enforcement. Education is a type of enforcement. If you're not happy with that, it's still enforcement. So I don't think we have an issue with the state of California. We need to be sincere in what we're discussing, which is just adding penalties, which is a different type of enforcement. Because I've spoken with our law enforcement, and the issue is not an idea of are we enforcing, it's what type of enforcement that we're looking at, because again, education is a type of enforcement. So I think we need to be very honest and sincere with what we are looking at and why we're doing what we're doing. I will make some attempts to make some changes here, just for the fact that it looks like we're going to be moving forward with the first one. It does not come back to us at all for review, and I would like this to come back for us to review. We're reviewing our protocol for our employees. We're reviewing our remote work protocol, and I think that we need to make sure that this is going to be doing what is anticipated and not going overboard, or for those who are voting for it, not going below. I just think that passing this and walking away and expecting everything to be great is a little naive, and we need to make sure that this comes back to us so we're very aware of what's going on with it and how it's impacting our community or impacting our numbers. And I do not see that in there, so I'd like to see that added in. As well, I know that it says agencies, and I mean this with the kindness of hearts, but are we going to start with the courthouse? Because I can walk onto the second floor, the third floor, or the fourth floor, and it does not seem to me that we are actually passing the smell test of this ordinance. And if we're not doing it, I have troubles with why we're even passing this when we talk mainly about businesses. We are just as good and just as bad as any other business. Why? Because we're trying, and it's not going to be 100%, but we are talking about others when we really should be looking at us first and how are we doing, because we should be leading by example if we're going to be setting up this type of ordinance. And I do not believe that we are leading by great example. And I hope that that will if this is passed, we are just as equal in being a subject to this law as anyone else. And I want to make sure of that, because that is not a good way for us to move forward if we are not treated the same.
Okay, thank you, Supervisor Sabatier. Supervisor Brown, did you raise your hand?
I didn't, but I would like to follow up now that you've brought that up. I want to know about the enforcement. Who's in charge of this? What department is in charge of it? The public needs to know what tasks they'll be taken away from in order to accomplish this, and who's actually going to be the enforcement agency, the officers that are going to be going out and enforcing this.
Mr. Chair, I think I can speak to that conceptually.
Okay, go ahead, Carol.
Staff has not been able to put absolute plans in place until we had some sign that an ordinance would be passed. But the intention would be to use some of the CARES Act funds to hire some additional staff that would do this enforcement and would do so under the oversight of the public health officer. And so since this ordinance has some time before it goes into effect, we will have time to put that in place. But the intent is to hire staff that would be trained to do this. And as a parallel, it might be a little bit like the extra help staff that we have doing the enforcement at the boat launches. That's an example. So they would definitely need some training to be able to operate according to this ordinance. But we couldn't lay firm plans to do that given all of the stops and starts in these discussions and whether we'd have an ordinance.
And Mr. Chair, the ordinance itself lists the enforcement officer in Section 3, Health Services Director, Community Development Director, and any official designated by the board to enforce the ordinance, and their designees, of course.
Thank you, Anita, because that's what I was going to ask. It doesn't say anything in there about the, well, it does say public health officer, but it also says enforcement officer being the health services director, which is different from the public health officer, community development director, which is obviously different, and any other official designated by the Board of Supervisors to enforce this ordinance. But I haven't seen, I know we've talked about it in private meetings about the CARES Act funding, but we can't hire staff, we can't fill the vacancies that we already have, let alone go out and hire more people just for the purposes of enforcing this. So I just, and I've said this before, and I'm going to say it, no matter if it passes or not, if it passes, you're creating an expectation that is unfulfillable. And I think not being able to admit that is a sign of weakness. It's not a sign of leadership or strength.
Supervisor Sabatier?
Yes, it doesn't specify in this, and I'm assuming I know the answer since this is under the guise of public health, but does this include the county using code enforcement officers in city jurisdictions for compliance? And have those cities been spoken with about this?
This ordinance doesn't directly speak to that. Actually, it could, but I was aware of the fact that both cities presently already have their own citation ordinances.
Yes.
That's correct. The cities have been enforcing compliance for quite a long time.
And frankly, given the time frame, it was impossible to be able to check with them. But since they had something in place, they had already taken action.
Okay. Thank you.
I did see, okay. Any more discussion from the board?
Mr. Chair, if I may, just in terms of actions, if your board decides to go forward, the first action would be to move waiving the reading of the ordinance as amended, and assuming you want the amendments that I suggested. If not, then you wouldn't use those two words. Mm-hmm. And then I have the ordinance read in title only. If that motion passes, then there'd be a further motion to advance the ordinance for a second reading on the next Tuesday, which would be the 18th, sir.
Okay. Thank you for that clarification.
As we get into that, I just wanted to, answer.
Supervisor Brown?
I wanted to follow up with something that Carol said. I would like, just to satisfy my own curiosity, I'd like to see exactly what the cities are doing, because I'm under the belief that they're not doing that. So I don't know where that information is coming from. I know that the city of Clear Lake publicly announced some time back that they weren't enforcing this, so I don't know if something new has happened, and I'm not aware of any enforcement at all in Lakeport, so maybe somebody could bring that back at another board meeting and fill us in on what is.
Oh, I didn't, Mr. Brown, sorry, I didn't say that they were enforcing, I just simply said they had each had an ordinance.
Yeah, I
for
thought Carol said that,
administrative
maybe I
citations.
misheard, I don't know.
Yes, I'll absolutely recheck with them. But I know this came up in discussions a number of weeks back when there was a conversation about an earlier draft version of the ordinance.
Yeah, and the conversation came up during the reopening meetings, and I know Margaret is gone now, but I know Margaret was in those meetings, and also and we had the cities with our reopening committee. I think is where the discussions came up.
Okay, that still doesn't answer my question as to what they've done. Talking about it, we've all done a lot of talking about it, but not a lot of action. So I'd just like to see what their action is that they've taken.
Okay. All right, any more discussion? All right, Supervisor Crandall?
So I understand this decision is not going to be very popular either way it goes. However, this ordinance has a lot of compromises. I'm thankful to be able to work with both sides of the spectrum on this. I value that I could commonly do that. It's not always about winning. It is about compromise for the greater good. When we brought this up the first time, I stated only bring it back in order to ensure businesses can stay open. Us putting enforcement in order gives credence to compliance measures that we talk about funding. And I know that it's been looked at in a way that sheds a dark light on funding, but the bottom line is that the county needs this funding. This is not political. It's about health and safety of others. It also gives the opportunity to keep close local control reins. That is something this board has always advocated for since we've been dealing with this pandemic. So I'll move to waive the reading of the ordinance with the additions made by the county council.
Second?
And to have it read in title only.
And to have it read in title only.
Thank you, sir.
All right, there's a motion and a second. Johanna, can you please call for the roll call vote?
Yes. Supervisor Sabatier?
Nay.
Okay, Supervisor Crandall?
Yes.
Supervisor Scott?
Aye.
Supervisor Brown?
Hell no.
And Supervisor Simon?
Hell yeah.
Thank you.
With that, I offer.
I'm sorry, sir. The clerk now needs to actually read the ordinance in title.
Okay, let me make sure I have the right one. It's the first
How about
attachment.
if it's okay, I can do it. An ordinance of the County of Lake to provide for graduated levels of enforcement of public health orders through education and training and the imposition of administrative fines.
Okay.
Now the motion to advance.
Motion to advance.
You're back on
Second
meeting.
that?
To the 18th, sir?
Yes, I motion to advance to the 18th.
Thank you, EJ. Is there a second?
Second.
Okay, Supervisor Sabatier?
Nay.
Supervisor Crandall?
Yes.
Supervisor Scott?
Aye.
Supervisor Brown?
Nope.
And Supervisor Simon?
Yes.
Thank you.
Okay, thank you very much. We're moving on to our next. We have not had a lunch break, and I know it's dragged on here for a while. We'll ask the board, would like to take a 30-minute break and come back, or try and push through?
I think staff needs the time off.
Yeah, I would agree too. So let's go, let's check the exact time here. Let's say, let's just say we'll reconvene. I know it's a late day here. We'll reconvene at 4 p.m. finish our other agenda items. We're going to take a lunch break and be back at 4 p.m.
Thank you, Chair.
3, 2, 1, we're go.
The
We need
chamber
the
room.
boardroom view up, the boardroom view. There we go.
Okay, there we go, Bruno. Excellent. Okay, we're going to go ahead and reconvene the meeting, our August 11th meeting, Lake County Board of Supervisors at 4 p.m. I know we've had a long agenda and other things, and I know that what I would like to do, and Carol, you can make sure this is all good by the technical aspects of things, but what I would like to do is go to our closed session item. I would like to address that first, and then we will come out of closed session and then address our last 3 items, 7.1, 7.2, and 7.3 that we have on our agenda. The reason, just a timing issue that, it's a very important issue that was asked by the supervisors. We put it on the board here. And so what I would like to do is go to our closed session item.
And Mr. Chair, the tech team is advising me that the most effective way to do that is to put those that are participating in a private room, and Jake will facilitate that as soon as you give the heads up. And then this room will remain open for people that are waiting for us to come back, and hopefully that would take place in about a half hour or less.
Okay, excellent. So just for you, the folks that are on the line, our constituents, we are going to go into closed session. So you're going to be put into a room probably for 30 or 40 minutes. Hopefully it'll be shorter than that, but we have one item we're going to take up, and that is item 8.1, conference with legal counsel, threat to security of public facilities and delivery of essential services pursuant to Government Code Section 54957. And so I know it's been a long day, but this is an issue we want to get taken care of in closed session. So we're going to go into closed session at this point. When it is over, we will come out and we will continue on with item 7.1, 7.2, and 7.3 once we are concluded with our closed session item. So I don't know what that process for Jake is, but let's move to our 8.1, our closed session item at this point.
Okay.
Go for it, Jake.
All right, I'm going to move you all to the breakout room.
All right, then, let's go ahead and we're going to go ahead and come out of closed session. Was there any action to be taken out of closed session?
No action taken in closed session.
All right, we're going to go ahead and finish up our agenda today. We have item 7.2, consideration of a recommendation for the formation of our Economic Development Task Force. I know that we concluded our 4 workshops, and we talked about bringing back a task force to set this up. And in your memo that you had all received, what I would like to do, I don't know if we need to put that up on the board, but we brought back a recommendation for forming the task force, the proposal for the...
There you go, Mr. Chair. Is that okay?
Thank you. Thank you very much. Yeah, absolutely. So for formation of the commission, recommendation is for 3 individuals to be on it. Moke Simon as the appointee, EJ Crandall as the appointee, and also Supervisor Shabate as an alternate. And the consideration on the formation of that task force was obviously to really address the unincorporated areas of the county, which is under our jurisdiction. And obviously, with Supervisor Sabatier, we know he is enthusiastic to be part of this project also. But we looked at that as to be an alternate at this point, and really focusing on, the outlying areas of the county, which are the unincorporated areas, which we are controlled over, and also a representation of continuing terms, which myself and Supervisor Crandall are at this point. And then at the end of the year, with the formation, as far as this, we can adjust the appointments at the start of each year, just as we do with our other committees that we're on. And obviously, looking at quarterly reporting coming back to the board. The second part of the board is What we really looked at, the departments that we feel are some of the major drivers for economic development in the unincorporated areas of the county. Obviously incorporating everything, but really focusing on the unincorporated areas, which would be the assessor recorder, Mr. Richard Ford, community development, the interim director, Scott DeLeon, county administrative office, Carol Hutchinson, public works and water resources director, Scott DeLeon, and special districts administrator, Jan Coppinger. So that'd be the makeup of the board. And the recommendations of the board and department heads represent the core members who will drive the priorities and the process of the task force. However, each of the department heads appointed to the task force would also be requested to include their key staff as regular participants to help support the task force. Additionally, other departments will be called to task on topic-driven basis as we move forward to really look at trying to implement some of the economic development projects we'll be working on. The administrative office will support the task force in terms of dedicated staffing and scheduling, meeting minutes, and report preparation. Initially, it's recommended the task force, we report quarterly back to the Board of Supervisors on progress. Actually, the first initial meetings will be really to set out short-term, long-term goals and then the progress. And then the primary focus of the task force will be strengthen county operations, building sufficient revenue streams, unifying efforts among departments, providing services to drive our local economy, all intended to lead to improved customers' outcomes for our communities and enhance quality for the citizens. And ultimately, the long-term goal of where we're going for the future in the county. And, ultimately, I know there's going to be some discussion that happens here. I think that the formation of this task force has really been led by, our long-term vision and also the opportunities that we believe with the short-hanging fruit that can be taken care of to just obviously give the individuals that we're serving, our constituents, easier ways to pay for anything and, just like you said, technology and other stuff. So that's the recommendation that I bring to the board today. We brought it, 2 weeks after, 2 weeks after, I think it was 2 weeks after, 1 week after the workshop, forgetting the dates right now. But that's what we'd like to, that's what I'm presenting to move forward with as far as the formation of the task force and moving forward with it. So go ahead and open it up to the board. Questions, comments? Am I on mute? Was I on mute the whole time?
No, we hear you. We hear you. And so when would these start? When would these meetings start? Probably like this month or so, or
yeah,
as soon as possible.
Yeah, we can get approved today. We definitely as soon as possible. Supervisor Scott?
I don't have any questions, just I'm excited to be moving forward with this and to the formation of this this group. And I know that great things are going to come from this. And I know our Vision 2028 is all about making sure that we're moving in the same direction. And I think this is a very needed piece of this.
Okay, any more questions or comments at this time from the board members? Okay, seeing none, we'll go ahead and open it up for public comment. I don't see, I do, yes, I see one hand up here. We'll go ahead and go to Johnny. Jake, I have that hand up.
Yes, Johnny, I sent you a mute request. Will you please confirm your first and last name?
Johnny Garcia.
Thank you, we can hear you.
Okay, so can you just, what exactly would Bruno's role be as an alternate? Is he going to attend all meetings, or, I mean, his role, can you specify on that a little more, just so I understand?
Bruno's an alternate. Bruno is an alternate to, if one of us board members, myself or Supervisor Crandall can't make it, it's how we have set up across the board for many different of our committees. I think one specifically would be LAFCO. LAFCO has 2 appointees and alternates, so would participate when one of us are not available.
Okay, so it would only be if you or Crandall can make it, then Bruno would step in. doesn't it? I mean,
Yes.
I was gonna actually offer something as well for that.
Okay.
What I was gonna say is that go ahead, I'll let you finish.
How about we do the public comment and stuff, then when we bring it back for, if you have polls or something, EJ, would you entertain doing when I bring it back for discussion, final comments?
Yeah.
Okay.
I was just gonna explain something again.
Okay, excellent. Did that answer your question, Johnny?
yeah, I guess it did. And what's the reason for that? What's the reason where he can't be there? I mean, why is it only two in charge?
Brown?
Yeah.
It's the Brown Act.
Okay. Okay, yeah, that answered my question.
Okay, thank you, Johnny. Okay, I don't see any other hands up on this item. Jake, can you just open up the room?
Yes, I will unmute the Zoom room here. All right, the floor has been unmuted. If you'd like to make a comment, please state your first and last name.
Okay, hearing none, we'll go ahead and bring it back to the board.
All right.
Or actually, we'll bring it back to the board chambers. Is there anyone in the chamber that would like to make comment on this item?
No public comment on this item at this moment in time.
Okay, thank you. All right, then we'll go ahead and close public comment and bring it back to the board for action or discussion. I apologize. Go ahead, Supervisor Crandall.
Yeah, no, I was just gonna explain for Johnny too, that Bruno, myself, Tina, the whole board, we're all on different committees and whatnot and as alternates. And at times, I know that we have a lot of conflicts. That's why I was asking when we meet, what dates it would be, because there's times also where we're doubled up on different meetings. So it's more than likely Bruno will be at a meeting that I can't be at or whatever. It's just like this. I think it's this week with RC where Bruno's taking over on that, where I have a conflict meeting. So he'll be actively engaged, and so just be rest assured that Mr. Garcia.
And some of our first meetings, obviously, is figuring out a date that does work without, obviously interfering with all of our other committees that we set on as we move forward with that. So those will be things that are figured out right from the beginning, and obviously, like I said, checking calendars and understanding, when is the best time to meet. So today what we're doing is obviously looking for action to form the task force, get it started. And so if there's any more questions or concerns, anything right now, please go ahead and speak up. Okay, not hearing none, then we'll be looking to, if someone could, or EJ, or someone could pick up the motion, that'd be great.
Mr. Chair, I move to approve the recommendation of the formation of the Economic Development Task Force.
Was that a second, Eddie?
Name the members. You should name the members.
Oh, you should name the members, Tina.
Supervisor Moak Simon as appointee, EJ Crandall as appointee, and Bruno Sabatier as alternate. Assessor Recorder Rich Ford, Community Development Interim Director Scott DeLeon, Community Administrative Officer Carol Hutchinson, Public Works Water Resource Director Scott DeLeon, and Special Districts Administrator Jan Coppinger.
Okay, second, you still second it?
Yeah, second.
Okay. All right, Johan, did you have a question, EJ? I mean, Bruno?
No.
I do have a question.
Bruno had his hand up right there when things were going on. Go ahead,
I
Bruno.
appreciate you noticing that. I do have a question, and I'm just wondering, I know that you guys have a lot of flexibility. We have a lot of flexibility within committees. Will you be possibly reaching out to the public to see if there's some expertise that you can bring in rather than just using knowledge, effort, and experience from those within our agency? Because I think we have a lot of opportunities, whether there's some retired ex-CEOs that are in the area that have managed large development, large enterprises, and found success. And I'm just wondering if the way it's written, if it allows for that, or if we need to have a discussion, if the rest of the group feels that that would be a useful part of the Economic Development Task Force to allow for that to happen.
So I guess to answer the question, what we thought as far as economic development for this task force to begin with would be to look at setting up with our internal folks on what's going to drive the revenue here in the county. And then obviously as it grows, I think those are conversations we need to have down the road once we can really look at some of the internal things that we can work on as we work through that. So I think on our quarterly reports as we come back, I think that's definitely, if that's the direction we need to grow, I think we need to be open to those opportunities down the road, but allow us to get us established internally here to work on some of the things that are lower hanging fruit in the beginning.
Okay, just wanted to bring it up because I think it's important to make sure we have a open dialogue, not just with ourselves, but with the community as far as what is anticipated of the future of Lake County. So appreciate it and looking forward.
Okay, so there is a motion and a second. Johanna, can you do the roll call vote?
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Yes.
Supervisor Scott?
Aye.
There's no Supervisor Brown and Supervisor Simon.
Yes.
Thank you.
All right, thank you very much, board. Excited to get that started. Thank you. Item 7.3, consideration of a resolution authorizing a joint application by the County of Lake and the Elijah House Foundation for the California Department of Housing and Community Development Home Key Grant Program. And I see here is Todd Metcalf, our Behavioral Health Services Director. Go ahead, Todd. Still on mute. Jake, can you unmute Todd?
There we go. All right. Well, good afternoon or almost good evening, Mr. Chairs and members of the board. My name is Todd Metcalf. I'm the director of the Behavioral Health Services Department. So today, this resolution before you is to approve a joint application to apply for California Department of Housing and Community Development funds. These funds are the extension of Project Room Key, which I know you've heard about, which now has turned into Project Home Key. And the purpose of these funds is to isolate individuals experiencing homelessness during the COVID-19 crisis. This will be a partnership agreement between the County of Lake and Elijah House, which, as you may know now, is currently operating the temporary COVID-19 shelter at Old Juvenile Hall. If our application is accepted, Elijah House will purchase and refurbish the Starlight Hotel Resort over in Glen Haven. Anticipated capacity, as I mentioned in the memo, maximum is about 26 individuals, which I believe will, positively impact the variance that Dr. Pace talks about as far as being able to house individuals in our county during the COVID-19 crisis. Elijah House will own and operate the facility and will also report and execute all grant deliverables. The County of Lake, Behavioral Health Services will just act as a fiscal sponsor to pass through the Project Home Key funds, along with offering and providing fiduciary oversight to Elijah House as they, navigate through this and operate this facility. I believe if awarded, this would be yet another positive step in solving issues around homelessness in our community. I believe last week, Crystal Marquitan brought a similar proposal to the board. And in my state call with the Department of Housing and Community Development, they were very excited that there was more than one proposal in the works to go after these funds. So, it's not competitive. I'm just excited to be a part of this. Elijah House approached me not more than a week and a half ago and said, "Hey, we want to go after this. And they needed a government entity such as my department to partner with them to go after these funds. So I think it's a win-win situation. So I'm asking the board to adopt this resolution for us to at least apply for this Project Home Key funding.
Okay, thank you very much, Todd. Go ahead, Supervisor Scott.
Thank you, Todd. I know this was not an easy turnaround to do all this work and now get it in front of the board. So I just know that we really appreciate you. On the call that I wasn't on your call, but I was on the other call that they said that we would need to say what grant we were offering first. So is this going to be the second one that we would want to, if they were only going to give us X amount of dollars, they would fund the first one and then this one, or how is that going to be set up?
I believe you're correct there because the original proposal, I believe, is $6 million. This one is $4.7 million. But from what I'm understanding from the state is if we can get our application in before August 13th, which is sort of a soft deadline, that there are more monies available. They said, oh, we can apply afterward, but after that, it's basically it's a first come, first serve thing. So I'm fairly confident that both projects should receive most, if not all, of what we're asking for. I may be overly optimistic, but that was the impression I got on my call with the state just last week.
Thank you, Todd. And it's great that Lake County is going after this funds because I know we've left so much money on the table. So this is great that we are doing this and we have the opportunity. Thank you.
And that Elijah House, as we've talked about before, I mean, they want a presence here in the county. They specialize in substance use disorder services and mental health services, which would be a great complement, to the services that my department provides. But also in working on, they're wanting to create more of a permanent supportive housing facility. This could be it. So. Basically, again, all I'm asking for is the board's permission just to apply for these funds. And once we get them, I hope we do, then you'll hear more from me. But that's what I'm asking is just your permission to go after this.
Thank you, Supervisor Scott. Thank you, Todd. Supervisor Sabatier?
Yeah, thank you. We always hear from you, Todd. That seems to be a weekly thing. There's so much going on in behavioral health that there's always some kind of program or some kind of funding that's become available, and I appreciate that you go after it. The thing that I see as the good news is we're looking at rehabilitating a currently vacant building, offering opportunities that aren't currently being offered, and in addition to the $6 million that we could potentially get from the first one we did last week, this would be an additional $5 million potentially, where there's the maximum amount of $11 million being put into our community for programs that are absolutely needed. So I see this as a definite win. I just hope that there is some sort of what's the word I'm looking for that's oftenly used for grants, but how to be self-sustainable in the future, other than always relying on these grants for the future of the programs, because these are programs that are going to be very important to change, and if they only happen for a moment and then disappear, that actually might be more detrimental. So I sure hope that some of these funds will be available for a little longer so we can find that sustainability model, but I'm also very hopeful and super happy that Elijah House wants to do some work here in our county, because we're going to benefit from that.
And thank you for that, Supervisor Sabatier, because that's where I believe the sustainability piece is going to come from Elijah House. I had met with them earlier this year because they had wanted to open a sober living facility here in the county and couldn't quite figure out where that would be or what that could be. This, I believe, is their opportunity. That funds are coming to rehabilitate an existing facility, and that once it's done, they will be able to continue carrying on those activities in this facility. And the location, I think, is somewhat ideal because it's over in Glen Haven. It's I have a peer support center in Clear Lake Oaks, and then our clinic.
Oh, we lost your volume somehow, Todd.
Oh, sorry.
There you go.
I think the location is good because it's in between a couple of our facilities that, folks that have, mental health issues and substance use disorder issues would have that accessibility to either our office in Clear Lake Oaks or Lucerne. So I see this as a win-win.
Excellent. Yeah, well, Todd, thank you once again for bringing something that's going to be beneficial to everybody and our most vulnerable in this community. So thank you and everyone else that's worked on this throughout the project. But I know this is just the beginning. We've got to be successful. So we'll get the support today and go on from there. Supervisor Crandall?
Yeah, no, this is awesome. And with the amount of folks that are homeless in my district, this is going to be a benefit. And that's the question I was going to ask is this for people like that, or is this for people that are already kind of housed in one of the homeless shelters and then will be moved here? I just kind of wanted to get a better idea or even get that explained, while we're online with the public.
Well, right now, the funds are just tied to COVID-19 activities. So as you know, Elijah House is running the old juvenile hall. They're taking care of those operations there. So then this would sort of be in addition to that. But moving forward, I can see that there should or will be other funds to keep it going beyond COVID-19, because Elijah House has assured me that they already had the funds apparently available to open a facility here. This is just going to give them a big jump start to set this up and establish something in the community. So I think it's great.
Excellent. All right, any more questions? Any more questions or comments from the board? Okay, we'll go ahead and open this up to public comment. We'll go ahead and open up the room. I don't see any hands up, Jake, so let's go ahead and open up the room.
All right, I will unmute the Zoom room here. The floor has been unmuted. If you would like to make a comment, please state your first and last name.
Okay, hearing none, we'll go ahead and close the room and we'll bring it back to board chambers. Is there any public comment in the board chambers?
I do not believe there is any public comment in the board chambers.
I wouldn't think so. It's been a long day. Okay. All right, we'll go ahead and bring it back, close it down and bring it back to board for action.
Chair.
Oh,
Go ahead, Tina. Good.
Mr. Chair, I'd like to offer the resolution.
Okay, the resolution has been offered. Johanna?
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Yes.
Supervisor Scott?
Aye.
And Supervisor Simon?
Yes.
Thank you.
Okay, Todd, thank you very much.
Thank you. Stay tuned, more to come.
Okay, we'll move on to our final item on our agenda today. And that is our weekly calendars and travel. It's item 7. Go ahead and we'll start with Supervisor Sabatier.
Yes, thank you. On tomorrow, I will be doing the RCRC meeting that starts at 9 a.m. Later on, typically, I know that Supervisor Scott takes care of the first 5, so let me know if you need me to be there at 2 o'clock. Other than that, I will be meeting with Supervisor Scott with the CEO of Adventist Health later on that day. Get an EOC update on Thursday morning. I will be joining the Mental Health Services Act meeting happening on Thursday morning as well on Zoom. Looks like we have, looks like I have a little bit of a conflict that popped up. We'll be doing a tour of a project site in the early afternoon on Thursday, but also have tax collector, treasurer ad hoc committee meeting over also at 1 o'clock. So I'll have to figure out how to move that around. And then later on that evening, CSAC call just to kind of get an update from the state as to what's going on. Going to be meeting with the new Dean Cortez of Woodland Community College, just to introduce and see what we can work on together in the future. What else is there here? I'll be meeting with our registrar voter as well. And nobody cares that I'm getting a haircut too, even though that'll be wonderful. And then I'll be back on Monday for another EOC meeting and meeting with our CAO. It looks like we actually don't have multiple meetings one on top of the other, but maybe that'll change. And another CSAC meeting on Monday, and then back here on Tuesday, the 18th, for another wonderful session.
Supervisor Scott?
Well, tomorrow is the first day of school, so I will be helping my children set up in the kitchen with their Zoom classes. We're waiting tonight, I guess after 5, so they didn't post it. We'll see how that's going to go tomorrow, having 4 of them go to school in the kitchen. And then I have a meeting at 10 o'clock, technical assistance for mental health first aid. There's no first 5 tomorrow. The first 5 is actually on the 26th at 2 o'clock. They've changed the dates on those.
Gotcha.
At 2 o'clock, I have a task force for West Shore. And at 4:30, Bruno Sabatier for looking at our homeless issues that we have here. On Thursday at 10 o'clock, I'm going to the MHSA public hearing. 11 o'clock, I'm meeting with staff at the courthouse. At 2 o'clock, I'm going to be meeting with Vet Connect. They're looking at trying to come up with solutions to be able to have their stand down that they normally do in September. They're going to be trying to figure out how we can go about still doing that with all the protocols in place with COVID. And then Monday, I will be attending the Human Trafficking Conference that starts at 10 o'clock, and then back here on Tuesday.
Okay, thank you, Supervisor Scott. Go ahead, Supervisor Crandall.
Yeah, so tomorrow in the morning, early morning, I have a constituent niece that's having issues in the area where Pile Road seems to be a big problem. So I want to check out this red tag and meet with the guy. Also in the evening, I have some constituents in Clear Lake Oaks that are having issues with another red tag. So I just want to get a look at them before I start making contact with others and seeing where we're at with them. So just a couple meetings there. Thursday, a constituent in Upper Lake that I'll be meeting with. Friday is the WANB meeting, Workforce Alliance of the North Bay. And Monday, COVID recovery at noon. And do we have risk reduction? I seen it was put on our calendar and then taken off. So I don't know if it's Monday or not.
No, it is Monday.
Okay, so we have that, right. So we have that. And then probably a call with Carol afterwards. And then I'm back here Tuesday.
Okay, thank you very much. Obviously, after today's meeting, I have agenda review. The 12th, which is tomorrow, just obviously returning phone calls and talking with constituents down here in the South County. Usually that would be an evening meeting, but now with COVID, that isn't happening. On the 13th, I have the EOC call in the morning. I did have on my calendar too, the MHSA public hearing. I know 2 supervisors are going to that, and I think I can join just on the hearing part of it. And then also have that evening, we're doing our second virtual math meeting, our Middletown area town hall. So we'll be doing that. And Friday, I do have the Workforce Alliance in North Bay at a different, what time do we have that on Friday? EJ, is that 1 o'clock?
I did 1:30.
1:30, yeah. So I have that one on Workforce Alliance North Bay. On the 17th, have obviously the EOC call in the morning, the recovery group at 12 o'clock, and then risk reduction authority meeting late in the afternoon, and then back here on the 18th. Also, just for South County residents, I want to say that the Redwood Food Bank will be doing a food bank giveaway. They've established that now, in the overflow parking lot at Twin Pine Casino. It is from 9:30 to 11. That is open to all. in the South County area. This is the second month they've done that. I just want to announce it just in case anyone out there hadn't heard about it. So, and I want to thank the Redwood Food Bank for setting up there in the parking lot and doing that. They served 270 families last time, and they're hoping to do over 300 this time. So please, and it's open to all for that event. So, okay, other than that, that will conclude my calendar, and we'll see you on August 18th next week. Thank you, everyone.
Have a good evening.
And so those of us that are staying for agenda review, please just stay in here if you would. Thank you.
Okay.